in order to give absolutely evidence-based information as to where the challenges are in terms of education and how we develop the best policies in order to deal with that. And we're working with the Education Endowment Foundation, as well as the Sutton Trust, as well as doing our own internal work in terms of how we put in resources that are going to best able to help children to be able to recover and make sure that they get all the resources that they need in order to get the best education.
You mentioned the laptop scheme, which is a great scheme, and I'm sure that lots of parents and schools will be thanking you for that. But does the department know how many disadvantaged learners are not eligible for the free laptop scheme, and what are your plans for those particular individuals?
Sorry, could you repeat that question again?
Yeah, does the department know how many disadvantaged learners are not eligible for the free laptop scheme, and what are the plans for those individuals to make sure that they have access to some kind of online learning?
So the reason that we'd established the laptop scheme was because we're conscious that there are certain people at critical moments of their education where they were going to be facing challenges in terms of exams in the near future. We needed to put those that resource in place. So as a first priority, we wanted to get that resource to them. Obviously, we're looking very closely as to how this is going to work, and if it works well and if resources is used in making a big impact in terms of those children's learning, it's something that we'd like to look at. Is it something that could be expanded? Is it something that's worth expanding? But we wanted, this is a pretty substantial trial of an investment of £100 million, but we wanted to make sure that this has the real impact that we're expecting and hoping it does.
In terms of vulnerable children, there are some charities and organisations like the Safeguarding Alliance who say that there are new vulnerabilities that are being found. There's a new frontier of vulnerabilities in terms of affecting children being affected by mental health, children who have access to potential serious online harms. Are you assessing those kind of different vulnerabilities that may emerge, even though they may not be classed under existing list of vulnerable children?
We absolutely are, and this is something that we've been working very closely with the Home Office and the Home Secretary on, in terms of looking at a whole range of different harms and vulnerabilities that children may be exposed to. And we've sadly always seen in times of crisis, sometimes the predatory behaviours emerge and people using the crisis in order to be able to exploit children. And this is why the work that we've been doing with the Home Office is so vital. And I'd like to pay tribute to both the Home Secretary, who has driven this incredibly hard in terms of all the work that she's been doing in the Home Office, working with social services, but also working with schools. And you've got a very high level of collaboration about how we're trying to tackle some of these increasing dangers that we may actually sort of...
Just to go back to what I was saying, does the DfE have a clear picture about exactly what's happening to vulnerable children who are not attending school? And are you satisfied that those children who are not attending, that there are adequate measures in place to ensure their safety?
Well, this is why you've seen a lot of work through social services, but also working closely with schools, making sure that there's regular contact with those children. Just because they're not in school doesn't mean to say that the work that social services are doing isn't incredibly far-ranging, to making sure that they're constantly working with those children, working with those families, making sure that they have the support that's needed. But we recognise that actually the pressures in this area are actually grown. This is why we took the measures to increase the number and pool of people that could come back into social services work. We extended that pool by 8,000. I'm pleased to report to the committee that over 1,000 social workers have come back into the service in order to help us at this quite extraordinary time.
We talked about the digital divide. most homes, 95%, have a TV station. Have you had any thoughts about perhaps working with the BBC or other broadcasting services to provide a long-term national education service on television that would broadcast a few hours a day and people could access through a red button what year they were in? So those children who don't have access to computers would at least be able to get an education at home if they're not attending school.
This is something that we have been working very closely with the BBC on, and I've had a number of meetings with Director General of the BBC, Lord Hall, in order to discuss this exact issue. And if I can take the opportunity to thank the BBC for launching the largest ever education programme that they've had in the corporation's history, recognising the point that people don't always have a laptop or a sort of some form of sort of a tablet in their home, and recognizing a TV is a great way of doing that. We've been working closely with the BBC. They've got an extensive programme. We are always very keen to see how we could make that a more extensive programme. And recognizing the fact that most people have a TV in their house where they're not necessarily going to have a computer. But if we are in a position where we could do more with the BBC and the BBC is able to make more available, we're incredibly keen to do that with them. And we've been providing them with guidance as to how best to do that, and also making people available who can best be able to guide them and put the best resource on TV for children.
And as we move, hopefully, towards the aftermath of this awful disease, we've talked about the according to the Sutton Trust. Do you support the idea that I floated and provide extra Jewish and extra mentoring for these disadvantaged or vulnerable peoples who may not have attended school one way or the other and may be way behind, and perhaps that catch-up premium supported by a nationwide network of volunteers, of graduates, of retired teachers, of perhaps Ofsted inspectors who may have a lot of them are former teachers who may be able to join a volunteer scheme in the way that the government has done with the NHS volunteer scheme, helping existing schools, supporting vulnerable children, both at the present and in the aftermath of this disease.
Mr. Chairman, I do apologise. You froze at a number of points during that question, but I think I got the gist and thrust of it. But if I don't sort of touch upon any particular point, if you could maybe come back on that. I'd like to think that we're actually a bit ahead of you in terms of you've talked about the catch-up premium. We actually recognise that we need to put in a whole set of different measures to help all children, and this is why we've launched the Oak National Academy. This is why we've started to put more resources online. This is why we're working very closely with schools to actually start looking at how we can sort of plan resources best in the future to make sure that children from whatever background they come from are helped. But there is a particular issue with some children who are most disadvantaged. And why I say that I'd like to think that we're sort of getting a bit of ahead of what you were suggesting is the fact that we're already making that £100 million investment in terms of IT equipment to reach out to some of those most disadvantaged children. We're also very closely working with the Education Endowment Foundation about the concept of pilots, about actually how best we can do targeted support for some of those most disadvantaged children. And we've set up a whole stream of work about how, in terms of recovery from this, how we can pick up some of those children who are most disadvantaged, how we can put in place those interventions that will ensure that they don't suffer any form of educational disadvantage, how we can help them. But what we do on that, I want it to be very targeted support that makes a big impact in terms of those children who need that.
And would you consider this being, I mean, are you considering a nationwide volunteer scheme of former teachers, of perhaps some Ofsted inspectors, of graduates to help schools mentor and provide tuition for left behind pupils?
Well, we're discussing it, and we're doing quite a considerable amount of work on a whole different and range of aspects of policies. Those policies are not yet ready to be launched. When they are, obviously, we'll be sharing that with the committee. But we are looking at different ways about how we can use the enormous volunteer army of people that have come forward, many of with past educational experience, many of with an awful lot of knowledge in specialist subjects. We've been working incredibly closely with Ofsted, who have been incredibly important in terms of supplementing and working with the department in order to support many different aspects of education. So we're very open to these ideas, but we've got a whole train of different pieces of work as to how we can support pupils. But at the moment, coming to this committee, I'm afraid I'm not in a position to be able to announce what those policies are going to be.
And do you have a date when the schools will open?
Apart from obviously what we've already announced in terms of the digital £100 million investment that we've made. Sorry, Mr. Chairman, I didn't mean to. Did you ask me as to whether we'd got a date as to when schools will open? Yeah. We are working very closely with the whole sector in terms of actually when is going to be the best time to bring schools fully back into operation. We have set out 5 clear tests as to what's incredibly important and what will inform the opening of the schools. We want to make sure that schools are given proper notice, but we do not have a date as to when schools are going to be opening.
Do you imagine when they do open, it will be in stages? And would you favour primary opening first or secondary schools opening first?
This is obviously something that we are giving a great amount of thought to, and we're giving a lot of consideration. Just a couple of weeks ago, I commissioned SAGE to set up a subgroup to look at the particular issues of opening schools, making sure that when schools are open, it's done in the best possible way with the very best scientific and medical advice. And we expect SAGE to reporting back, and the information that we get from SAGE along with Public Health England will be the key parts of what informs us to how best we open schools. But I do expect schools to be opened in a phased manner. I also intend to be giving schools as much notice as possible in order to be able to ensure.
And should they open in the summer holidays to help left behind?
We seem to have lost the chairman now. Are you back, Robert? You froze there.
I'm here. Yeah. Yes, I am. Yeah. Should we schools for left behind pupils?
Mr. Chairman, I think you're asking as to whether we are planning to open schools during the summer, and we're not planning to run schools through the summer. But as I was talking about earlier, what we are doing is we're looking at a whole set of interventions to help children both catch up in terms of their work across the whole broad setting of children of all backgrounds, but we're also looking at different interventions that we can make in order to be able to help children from the most disadvantaged backgrounds.
Okay, my final question, just before I pass to my colleagues, is we know that support staff are often the unsung heroes of the lockdown, and without them, none of the schools would be able to remain open. The government's guidance says that PPE isn't needed in most cases, yet acknowledges that social distancing is harder to maintain in education settings. And what's the scientific basis for saying that most teachers or support staff do not need PPE?
Mr. Chairman, do you mind repeating the question, because I think it sort of blanked out at possibly the most important part of it.
Yeah, so the government's official guidance says that PPE is not needed in most cases, and yet acknowledges that social distancing is harder to maintain in education settings. How is the government reconciling these two positions, and are they contradictory? And what's the scientific basis for saying that most teachers or support staff do not need PPE?
Well, as you can imagine, we turn to Public Health England in terms of actually giving us the very best advice in terms of protecting both for workforce and also for children. We've constantly asked them for guidance as to how best to deal with both school settings, both primary and secondary school, but also special schools as well. And at every stage, when we're looking at, as we reopen schools in a phased manner, the reason that we commissioned the SAGE subgroup to look at this is to make sure they're giving us the best scientific advice. And then as we're opening schools in a phased manner, we'll make sure that we're consulting with Public Health England to make sure that we're getting the very best advice in terms of protecting children and in terms of protecting staff.
Thank you. I'm going to bring in very quickly Tom, Ian and Jonathan, then pass over to David Symonds because they have questions. Tom first, and Fleur. So just some quick questions from them, and then we'll pass over to David. Tom.
Good morning, Secretary of State. I just got it does concern me that the rates of the Sutton Trust findings in terms of the percentage of children who are every day logging into these online lessons, and how I think it's about 17%. Is the level for some of those from a disadvantaged backgrounds. I have spoken to a couple of head teachers who have actually had very high levels of participation every day, and one of the things that they do is have a live roll call every morning, and they make it so that the children have to register for every class, and if they don't, then they call the parents. It seems to be working quite well there. I just wanted to know what the Department for Education guidance is to schools regarding registration, roll calls at the start of the day, and whether you think that could lead to higher attendance at the moment during COVID.
Of course. Tom, I think that's a very valid point, and it's what we've been trying to do in terms of putting out more and more guidance to schools. It gives them a greater sense of what is actually working, and we've been working with a lot of schools right across the country. I mean, the reason we created the Oak National Academy was actually to give a very structured form of learning that anyone would be able to access. We're very keen for schools to do everything they can do to be engaging with their pupils, to giving them a sense that education can continue in a different way as to how it would be in school, but sort of giving children as much structure as possible. And there's some brilliant examples, but how we get those brilliant examples and scale that up across the country is something that we've been attempting to do by sharing more guidance and a greater sense of what's working, how it can work, and helping schools to deliver that.
Thank you, Jonathan. Jonathan, are you there?
Oh, thank you very much, Chair. Thank you very much, Secretary of State, and I wish you and your family all the best, and obviously during this crisis. Coming back to the Chair's point regarding the kids going back over the summer holidays, my great fear, and I'm sure that of yourself, is that Year 11 and Year 13 especially missed out on a crucial learning of what it's like to sit an exam and obviously be rewarded for what they've done, and they would have been away from school for such a prolonged period of time, especially the Year 13s. Obviously, we normally have the National Citizenship Service that runs through the summer break. Is there any way that we can ensure, especially Year 11 and 13 students, can do some voluntary work within the community to ensure that they're engaged and motivated while they don't have the academic pressure of an exam sitting over them?
Yeah. So if I could start off by paying tribute to, I know the amazing work that you've been doing with your schools in Stoke-on-Trent North, and obviously bringing your talents as a teacher to very much to use to support your constituents. A lot of this depends in terms of the scientific and medical advice that we get in terms of what we can lay on in terms of best supporting those children. I think there's a real challenge in a number of transition years, and you highlight those who are in Year 11 and those who are in Year 13. And we have particular concerns about children in those years who may not wish to exploit some of the further education education opportunities that may be available to them, either through further education colleges or universities. So we're looking at how we can do reach out work to them to make sure that they are aware of those opportunities. In terms of the idea of volunteering schemes, this is something that we would very much like to see, but we are a little bit dependent on the scientific and medical advice as to what can be laid on, what can be done. And I know this is something that the National Citizenship Service has been looking at very closely as to how it can be done. And in the department, we've been doing work to see as to, is there activities that we can be putting on through the summer for youngsters? It was looking slightly more broadly, not just at those particular two-year groups, not just in terms of helping them in terms of education, but actually putting them in connection with young people again after they've had this long period of social isolation.
Okay, Fleur, if you wanted a quick question.
Yeah, thank you. Good morning, Secretary of State. I just want to ask a couple more questions about the laptops. In my area, we're scrabbling around getting voluntary contributions of laptops, and some charities are helping, but we don't know when the rollout of the laptop scheme is happening. So could I just ask you again about what's the likely time frame of the rollout of the laptop and the accompanying data, which is proving even more important for many families? And also, is that just for England, or is it Scotland and Wales as well?
Firstly, it is just for England in terms of where we're doing the laptop scheme, as these matters are devolved to Scotland, Wales and Northern Ireland. In terms of a time frame, this week we'll be writing to all local authorities and multi-academy trusts to give them a clear indication as to what the allocations that they'll be receiving in terms of this rollout of digital equipment. And we expect the first laptops to be arriving at the end of May, with the majority delivered through June. We do not see this rollout of digital equipment to be something that is just to deal with the challenge that we're facing today. We see this as part of addressing the longer term problem in terms of actually helping children get what they need in terms of their learning as rapidly as possible over the summer period and going into the next academic year as well.
Thank you.
Ian.
Thank you, Chair. Good morning, Secretary of State. Regarding the potential for phased reopening or reopening of schools, many of our schools, of course, are still open. Here in Gateshead, I know of schools which are still doing what they're meant to be doing, and that is looking after the youngsters of key workers and youngsters with vulnerabilities and disadvantage. But the numbers are very low. I think the sort of numbers that we've heard talked about, 1% before Easter, and schools that I'm aware of about 3 or 4% of pupils actually physically coming in. Now, social distancing is absolutely possible in that sort of circumstance, but even on a phased return, we'd have to think about youngsters not being in school probably more than 25% of the roll at once, in order to have any chance of keeping the social distancing rules in operation. Otherwise, what we do know about the potential for asymptomatic transmission of COVID-19 could still be significantly a danger. And the guidance regarding what's required in schools regarding PPE and social distancing really does need to be updated, because the guidance that we've seen for the care settings has been constantly updated and moved on quite a lot since this whole business started. So we do need to think about that very, very carefully, Secretary of State.
Ian, I think you raise an important point, is when we enter the next phase of dealing with this crisis, and as we look at having a phased return of schools, we'll have to constantly look at how we update the advice and give teachers and those who work in schools, as well as nurseries and colleges, the very best advice in terms of making sure that they create a safe space. It is it is incredibly important that we get the right balance in terms of actually making sure that we create an environment that is good to learn in, but also that is a safe environment for people to both work in and learn in as well.
Okay, thank you. David, been waiting very patiently. Thank you.
Thank you. Good morning, Secretary of State. Very much echo your comments about how the sector stepped up to support children. Two questions about reopening and PPE. I've been speaking to a lot of head teachers in the constituency about what their plans are, and in particular, multi-academy local authorities looking at what they can do over the summer for catch-up. Flags two issues. The first is around the risk assessment for vulnerable children. SEND schools in particular have said they already have supplies of personal protective equipment for any child where they would routinely expect to need it. But some of those children have particular medical vulnerabilities, and they really want on the department's radar the need to do effective risk assessments, and that forms part of any reopening plan. So your view about that risk assessment process. And then the second issue, more generally about opening. A number of those schools and local authorities, multi-academy trusts have said they are already planning to open up for as much of the summer as they can on their own initiative. And they'd like really to have that engagement with the department so that in the context of the national plan for reopening, the department is aware and can factor in the plans which schools may themselves already be making to ensure that they can provide catch-up and support for children, especially the ones that they regard as vulnerable.
David, if we can pick up on lots of special schools, we've had to look very closely in terms of guidance that we've been issuing with them, and we've worked very closely with Public Health England, but also the whole sector to make sure that, because of the unique nature of the support that they're providing, is that we're giving them the best guidance as possible. In terms of return, in terms of these settings, is the knowledge that is contained in these schools of their pupils and their very specific needs is probably there is no one that has a better understanding of what that is, and we're looking very closely at how we can support those schools in terms of any return. As you yourself know, many of these schools have continued to operate, and we've been looking at different ways that we can support them to make sure that they continue to support the most vulnerable children in our society, and we'll continue to double up in terms of those efforts when there is a more general return. But we recognise it's going to be very specific advice that's needed for those settings, that is tailored for those settings. It's going to be quite separate from the general return for all of the schools. In terms of work that's been done, the department's engaged in a whole set of stream of works about how we look at helping those children catch up in terms of work that we recognise that they will probably have missed out. And we've already had a lot of engagement with multi-academy trusts and schools as to how best we can assist them in terms of supporting them in doing that. And that will be through a whole range of different activities, a little bit like some of the ones that you've yourself highlighted, but we're hoping to bring forward some of that thinking over the next few weeks and share that with schools and work in conjunction with them. And actually, most of the thinking that we've done is actually borrowing from the knowledge and the expertise of the school sector, who know better than anyone else as to how best to support their pupils in making sure that they're not disadvantaged from the weeks that they've missed in school.
Thank you. David Johnson.
Thank you, Chair. Thank you, Secretary of State. Can you say anything about the measures that you expect the department to use to make sure the disadvantage gap is not growing between the poorest children and the rest as a result of this lockdown?
Well, we've already highlighted the fact that we're sort of rolling out a digital programme. We're going to be coming up with a whole set of other actions to be particularly targeted. I mean, a little bit like the chairman himself was highlighting the fact that there'll need to be quite specific targeted actions at some of those disadvantaged children. This is very much what we're looking at doing, and looking at developing a whole set of policies that are going to be helping and supporting those children, to be ensuring that they don't fall behind in terms of their studies. But we mustn't forget that actually every child is going to have suffered as a result of not being in school. And we do need to have a whole set of actions that support the whole school population. There's going to be needed a very targeted approach at some of those from the most disadvantaged communities, and how we help them and how we give them that lift. As I say, the digital package, which is a £100 million package, was the first stage of that, but it is the first stage and certainly not the last stage. But I'm not in a position to be able to outline the policies that we're going to be doing, but we are very aware of what needs to be done.
I suppose I was, thank you for that. I suppose I was thinking, what will your indicators be looking at the performance of children to make sure that this is not having an undue impact? So I appreciate there'll be more measures that you take. What indicators are you going to look at?
Sorry, David, I think you raised an important point in the fact that actually the assessment programmes that we have actually put into schools over the last 10 years are an incredibly important part in making sure that children's attainment is continuously monitored, and actually that we're constantly looking at where they're falling, where if a child is falling behind their sort of year group, and making sure that action is undertaken. We're looking at a whole different range in terms of reading ages to see if there's actually children have been falling behind in terms of their reading age as a result of not being in the school environment. We'll be having to look at a whole set of different baseline assessments to make sure that we have a clear understanding of what children need. I think the teaching profession is acutely aware, and they, of course, hold so much of the expertise in terms of making sure that that assessment of children is made in terms of their return to school and what action is undertaken. But we'll be looking at supporting schools with guidance and advice as to how best to make those assessments, and working with them to make sure the interventions are put in place so that they don't fall behind.
And can I, just as a final point on this, can I encourage the department, if it's not already planning to pay particular attention to the destinations data for these cohorts that will be leaving, to make sure that we're not seeing a radically different set of destinations for these guys that we would usually see?
David, that is such an important point, and it's something that I've been particularly concerned about. And the Department for Education has some of the most developed data in terms of looking at young people's trajectories and where they go in life through the different stages of both education and work of any government department. But I'm particularly concerned about children from those vulnerable groups, because they've been outside of the outside of school or outside of college, that maybe they have not been pushed to seize some of the opportunities that are really open to them and that could be truly transformational in terms of their life. So we're doing a whole body of work about how we reach out to those children, make sure that they understand that these are great opportunities for them, whether that is through further education, college, doing different levels of qualification, or whether that is taking the opportunity to go to university, going to the very best university that we can encourage them to do.
Okay, thank you. Just before I bring in Ian on the free school meals issues, Caroline Johnson, are you there? Can you hear? Because she had a question. I'm just going to read out her question, if I may, Secretary of State. I would like to, she'd like to ask about guidance to schools on provisions for the curriculum, what guidance there are for children with no broadband access. She's suggesting that some children are not on broadband due to geography rather than finance, and these children would not be routinely be disadvantaged, but now are. And how are these children being picked up?
Okay. So, Caroline raises an important point, because there are parts of the country which do suffer from very poor broadband connection. This is why I think our shared passion, Mr. Chairman, to involve the BBC and really support the BBC and the work that it's been doing in terms of providing educational resource through the television is so useful and so important. We've also issued whole sets of guidance for schools and resources that actually, if children are suffering from no proper access to broadband, we'd be really encouraging for them to be able to share with children, to be able to sort of post out to them if they're not able to access broadband, broadband, to be able to access education resources. We've also, sorry, Mr. Chairman, but we've also, as part of our digital package, we've recognised a number of people don't have access to 4G. So that was why part of the package, quite a substantial part of the package, was about creation of a, distribution of 4G access for families, so they're able to access internet if they've not previously been able to do so.
Caroline, I think you can hear now. Is that okay? Is that right?
Yes, I can. So my constituency is particularly affected, I think, as a rural constituency by the lack of broadband. And one of the things that what concerned me about our meeting earlier in the week with the lady from Ofsted was that there was no review at all of the provisions that schools have been providing during this period. I wondered, I've heard from my constituents of varying packages, some of which are. And what guidance is your department giving to schools to support those children who live in rural geographies and don't have access to the broadband? I understand that you've got the BBC, but if somebody has more than one child, just having enough amount of time for the programme to go through the BBC programmes may not be possible. Many parents, many families don't have the opportunity to look at more than one channel at the same time in the house. Can you hear me?
I've heard, Caroline, I've heard elements of it. We've I think you're demonstrating some of the challenges of poor internet access, sort of very
sorry for speaking.
There are challenges. There are geographical challenges where we've been trying to build up quite a substantial resource base for schools in order to be able to access and in terms of guidance. I mean, obviously the internet is the easiest, most cost-effective, and also the most simple way of sharing things most widely. We do recognise that some schools will have sort of technological challenges in terms of being able to do that. That's why most areas of the country do have sort of good 4G connection if they don't necessarily always have the best sort of internet connection. That's why we sort of done the 4G package that we sort of brought forward. But it's really about trying to give schools guidance and advice in terms of actually how they can use resources to sort of send out to sort of children. But we're not at the we're not in a position where we're sort of Ofsted are doing inspections of schools to sort of check as to what they're doing, but we're trying to put as much resource there to be available to schools to give them the best chance of being able to support all communities, wherever they are, whether they're town, city or rural.
Tom, did you have a question?
Sort of a disadvantaged, particularly those, I'm really concerned about those with sort of dyslexia and dyspraxia. I mean, I know that the Oak Academy, it does have support for those with autism and quite severe forms of SEN. But I have had a number of teachers express concerns to me that it's not dyslexia friendly, and or for those with dyspraxia either. I think, as somebody who's got dyslexia and dyspraxia myself, I know actually that IT, online, things that are online, they're not easy for us. We struggle with the processes and it can be really difficult. And often for those who have got dyslexia and dyspraxia, they have very special relationships with certain teachers that they work with on a daily basis, and those relationships are what get them through the challenges and help them progress. So I think that when considering the impact this is having on those who have special educational needs, I would really urge the government to do everything they can to support those with dyslexia and dyspraxia, as well as those with more severe forms of SEND as well.
Tom, as someone who sort of knows some of the challenges that dyslexia brings in terms of learning for young people, as I know that this is incredibly important and something that a lot of parents really sort of worry about. We have tried to across the whole sort of spectrum of needs that children have, we've tried to put actually as broad a range of advice and resources available to them. But I do recognise that that there's probably a hunger for ever more support. As you can imagine, in terms of the Oak National Academy, this was a resource that has been born out of sort of a crisis that has been really pulled together at amazing speed by some amazing and wonderful people who put so much personal effort in terms of making it happen. But we'll certainly be looking at what more that we can do to help and assist those children and those families who are trying to support their children with dyslexia or dyspraxia. I must confess, the best way of supporting them is making sure that actually they're back into a good, safe school setting at the earliest opportunity, and that's why I'm genuinely so passionate to see schools return when it's the right time to do so, because I know that there's so many children, and I think the whole committee's touched on it, children from every single background, every single one of them benefits from being in school and has the best opportunity and the best way, in the best position to be able to learn when they're in school. And that's why I'm so keen to see schools return when it is that right time and when we can make that happen.
Thank you. Upsana, did you have a quick question?
Yes, thank you. And thank you, Secretary of State. Just a quick question about the emerging evidence that it's not just, well, actually that some adults from BAME backgrounds or Black and ethnic minority backgrounds may be disproportionately affected by COVID-19. So what plans are there in place to work with other departments to consider what this means in particular for Black and ethnic minority staff alongside other categories of vulnerable workers that are delivering teaching at the moment?
Absana, the decision to return schools in a phased manner will be a decision that is made right across government in the best interests of the pupils and the teachers, and making sure that this is done in a coordinated manner and working with all government departments to ensure that all considerations are properly taken on board. The issue that you raise is something that is a really important consideration for the SAGE subgroup that we've asked to look at the issues of schools returning and making sure that they're done in the best possible and the right way to protect the interests of pupils and protect the interests of those who are working in schools, whether that be teachers or support staff. So this is a key consideration in making sure that we get that right. And we'll always be guided by both the scientific and medical advice to make sure that we make the right decisions.
You just said that the decisions to open schools in a phased manner will be decided by the scientific advice. Does that mean that when it does happen, they will be open in a phased way?
Mr. Chairman, when we bring schools back, which I think everyone wants to see schools returning, they'll be returned in a phased manner, so that we recognise that the idea of schools all returning on day one with a full complement of pupils is not a realistic or practical.
Okay, but you haven't decided the way that phasing is going to work yet, whether it's primary or secondary or early years?
Mr. Chairman, we're working with the sector and with schools to make sure that when we do this, this is a logical and sensible route to doing it. We're looking at many countries across the globe that are a number of weeks ahead of us, whether it's nations such as Germany or Denmark, and looking at what works for them, how we can learn from that best practice. Of course, every nation has a slightly different schooling system, so the lessons that they've sort of learned don't always translate, but it's important to look at what.
Thank you. I'll do a quick question from Christian, and then Ian, I promise I'll bring you in now for this other stuff. Thank you for being patient. Christian.
Thank you, Chairman, and thank you, Secretary of State, for joining us today. Similar to the question that Tom was going on earlier, last week I met with Bury Together, which was a group of parents with SEND children. So I'm just wondering what engagement the department is making with parent carer forums during the lockdown to make sure that the right information is getting to parents to how they can educate their children during the lockdown in the absence of being able to engage fully with the Oak Academy. And on a similar point, obviously the Oak Academy, as a great resource it is, unfortunately there's still no real resource to help parents with early years children, myself included. So whilst it is very nice to have the toddler at home, it is very difficult to know what best to actually do to actually help educate them. And if we get early years wrong, that potentially sets a child's educational career up for the absolute wrong trajectory. So what's the department doing for early years in lockdown to make sure that actually our younger children are benefiting the most?
Yeah. So we're looking, obviously, some of the key priorities have been children in years 10 and 12, as the committee will appreciate that we've recognised that there's been, those are the children who are going to be facing exams at the earliest stage. So quite understandably, a lot of focus has been put in terms of supporting them. Oak National Academy has been touching across every single year group, but we have been trying to work with, one of the best resources in terms of access, again, has been the BBC in terms of touching some of those sort of early years. But we do recognise that there's always a demand for more. I take on board your point that you would like to see more in early years. I will try and make sure that we have a specially targeted package for you, Christian, to be able to educate your children. But we're constantly working with the sector to sort of actually develop the offer that we've got. As you've probably seen from the gov.uk website, we put up an enormous amount of resource, whether it is for children who have got special educational needs, whether it is children of all age groups. And it isn't just about the Oak National Academy. There's a whole set of players, businesses, organisations that have made their resources free. And we've tried to use the gov.uk website as the opportunity to signpost, whether it's parents or whether it's teachers, to these resources of every single age group, but also of every single ability range, making sure that we've got the very highest quality resources.
Thank you. Ian has been waiting for a long time, so thank you so much. There were so many questions on that from members.
Yeah, it's returning to the issue of what are we doing to ensure that disadvantaged youngsters are being catered for in this period. And of course, one of the things which has been done is the development of a voucher system to make sure that youngsters have access to enough food for when they should have been at school and would have got a free school meal. But it has to be said, Secretary of State, I could probably talk to you for the next 45 minutes, which I won't be allowed to, about the failings of the Edenred system and the inordinate amount of time it's taking school staff, in particular head teachers, out of hours to access the system, hours and hours on end. And I've been kind of collecting horror stories really about the Edenred system from head teachers and how inaccessible the whole system actually is to them. And the fact that it's taking hours and hours, the head teachers have learned that Edenred themselves have stated that the number of youngsters that they were expected to cater for was originally 100% understated by the DFE, and therefore they weren't actually geared up for the numbers that they eventually then had to deal with. And I've seen head teachers have described to me that if they had to put on a bar graph their interaction with the Edenred system, it would go something from the low end, deep frustration, to the high end, please kill me now, because it is taking so long to interact with this system. Secretary of State, what can be done? Because as a result of this, many youngsters who should be getting this support are still struggling to get that support. And we've also had a situation where free school meal services provided by the local authority have jumped back into the void and provide hundreds upon hundreds of meals for youngsters in a packed lunch format.
So Ian, right from the start, we're very keen for schools to be able to continue to provide funding, school meals in terms of at a local level. And obviously the funding for school meals that can be provided by schools has continued all the way through this period. Additional to that, we wanted to be able to give schools the ability to offer additional resources, because we recognise that all children who would be eligible for free schools meals wouldn't be able to necessarily access schools themselves in order to be able to have the benefit of the meal that we'd already funded and provided through that school to be able to do. So additional to that, we wanted to be able to put in resource. We did say to schools that we'd give them the flexibility to be able to procure it locally up to the value of £15, and we increased the amount that we're willing to be able to spend on that. But we did also say, in terms of the Edenred system, we wanted to put something in place which was a national voucher scheme, that if it wasn't to be able to be provided locally, or there wasn't the systems in place, this is something that they could turn to. I readily acknowledge that actually the level of demand for this has been exceptionally high, and we've had some big challenges in terms of being able to provide schools with the level of service that we would have really wanted them to see. But we've been putting, both from the department's point of view and with Edenred, doing everything we can do to support them in terms of being able to get these vouchers out as rapidly as possible. We, in the first few weeks, we saw a very slow turnaround in terms of people getting the vouchers out. That's increased substantially. We still have some challenges in terms of actually schools being able to access as rapidly, being able to place those orders. And we're actually sort of doing a lot more work with Edenred to sort of speed that up, because we recognise how important that is.
Ian.
Secretary of State, thank you for that. I mean, I hope that you have gained from my question the deep level of frustration which exists out there. Additionally, though, I understand that a number of the supermarket chains are where people are able to redeem their vouchers, but not the co-op. And there are an awful lot of communities around the country where the co-op might be the only store which is accessible locally. And, you know, I've got no axe to grind with the co-op, but it has been raised with me directly that why isn't the co-op involved in this scheme, given that in many communities it might be the only store which is of any use in terms of redeeming such a voucher. They are ready and willing to participate should the DFE and the Edenred scheme be able to do that for them. So could we see some movement on that, please?
So Ian, we want to have a larger range of supermarkets participating in the scheme, and as of today, McColl's are coming onto the scheme. We saw just a few days ago Aldi coming onto the scheme. We really want the co-op to participate in this scheme, but as you well know, as I do, the co-op isn't one organisation. It's a multitude of different companies, of cooperatives that sort of form it, but obviously operating under one brand. And if I think about where I live, there's 2 co-op stores where I live, both operated by 2 different cooperative societies. And some of the cooperative societies are in a position where they could accept vouchers, but a large number of cooperative societies aren't yet in a position where they can accept the vouchers. So then there is a danger that people are in the confusion of they're going to a co-op store, which is branded exactly the same, but they're not able to access it because that is a cooperative society that isn't able to accept the vouchers. We're working with the cooperative movement to be in a position where they can accept the vouchers. I want nothing more to do this. It was one of the supermarket organisations right at the start. We wanted to get them on board. I know that they want to do so, and they're working really hard with all of their members to be in a position to be able to accept those vouchers, but avoiding the confusion for people who may potentially go into a co-op that wouldn't then be able to accept that voucher. But we're trying to get there. And if there's anything that you or the committee can do in terms of working with the cooperative movement to help them to get into that position, we're doing everything we can to help. And we'd hope that we're in a position where we can get them accepting these.
I'm going to bring in Fleur and then Jonathan briefly on this. Fleur.
Thank you. Jonathan's going to ask, I think, about the Wandy scheme, but I would just like to ask why Edenred was chosen when it didn't and still doesn't, from what you're saying, enable cooperation with Lidl or the co-op, but it does with Waitrose and M&S. And given the group of people who we are working to provide the free school meals, it doesn't seem to have been the right choice of a company to have supported from the start. And I'd like to echo what Ian was saying about the co-op, that they do want to work with the department on this. They are ready and willing, but they cannot work with Edenred. They've gone as far as they can for that. So there needs to be some flexibility and different ways of working, which I'm sure can be done, but just needs to go outside the Edenred scheme, which many schools have had to do in order to get those free school meal vouchers early enough as well, because they've taken a long time to come.
If you could try and give a brief answer, Secretary of State, thank you.
So the reason that Edenred was chosen, as you would imagine, you would very much hope for me to always operate within the law, and in terms of procurement of making the commercial procurement decisions, Edenred was already an approved supplier that we're able to turn to at speed. You raise a particular point about actually schools do have a flexibility. We wanted to build in the flexibility. So if, for example, a school is serving a community where the only store is a cooperative, they actually have the ability, and they'll fully reimbursed and fully refunded in order to be able to procure vouchers from that cooperative in order to distribute to that local community, because we recognized immediately from the start that, the speed that we were creating a system, we could not create a perfect system. So we recognized we needed to give schools the flexibility to do that. And that's why they have a flexibility. So if they need to work with a cooperative and want to work with a cooperative in that way, they can procure vouchers and do it in that manner.
Jonathan.
Thank you very much, Chair. Secretary of State, obviously I appreciate what you're saying, with regards to Edenred obviously being selected due to your constraints within the law, but we are in unprecedented times, and I do applaud the DFE on, trying to pull off what is, hopefully a once in a lifetime thing with this. But can I ask Wandy, who already provides to 16,000 schools vouchers, why would they be ignored when they offered their assistance with the delivery of this voucher scheme?
If I can write to you, Jonathan, in terms of the details of the decisions that we made in terms of the procurement, I'd be very happy to write to you directly with the details as to how we reached that decision and at the speed that we had to sort of make that.
Appreciate that, thank you.
I think the general point of the committee is it's great and amazing that you've been able to set this up in a record time, but there are one school after another is having huge difficulties getting access to it, and queues online. It's a bit like trying to get a supermarket delivery, but obviously this is for vulnerable children. So I think that's kind of underlying the questions of the committee.
I think, Mr. Chairman, effectively we had to sort of create a whole new strand of sort of almost support for families that had previously never been done by a department at such speed, to such an extent before. And we recognise that there have been real challenges with the system, and we really do value the patience that people have shown. But please let me reassure the committee that we're doing everything we can do in terms of both putting flexibility in the system for schools to work to local need, but also equally importantly to make sure that this system works as best as possible for those schools and those parents who are accessing it.
David Johnson, do you want to come in any more on online learning? Or
there was just one small question. Am I right, Secretary of State, it's 200,000 laptops that you expect to supply? Is that what you said earlier? Yes. In your guidance, it says that the devices will go to some Year 10 pupils. Does that include free school meal eligible pupils?
It's going to be, we're going to be giving schools the opportunity to decide as to where the resource is best needed. Obviously, if a child already has access to IT equipment, we think it would be logical for there's not really an awful lot of point in sort of doubling up in terms of that resource. Free school meals is one of those factors, but we think that schools will be the best people to use sensible discretion, because we want this resource to be as widely used for children who have the greatest need. And there's a lot of children who obviously have access who are on free school meals, but will have access to laptops. So we wouldn't want to see doubling up.
Thank you. Just on the online learning, I know we've talked a lot about this, but given the importance of early years in setting up children to learn, do you have any plans to increase access to online learning for very younger children at home?
Not currently in sort of a specific sort of department-led online sort of portal, not in the sort of the realm of where the Oak National Academy was, but we're currently across a whole set of areas. We're sort of so rapidly developing different offers, and if you'd asked me 4 months ago as to whether we would have the Oak National Academy running, I would have not believed that that was possible. So as to where we'll be in a month's time, I imagine we'll be in a substantially different place than we are today.
I think there is significant recognition. There are some remarkable things that have been done, and the Oak National Academy, the laptops for older children for the Year 10s. It's just the concern, you don't need to answer this, but the concern that there are still a lot of people who are not online, who are disadvantaged, who may not be getting the education they need, or don't have access to online learning. And I appreciate you can't solve every problem at once, but we're raising it because it is potentially a serious issue.
Well, Mr. Chairman, if I could signpost, and maybe this would be a good one to signpost Christian to as well. This isn't something that we developed during the coronavirus crisis, but the development of a Hungry Little Minds project, which I'm sure that the Select Committee is familiar with, is an amazing resource that's very much targeted at those early years. And while it wasn't developed in response to coronavirus, it does actually have a lot of value in terms of actually supporting those early years, especially in terms of language development. And I know that members of the committee are very conscious that language development is one of those key determinants as to how well a child does in terms of later life. So we'd be very keen to get parents and youngsters sort of accessing those resources that have already been created, recognising the importance of the early years environment.
I'm going to bring in Jonathan Gullis now, please.
Thank you very much, Chair. With regards to, or obviously with the exams, can I ask what conversation has the department, or is the department having with Ofqual to ensure all exam candidates receive a fair grade? And how accessible will the appeals and resit process be in terms of administrative burden and cost?
So as part of engagement with stakeholders, we have a round table, and Ofqual are one of those key members of that round table every single week. And we've worked incredibly closely with Ofqual. And if I could just thank them and the exam boards for work that they've done in terms of working closely with the sector to try and actually create a system that is fair and has been in response to this crisis. You know, the Ofqual have launched a major consultation, and it's obviously had a very high response. That's a consultation that closes today, and we're very keen to make sure that people's input in terms of concerns that they may have in terms of the process that Ofqual have outlined is properly listened to, and we will respond to those concerns. So it would be, I don't want to preempt the consultation, but we will listen very, very closely to those concerns that schools, parents, and other organisations have raised in response to this. For me, the best form of assessment is an exam, and any other form of assessment is not going to be as good as a proper exam serial. So, but that wasn't an option that was going to be open to me. And can you imagine the amount of uncertainty and the amount of worry that so many children would be having at the moment, and teachers and all those who are working in schools would be having if we hadn't outlined what we were going to do and recognising the fact that we weren't going to be able to run an exam series. That's why we did what we...
Okay, thank you.
Can I just add one thing in terms of...
Very briefly, because we've got a fair few questions to go through.
But I particularly wanted children, if they did not think that the grade was a true and fair reflection on the work or what they would able to achieve, to have the opportunity to sit an exam. And that's why we've been working with Ofqual and the exam boards to provide an autumn serial of exams. Because I think that if people do not feel as if this is the right qualification that they truly deserve, the best way is giving them the opportunity to sit a shortened exam paper and have the opportunity to sit that exam and get the grade that they truly believe is what they can achieve.
Jonathan, you've got to come back to that.
Thank you very much, Chair. I'll put the two questions together in order of speeding up time. Obviously, Secretary of State, I appreciate that, you know, collecting data before the 20th of March is extremely stressful, because as a former teacher, as you've alluded to, I know that with mock exams, for example, you would have set very challenging papers and probably marked harsher as a way of motivating students. And I do fear the impact that will have, especially on disadvantaged, because obviously it won't necessarily be a true and fair reflection. I will just come to my two questions though. One is obviously the transitions phase, especially in the primary sector. Those currently in year 5 who are due to sit their SATs at the end of Key Stage 2 in the 2020-2021 academic year, what preparation is being done for them, and also to come to the idea of how we work out these grades, because the Fisher Family Trust, you know, was set up in order to help with target setting, but has said that these are estimates in their own words. And I wonder if we'll be looking at how we use Fisher Family Trust in the future when it comes to target grades.
So, Jonathan, in terms of exams, as I said, are the best form of assessment that we can possibly have. But we have particularly asked Ofqual and the exam boards to look at the issues in terms of disadvantaged pupils as they're approaching, in terms of approaching assessment, and BAME communities as well, as there's been some particular concern that they may be disadvantaged as a result of the process. So we asked Ofqual, we asked the exam board to consider that as part of the work that they're doing, and in terms of a solution that they're providing in terms of the creation, the awarding of grades to pupils. We'd certainly be, we're working with a whole range of organisations, and the reason that we're consulting on this is just making sure that whether it's the Fisher Foundation or others who have got really valuable advice and guidance in terms of how we can do this, we can take that on board in terms of how we take this forward. But what is so important is, we've got a number of transition years, and I want to be getting back to a position where we're doing proper assessments, whether that's through through examinations as rapidly as possible. And you highlight years 5. You also highlight really years 10 and 12. Those years that are going to be facing exams, how we can make sure that we're supporting them so they're in best position to be able to deal with those exams and actually succeed in those exams, because I am absolutely adamant that we do not want to be disadvantaging those children as a result of this crisis, and how we put those interventions to help them to make sure that they succeed, and that gives them the gateway to succeed in so many other things in life, is absolutely pivotal to everything the department's doing.
Thank you. Apsana was waiting for a question, then I'll bring in David Johnson briefly.
Thank you, Chair. Thank you, Secretary of State. You mentioned about the impact of grading and assessments on particular communities, and I just want to ask for a bit more detail in that area as to what plans you have, what plans and what consultation you're doing with stakeholders and organisations to ensure that there isn't an unconscious bias and that's reduced and mitigated in assessments.
Well, Apsana, right at the start of the process, we highlighted this as a particular area of concern, and we didn't want, in everything that Ofqual did in terms of creation of a system of the awarding of grades, they had to be conscious of the fact that there was evidence that a number of youngsters within those communities were in danger of sort of not realising the grade that they would have been sort of achieving if there'd been a traditional exam. So that's why that they've come up with the system that they have. The ability to have a say on this is why they've done the consultation, which is closing today. And I would hope that those communities and organisations that sort of specialising in this area are using the opportunity of consultation to making their voice heard, so that Ofqual and the exam boards can properly take on board those concerns in terms of what they do, and make sure mitigation is put in place to make sure that no one is disadvantaged.
David, just Johnson, before I bring you in, I've got another question from Caroline Johnson, who has trouble connecting. She asks, on her behalf, in terms of nurseries and childminders, what thoughts that you have on how and when they may be able to reopen?
Well, this would be very much in line in terms of the actions that we take across the whole school and college estate, and it would be considered within the round of that assessment, and we'd be looking at SAGE to give us the very best advice to make sure that any moves in terms of whether it's bringing nurseries, schools or colleges back are done to ensure that it's in line with our efforts.
Thank you. David Johnston, thank you.
Just very quickly, I've had constituents who homeschool their children write to me and quite rightly say that their assessments will not be allowed to form the grades that their children get. So they really need those autumn exams. I know you don't want to preempt the consultation, but it'd be good if you could push for those exams in the autumn to be as early as possible, because that's a group that will really need those.
David, you and I are thinking in very much the sort of same space in terms of these exams. I would want, we've got to work with schools to make sure that, and those who are sort of have the ability to be able to put them into action, but I would like to see them at the very earliest stage. But we do have practical considerations to consider, but this is why having an autumn serial is incredibly important, and why we sort of pushed for it.
Thank you. Ian, you've got a question, please.
Thank you very much, Chair. Secretary of State, moving on to the question of independent training providers. Why didn't the department immediately comply with the Cabinet Office guidance and announce support for providers with a contract, those providers who have a contract with the Education, Skills and Funding Agency? Why wasn't that support package automatically done?
Well, we always comply with Cabinet Office guidance, and we always will do.
Well, the implication is that the department hasn't done so on this occasion. So I would ask you to look at that, Secretary of State, please. And what are you doing to safeguard the apprenticeship and skills sector in particular?
Well, Ian, it's a very important point, and we've got to be looking, and I'm sure well, obviously the Select Committee is already looking at this, the most important part is now starting to looking at the recovery of this, and I see apprenticeships playing a really important role as part of that. We've taken a whole number of actions in terms of increasing the flexibility so people can continue their apprenticeships, and over 81% of apprenticeships are continuing as we speak. But obviously that means that 19% of apprenticeships aren't, and what we've been looking through the ESFA is how we support some of those apprenticeship providers who aren't able to continue to deliver apprenticeships either through online learning or being able to sort of access those apprentices, but in those critical areas of where we're needing to preserve that high quality, of how we can put a package there to support those providers and make sure that we have a sustainable future in apprenticeships. I really think that there's an opportunity for us as we come out of this to make sure that we really skill our workforce in a way in terms of dealing with a new economy that's going to emerge, some of the new opportunities that we are going to be facing, but also some of the new challenges we have. And we've recently launched the digital toolkit, skills toolkit, which is specialising in digital resources. We want to be looking at different ways we can do that, but apprenticeships is a key part of that.
Can I just come in on the skills kit, which it looks like a credible option for people to reskill. Can I just confirm, is it new online learning, or are you redirecting people to existing things that are online?
Well, we've worked very closely with providers to actually look at what was some of the high quality resources that were there, and we've corralled them together. What I would hope to do is to see this as a platform of something that we can grow and actually put, as we develop new qualifications or new modules that actually can be added there for people to access, is be a platform that become larger over time and actually offering a much wider range of resources for there. So it is existing resources that we pull together, but I'd like...
And is the National Retraining Scheme, is that still the 100 million, is that been transmogrified into the National Skills Fund, or is it a separate fund? And if so, could some of that 100 million be used to help fund sort of these reskilling online courses for lifetime learning and people who are working but are not able to at the moment?
Mr. Chairman, is separate from the National Skills Fund, and yes, you're absolutely right, and that's exactly what we're looking at, is how we can use the retraining scheme as part of our response to the coronavirus.
So you could use some of those funds to support reskilling. Great. Ian, sorry, you got a quick one?
Yeah, it's just to come back, Secretary of State. I've got a constituent called Alice who attends or has been attending Newcastle College, but our course has been curtailed, and she's asking, why is it that A-level students will get a predicted grade based on assessment, but her as a BTEC student understands that she won't get a predicted grade, and she's really concerned about what's going to happen because she's been unable to finish the course at the moment, and she's hoping to do a nursing degree course at Sunderland University. Could you have a look at that, Secretary of State, if there is, one rule for one and one rule for another?
So, Ian, if you'd be kind enough maybe to forward the details of a particular qualification that Alice is looking at. We're very keen to give the predicted, the assessed grades, not for A-levels, but for BTECs as well. And that is largely what's been done. We do have a issue where there is, on a number of courses, and it isn't the overall, it's a minority of courses, where there has to be some on-the-job assessment in order for them to be able to complete it. And we're working with the sector to make sure that we're able to complete that final element of assessment, which just because you can't do, you've got to show a competency, a practical competency in order to be able to complete it. But we've treated BTECs in exactly the same way as we have treated A-levels, but it is that competency element in terms of practical demonstration that holds us back in a number of areas, and working to make sure Alice and many others are able to complete that at the earliest stage so they can get the qualification they've worked so hard for is incredibly important to, I know, you and me.
Before I bring in Fleur, I'm just going to bring in Tom, who wants to go back to a couple of issues. Tom.
Hi, just a couple of questions. So I did actually engage with a lot of my constituents before this meeting, and a common theme that came up and is raised by a number of different people was the issue of those in reception, so ages 4 and 5, and how important that first year is, and how so much of it is about relationships, and it's so important to be at class for that formative year. So just an idea about what specific plans there are by the government to address any concerns there. I mean, I know lots of parents might want their children to repeat that year, and I think if there was a case for summer schooling, it absolutely could well be appropriate for them. And also another question with regards to the national review on SEND that the Department of Education are carrying out at the moment. Just any idea about timescales and who the department have been talking to on that review. I mean, earlier this week, when we spoke to the Chief Inspector of Ofsted, I was slightly concerned when I found out that under the new framework, it might still be possible for a school to be awarded good or outstanding, even if there are serious deficiencies with regards to provision for those with special educational needs. Sorry, that's quite a few questions there. Sorry about that.
So in terms of reception, I totally agree about the important role that reception plays. I think all families are feeling a great amount of pressure with having sort of children at home. In terms of how we bring schools back, again, it's got to be looked at totally within the round. But we do recognise the important role that reception has in terms of that early development of a child, and how we sort of support parents to provide home resources for their children at this critical stage, and we'll continue to do that. The SEND review is something that we are continuing to do work on. We recognise its importance. To say that coronavirus hasn't had an impact in terms of how we've had to, deal with that, it will have delayed when the SEND review can report back, but work is still ongoing because we feel the importance of getting special educational needs provision right is so critical in terms of getting the whole schooling system right. And that's something that is felt right across government. But as you can imagine, a key part of special educational needs is also, and if we think about education and healthcare plans, a key element of that is also the health element. And as you can understand, there are multiple pressures within the Department of Health at the moment. So we do need to make sure that we don't move we don't bring the SEND review to a halt when we don't make sure it's a complete picture and it's a complete result to what we want to do with the special educational needs system.
Thank you, Fleur.
Thank you. I'd like to jump from early years to the higher education sector and ask a couple of questions about the future for funding and for stability of admissions as well. My local Vice-Chancellor in my university says that there is a very significant risk to our financial stability. And I know that universities are extremely worried about their future and have produced the paper Achieving Stability in the Higher Education Sector. So first of all, on international students and that part of the picture, what assessment have you made about the future and the impact of COVID-19 on the international student recruitment? Of international students specifically, and also of European Union students who are going to face potentially immigration status changes, and what flexibilities will you be introducing to help lessen this impact?
So thank you ever so much, Fleur. And you raised an important point in terms of the international student market. We've actually, as a department, along with Universities UK and obviously the Office for Budget Responsibility, have been doing quite a considerable amount of work in terms of looking at the impacts in terms of the education sector. Universities UK have done a lot of analysis as to the potential impact in terms of university finances, and this has been done very closely in terms of Department for Education and how we respond to this. The impact on international students is part of this is going to be when we're coming out of the measures that we've had to impose, but also many others have had to impose. And at the moment, I'm not in a position to say when that's going to be. And so we can't put a definitive number as to what impact universities feel. But we are working closely with the university sector in terms of actually, and also the Home Office, to look at the flexibilities that we can introduce, recognising that people will have difficulty taking English language courses in order to be able to then access university. And we've worked closely with the Home Office to put those flexibilities in so that universities are still able to continue their international recruitment, so that they can be in a place where they're welcoming international students into the new academic year. We're also working more broadly with the sector in terms of a package of measures to bring stability to the system.
Thank you. You mentioned the package of measures, and Universities UK have asked for funding, for substantial funding for research funding and stability in student application measures. There is some speculation that there is a delay or a block on this university bailout because an admissions free-for-all or a Wild West kind of situation, there'll be quite a change in where students apply to, would leave some universities more exposed financially than others. And then you or the Treasury are able to pick and choose who are saved rather than saving the sector in a more strategic way. Could you comment on that speculation?
I think for me, the main concern in terms of universities is for students that are actually in the universities and making sure that they have the stability to finish their either undergraduate or postgraduate degree. We then also need to make sure that we're safeguarding the amazing research resource that universities have and the important role that they play in terms of our nation in making sure that we're at the forefront of science and technology. And finally, and it's an incredibly important point, is that making sure that we recognise the important role that universities play to the economy of their local communities. And we're wanting to preserve stability for the whole sector, and that's why we've been working closely with Universities UK to ensure that we can deliver that. But those are the three aims of what we're working towards to bring that stability. But we mustn't forget, yes, it's about the stability of the institutions, but it's about those students that are studying there and making sure that they have the confidence and the belief that we're supporting them to make sure that they realise their aspirations in terms of getting their degree.
So when will you be likely to be announcing some of these measures and stability measures?
Well, we're working with the sector in terms of actually pulling a package together, and we're hoping to do so in the near future.
Thank you, David. You've got a quick question on this, David Johnston.
Yes, I appreciate the pressure the HE providers are under, but my question is about the students of HE, because there was a good case that some of them weren't getting a lot of contact time to begin with. Some of them have suffered from the strike. They've now got a lockdown where they're not getting teaching, and they're also being hammered by accommodation costs, particularly if they rented private accommodation. And I wondered what your message was to the students of HE about how the DFE is thinking about them.
So there's, for me, there's a very clear guidance that actually, if universities, if they're wishing to get tuition fees, have to provide learning, education and assessment to those students who are paying through student loans in order to be able to access higher education. And that is what's to be expected, and universities have to be doing that in order to be able to claim the fees that students are paying.
Thank you. Have you finished with that? A question, Flo, very quickly, because we're rushing along a bit.
My final question, and obviously we'll have to wait to see the package of measures to be able to assess them as a committee, but thank you for that. My final question is about the mental health of students. Do you have an assessment of and we have indications that there are increasing mental health needs of students who are either locked down away from home or at home but have less support? Do you have an assessment of the increase of mental health needs so that you can put in measures to accommodate them?
I think this applies across the board in terms of children at home as well, younger children, the increase in mental health issues.
We've been doing that assessment, and we've been looking at different ways that we can support both children at universities and across the spectrum in terms of dealing with some of those mental health issues that they may be facing.
Christian.
Thank you, Chairman. Obviously, the Secretary of State has mentioned several times about the strategy for reopening schools, and that will follow the advice of SAGE. However, I was just wondering to what extent you're actually consulting those education bodies as to how that's going to look like, or if they're able to feed into that conversation. So I know when I've spoken to several of my schools and also the nurseries and childcare providers, they've said at the moment they've not been consulted on anything, and actually they'd like to take part in that, so they can advise how that would be best represented by them rather than straight down from government to the education body.
So Christian, I'm sure you'll appreciate, with over sort of 22,000 schools and nurseries, I think if it's not really feasible for us to run a consultation with every single organisation right across the country, but the department's been, I myself have been holding regular meetings with the sector and with organisations that represent a whole spectrum of both schools, but also unions as well. And the department's been holding direct talks with different organisations. We pulled together a sector body which is having regular discussions as to the best ways moving forward. But it's just not going to be feasible to have a UK-wide consultation for people to be able to sort of feed into. What people will want is a clarity and a certainty as to how schools, how nurseries are going to be reopened. But in terms of actually listening to what the sector is saying. We're doing that, and we're doing it absolutely hand in glove in terms of our discussions that we'll continue to hold as to how that is best done.
Okay, thank you, Secretary of State. I guess a kind of follow-up question to that, although slightly more generic, would be: what do you think the department can actually learn from this whole situation of COVID-19? So what's gone well, what's not gone well, and what are the lessons we're actually moving forward with?
So I think there's a whole host of different areas that we can actually learn and benefit from. I think the ability to support children within the home and through holidays has really been transformed by a lot of the learning that we've had in terms of delivering, in terms of home education, and in terms of support that we can give children. We've actually recognised that resources can be much more rapidly shared, and I would actually hope that we can take we're going to be taking a look at how we can use some of the resources that have been shared and actually sort of reducing teacher workload in terms of lesson planning, in terms of resource sharing, making sure that teachers are getting the very best practice and actually being able to use it and bring it to their classroom. I think there's really sort of EHCP plans and tribunals. Actually, by moving them online, we're actually getting through, the backlog of tribunal appeals much more rapidly by being online than they're not by actually being there in person. Can this be something that we learn from and actually start to looking at how we can implement it? But I've said a whole strand of work in terms of looking at recovery, because so often there's so many things that we want to do in education, but we don't do because of a disruption that it may be causing to the sector. And as part of the work that we've initiated is what lessons can we learn in terms of good things that have come out of this crisis that has meant that we can do things better, but also different things that we may want to change in our education system that in previous times we've always said we won't do because of disruptive effect it has to education.
Thank you. Do you want to come back on that, Christian?
A quick follow-up, which is more on the resilience point of view, but that's more relating to virtual schools and EHC plans. So obviously speaking to a number of parents with children with EHC plans, they've said they've put forward some suggestions for spending in regards to those plans that they feel would benefit their children most, but have been turned down by the local authority. So to what aspect is that being considered by the DfE so that actually the children are learning as much as they can at home as their parents would see so? And in regards to virtual schools, obviously children looked after are arguably our most vulnerable children. So what work is being done with virtual schools to make sure that the CLAs are actually the ones who are maintaining their schools as much as possible so that they aren't missing out and having the double whammy of essentially being vulnerable and missing education at the same time?
Well, this is why we particularly targeted that cohort in terms of a sort of digital package that we're rolling out. In terms of parents who think that their children who have an EHCP plan would benefit through a sort of a reworking of that sort of EHC plan, we would really encourage local authorities to sort of demonstrate as much flexibility as possible in terms of actually changing and adapting the way that they allow people to access learning. Because we don't want people to be in that position where they're overly sort of falling further behind as a result of this crisis.
Thank you, David Symonds.
VR have published something to the effect that they think the impact of COVID-19 could have a devastating effect on the education sector. I know we're all very conscious that schools, in some cases, were in a parlous financial position in the run-up to the crisis. Other schools, speaking with some in my constituency, may have many millions of pounds of balances in the bank and are therefore well positioned to cope with it. I'm just interested in the assessment the department's doing about those risks and what steps you think the department might need to take to guard against a financially devastating impact on some schools as a consequence of the pandemic.
Well, we were distinctly conscious of the fact that the sort of change in terms of how schools are running and just being open to critical workers and those vulnerable children may have a impact in terms of school finances. That's why we put in place funds for schools to be able to apply up to £75,000 worth of resources to be able to cover costs that they may incur. We've as yet had no indication that schools are facing a negative impact in the way that you would maybe be concerned about. And I think that's partly down to the fact that we've put in place provision for whether it's primary schools or secondary schools, support there that they're able to call on if there are those abnormal costs that they would maybe be incurring. But we've not had those reports that schools are facing that financial dilemma as a result of that coronavirus crisis. But I'd hope that that has been helped and supported by the actions that we've undertaken right at the start.
Any more, David, at all?
No, that's helpful. I think the key question is going to be, as the OBR flesh out what they mean by that impact, that the department is able to respond to that. And clearly, the significant levels of balances held by some schools are an important part of that. But some of the other providers, including amongst the skills sector, will also be impacted. So I think just making sure that that's monitored for that impact as it plays out.
David, I think you're right to highlight some sort of differing sectors as to how they'll be impacted differently. And you see the HE sector, the FE sector, the broader skills sector, and also the early years sector, they'll have a different type of impact as a result of this crisis than you'll see in terms of the broad primary and secondary school sector. And we're working very closely, as we've indicated, to make sure that we take early action to help support them in the best ways that we can.
Thank you. Ian's got a quick question before I come on to you, Sana.
Yeah, thank you very much, Chair. And just following up from David's question and the point that he's raised about school balances, and of course, I thought it would be important to make the point that overall the levels of school balances have diminished, and it's not a uniform or universal issue across all of the school estate. There will be many schools out there who may be watching this morning on Parliament TV who would not recognise the question of there being healthy school balances that they have got to call on in such a drastic situation as we are in at the moment.
Ian, this is why we put in place the action to make sure there was a fund available for schools to be able to call on if they'd incurred expenses as a result of dealing with this crisis.
Fleur.
Thank you. Just to follow up on this, in terms of nursery funding and private nurseries, many nurseries have been in contact with me saying they're in financial difficulties, and this won't be an education funding. This will be you in conversation with the Treasury about how to treat them as small businesses that are in trouble, but that we don't want to lose a lot of our early years sector through falling through the gaps in the Treasury scheme. They especially many felt that they would get the education funding, the early years special funding, as well as being able to furlough staff, and they've been told that they can't. This seems to be a change in the rules. So is there conversations with the Treasury about, and do you know how many nurseries are in potential trouble and could be closing?
So right from the start of this crisis, we put in measures to support the early years provision, and we've seen the fact that we continue to pay the grants to local authorities for those to be sort of passported through to early years providers. But on top of that, you've got the furlough scheme, as well as a whole raft of extra provisions that the Treasury have provided in terms of supporting many small businesses as well as many larger businesses as well. And of course, you do have a number of large chains that also provide early years provision. We're actually working very closely with early years providers to have an understanding of where some of the weaknesses are in the sector. But we've always been clear, you can't, and the Treasury was clear from the start of launching the furlough scheme, is that you can't actually be getting government grant and then also getting an additional payment on top of that for money that's sort of covering those staff. And I think most people would recognise that we do have a duty and responsibility in terms of payment of public money, and we can't be in a situation of paying for two things twice. But we continue to work with Treasury, but also most importantly continue to work with early years providers to make sure we do everything we can do to support them, as well as with local government, in terms of preserving this really critically important sector that I think everyone wants to see back up and running at the earliest and opportunity and at the right time, as so many parents depend on it.
Can I just ask you very briefly, the Department for Education apparently has not clarified yet whether or not nursing students who work for the NHS during the pandemic are still paying tuition fees. Are they paying tuition fees? And if they are, can you make sure that they're not paying for tuition for that they're not receiving?
I will come back to you on that point, Mr. Chairman.
Okay, Apsana.
Thank you, Chair. Moving now on to technical and post-18 education. And given the concerns raised and voiced by, among others, the awarding bodies for T-levels, why is the department now pressing ahead with the introduction of T-levels?
Well, as you'll probably remember, Apsana, that this was a programme that had absolute cross-party support with both the Conservatives, Labour and the Liberal Democrats all supporting the introduction of T-levels. We are proposing to bring forward 3 T-level qualifications across 55 providers across the United Kingdom. We think this, I personally think the introduction of T-levels and actually raising the status of technical and vocational qualifications is one of the most important tasks that this government has. And I'm very keen to make sure that we continue with this programme. And we've been working really closely with that sort of a small number of providers. And we think that we can, as we roll this programme out, we reckon that there's we can learn a lot by the experience of doing it, but we also want to create the opportunity for young people to benefit from this really brilliant qualification that I think, as the equivalent of an A-level, with the status of an A-level, that's going to have a really transformational impact. And for me, technical and vocational qualifications are such an important part. And I know that this is something that has had cross-party support in terms of the importance of this. And, I want to see it happen, and I want to make it to happen. I don't want to see children and youngsters missing out on the opportunity of having that choice.
Apsana.
The Olga review was published last May, and I appreciate that definitely there is a disruption to the government's response. But can you explain what's been done with its proposals since the publication in May last year?
Of course. We're obviously, we'd been planning to publish our review, our response to the Olga review around the period of a spending review coming out, which was expected to be around the July time of this year. That looks as if that has been pushed back. That has been pushed back, so we'll be still looking at doing a response in line with the spending review. We've done a considerable amount of work, and we've recently set up a white paper task force with Keith Smith from the department leading it in terms of further education. That will be one of the key elements in terms of and key planks of our response to the Olga review. and Keith has been doing an immense amount of work, and as I say, we'll be responding to Augur in line with a spending review, but there's an awful lot of work that's going on. Keith's leading this work on FE white paper, and it's an area of department's work that I think it could be, really revolutionary in terms of driving reform in this vital sector, and incredibly vital for those youngsters.
Thank you. Could I just, I mean, there are some private schools that are behaving very responsibly and trying to work to support students and state schools. But I've had a note that there are some independent schools that are billing parents for as much as £8,000, including a discount for just 2 weeks of online A-level tuition amid school closures. And for children to be given A-level grade recommendations, the pupils must be on the school register. To be on the school's register, the parents must pay the fees. It's a catch-22. So what steps are the government taking to ensure that kind of bad practice doesn't occur and that independent schools don't use this to capitalise on changes to exam grading in this way whilst learning doesn't take place? The state sector, those schools, and help teach the left behind pupils.
Robert, Mr. Chairman, I do apologise. I lost you as part of that. But in terms of private schools, obviously the department doesn't have any role in terms of the contractual agreements that they have between themselves and parents. But obviously, we'd ask everyone to act in the most considerate and sensible and responsible of ways. And I know that right across the whole education system, everyone is in a rapid development and ensuring that they're delivering teaching for every child. And I'm particularly proud of the work that's been done in the state sector, which obviously we have direct control over. I would, of course, encourage all private schools, and you're right to highlight that there's been some brilliant examples of what they're doing in terms of supporting children from disadvantaged backgrounds. I'd ask them to look at what more can be done, how we can support vulnerable children, and actually, can they play a bigger role in terms of doing that, and not just through this crisis, but also into the future.
But if it is true that they are charging £8,000 for 2 weeks of online A-level tuition, and they can't get their A-level grades unless they pay that £8,000, would you say that's probably bad practice?
What I would say is, obviously that's a contractual agreement between a private sector employment, a private sector organisation and parents. But it's absolutely vitally important that all children who want to take their A-levels have the ability to do so, and no one should be held over a barrel in terms of being able to be put into that position of people's future to be threatened.
Thank you. Ian has got a question.
Yeah, thank you very much, Chair, and thank you very much, Secretary of State. Coming back to your earlier responses about what do you think the department can learn from the COVID-19 situation, one of the things which has come to my attention, and I'm very closely connected, so it's not a shock, is that my local authority have had to do an enormous amount of additional work, obviously in adult social care, but also in children's services and resilience planning, and particularly in relation to coordinating what's happening in the education sector. It seems that local authorities still have an awful lot of responsibility, but not so much jurisdiction these days over the different stakeholders which are working out there in the field. Also, on top of that, Secretary of State, my own local authority tell me that while they have been given additional resources, they believe it's only about 25% of what they have additionally spent to cover all of these different responsibilities. Is there anything that the DFE as a department can learn from that and feed back into government?
So on your latter point, the Community Secretary has set out a package of over £3 billion directly supporting local authorities, which is one of the biggest packages that you've seen in terms of direct support for local authorities to help them at this time. And we all recognise the important work that they're doing. And I would certainly hope as that money flows through, those concerns that your local authority have will be alleviated. And I know that the MHCLG are working on the allocations as to what that means for each individual local authority. Separately, in terms of the role that local authorities play in terms of schools, I think they've played a really important role in terms of working with multi-academy trusts, working with individual schools in terms of coordination, and I think we've all truly valued that. And the leadership that we've seen within individual schools and multi-academy trusts to actually provide an access, a route into access to education has been truly inspiring. And I think it's that collaboration that we've seen right across the board has been one of the great benefits.
Caroline, are you there? Can you hear? Caroline Johnson?
Yes.
Would you like me to ask your question? The line doesn't sound great.
I could try. I've got constituents who are stuck at university, and I know their families. They're often relatively young on their own, and some are getting particularly lonely and talking about them. And what considerations being given by the department allow them to take a single move back home?
Carol, I don't think that came over. Shall I repeat it if you don't mind? Can you hear me, Secretary of State?
Sorry.
I can.
Great.
I can.
What Caroline is asking is she has constituents who are stuck at university, unable to return home to their families and often alone. What consideration is being given to allowing them a single move home should they wish?
Well, I think that she raises, is this for domestic students and particularly or international students?
I think she's talking about domestic. Yes, she is, yeah, domestic student.
So I think this is something that we would very much want to facilitate, and we'd sort of certainly hope that students would have been able to return home. Obviously, if there's no issues in terms of safeguarded individuals in that house.
Okay, very, very quick one from Ian, and that will be it.
Yeah, on a similar vein, Secretary of State, is the department doing anything to look at the position of estranged students who are estranged from their own parents, and what support that they're being given at the moment? You know, if the university is closed, but they're stuck in a university town and have nowhere to go back to.
Well, this is why we're very keen to work with universities at the earliest stage to make sure that those youngsters who are so vulnerable would able to sort of stay within accommodation and that weren't sort of being literally kicked out. And I think it's credit to the university sector how they've responded. It's also really important if we sort of look at a slightly younger age group of those children in care. I've asked all local authorities to make sure that children who are in care, who are coming up to the age of 18 and who are, there could be no worse time to be leaving care than at this sort of moment. And I'm wanting all local authorities to make it absolutely clear to any child who is in care that they do not have to be leaving care and that they'll continue to be supported at this time. And I think it's these actions that actually will make a real difference to young people and make their future life chances.
So we've just had a last minute bid from Tom. So Tom, please.
It's just I've got a university in my constituency, and I have been contacted by the student union, a number of students who, because there's no courses, it's all online. They're not currently in their student accommodation, and they haven't been for a while, and they won't be for a while longer. So probably about 3 months, 4 months potentially. They haven't been in their student accommodation yet. They're still being expected to pay full rent there. So a lot of them are sort of fairly concerned about that, and I was wondering if the government had a view on that.
So in terms of universities, halls, we've been very keen to make it absolutely clear that we certainly hope that universities aren't charging students for that accommodation. Obviously, in terms of private landlords, the government has set up a sort of a number of schemes in terms of actually supporting people that are in those private agreements, and we very much hope that people look at those as to how they take access to them. But we've been consistently very clear with universities and people who provide halls of residence as to the approach that we would like them to take.
Thank you, everybody. Thank you very much, Secretary of State. I'm guessing with the announcement now of the new child of the Prime Minister and Carrie, I'm guessing there'll be a big focus on early years with the department in the coming months. But I really do appreciate what you've done, and also we thank teachers and support staff. We also thank the thousands of DfE officials who would be working overtime to try and solve these very, very difficult issues. But I do appreciate you sitting here for over 2 hours answering a sustained barrage of questions on a huge range of issues, and wish you well. Wish you well over the next few weeks. But as you can see, the focus of the committee is on the left behind children and pupils and students, and particularly the faring of how the vulnerable are going to fare in the aftermath of this crisis. Thank you very much for coming today. Order.
Education Committee, 29th of April. 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 Education Committee, 29th of April.
Secretary of State.
Thank you, Mr. Speaker. In these early stages, DFID has led the world, as I've said, in its commitment to supporting those organisations that can reach into those most vulnerable communities, into the refugee camps and so on, and 75 million to WHO, who have access there, 25 million to UNICEF and 20 million to UNHCR as initial commitments, we hope will help those most able to reach the most vulnerable as quickly as possible.
We're going back across to Sarah Champion. Sarah Champion.
Thank you, Mr. Speaker. Bond's recent COVID-19 survey reveals that 86% of UK NGO members are cutting back or considering cutting back in-country work. So how is DFID making sure that 30 years of work in alleviating poverty doesn't unravel as health systems come under more strain in lower income countries?
Bruce State.
Thank you, Mr. Speaker. The Honourable Lady is absolutely right that there is a real challenge here for those of us who are committed to helping those vulnerable countries to become stronger and more self-sufficient. We have had to bring some of our team home, but many are still in country, and indeed for all those who are, we are finding as many ways as we can to support in country, both from the economic side and the healthcare side, to make sure that those countries don't fall over, and that the work that has been painstakingly built up to help them develop strength and self-security will not fall backwards.
We have a substantive question. Lawrence Robertson.
Thank you, Mr. Speaker. The devastating locust outbreak in East Africa has paralysed communities that are already facing the daily threat of starvation. With British expertise and funding, we are supporting the international effort to track, stop and kill dangerous swarms of locust. With rising temperatures driving these infestations, Britain is stepping up to help vulnerable communities prepare for and adapt to the catastrophic impacts of climate change.
Lawrence Robertson, over to Lawrence Robertson.
Thank you, Mr. Speaker. As the Secretary of State has said, already millions of people live in food insecurity in East Africa. There's been poor seasonal rains recently and then the locust infestation. So can the Secretary of State therefore use the DFID budget in order to provide food aid of a nutritional quality to people who, through no fault of their own, face the most basic problem very urgently?
Secretary of State.
Thank you, Mr. Speaker. DFID programmes are supporting enhanced regional trade and access to nutritional food in East Africa. In Ethiopia, the UK is supporting the Productive Safety Net programme to provide food and cash to 8 million of the poorest, and the UK's recent £12 million contribution to UNICEF will provide malnourished children with nutritious food. We continue to work with governments in the region to ensure that essential supplies reach those in need.
We have a substantive question, Marco Longe. Secretary of State.
Thank you, Mr. Speaker. The Government is steadfast in our commitment to ensuring girls throughout the world receive 12 years of quality education. As well as supporting multilateral education programmes, the UK Girls Education Challenge, with projects that span 17 of the world's poorest countries and reaching over 1 million marginalised girls, is responding to the current pandemic. British expertise is working so that schools are able to reopen when it is safe to do so without further delay.
Go across to Marco Longe. Marco Longe.
Thank you, Mr. Speaker. Does my right honourable friend agree with me that whether you are in Dudley or Malawi, one of the key success factors impacting on children's education is for parents to understand the value of education? And if so, what is the government's approach in relation to this specific point?
Secretary of State.
Thank you, Mr. Speaker. As we all know, parents are a key success factor in children's learning around the world. UK aid programmes draw on evidence which shows that school attendance and learning can improve when parents and children know about the benefits of education to incomes and have local information about the choice of school quality. DFID programmes also address the cost and time barriers to education, especially for girls, to promote the vital role of teachers in children's learning.
We now go across to Yasmin Qureshi. Yasmin Qureshi.
Hello? Thank you, Mr. Speaker. We know that the Ebola showed the wider impact of infectious diseases on women as schools closed and teenage pregnancies spiked. But the impact of COVID-19 will be even greater in an ever-populated refugee camps. In Bangladesh, nearly 1 million Rohingyas now live in very cramped conditions in the Cox's Bazar, 70,000 people per square metre. In this tiny area, women's education suffers, but we'll also see a rise in gender-based violence, similar to the current pattern in the United Kingdom. What specific action is the Secretary of State taking to deal with this issue?
Secretary of State.
Thank you, Mr. Speaker. The COVID crisis has removed 1.5 billion children from school, putting the most disadvantaged girls at risk of dropping out of school permanently. School closures will significantly reduce learning hours, particularly for the most disadvantaged children, and we risk many dropping out permanently. Prior to the crisis, 258 million children and young people were already out of school globally, and over half of them girls. The Ebola crisis showed us that female pupils bear the brunt of school closures during disease outbreaks, leading to higher levels of sexual exploitation, abuse, teenage pregnancy and early marriage. So we will continue to prioritise, as part of the international response, education for all.
We now call Minister Morton, who will answer the substantive question tabled by Elliot Colburn. Minister Horden.
Thank you, Mr. Speaker. Science can help us deal with this crisis. To date, the UK has committed over £313 million into innovative research and development of vaccines, rapid diagnostics and promising therapeutics for coronavirus. The UK is the world's top donor to CEPI, which is helping produce a vaccine, including at Oxford and Imperial. We're also funding innovative research on virus tests and antibody tests right here in the UK, which could be suitable for use in developing countries. On Friday, the UK proudly stood with the WHO, the UN and 20 countries to work for global access to vaccines to end the pandemic, save lives and start the global economic recovery.
Okay. And this is a group question, but I go over to Elliot Colburn. Elliot Colburn.
Thank you very much, Mr. Speaker. And Carshalton and Wallington residents know that the development of a coronavirus vaccine is the greatest opportunity to save lives across the world. So I'd be grateful if the Minister could confirm that the UK is one of the largest global donors to the International Coalition Epidemic Preparedness Innovations, who are at the forefront of this global research.
Minister.
Thank you, Mr. Speaker. I can confirm that the UK Government has committed £250 million to the International Coalition for Epidemic Preparedness Innovations, or CEPI, to rapidly develop coronavirus vaccines. This is the largest contribution of any country to CEPI's COVID-19 efforts to date and is a major contribution to global efforts to accelerate vaccine discovery and in ensuring a vaccine is available to all, including the world's poorest countries. We're asking all governments to contribute to this important international goal as a down payment against the wider funding needs of the COVID-19 response.
We now go over to Steve McCabe. Steve McCabe.
Mr. Speaker, we've all witnessed the battle for access to the drug Orkambi for children in this country. What consideration has the government given to requests for a patent-free vaccine, thus ensuring that the millions of pounds ploughed in by British taxpayers recognises the truly global nature of the crisis and does secure a vaccine for all, rather than a fight over excessive pricing and huge profits for 4 or 5 pharmaceutical corporations?
Minister.
Thank you, Mr. Speaker. This is a very important point because, of course, a globally accessible vaccine alongside effective tests and treatments is needed to end this global pandemic and to start global economic recovery. This will need an unprecedented global collaboration and resourcing to drive the speed and scale that's needed. And the UK is at the forefront of global efforts to meet this challenge. Now is the time for us to come together to develop and deliver vaccines, tests and treatments that are safe, effective, affordable and accessible to all.
We now go over to Henry Smith. Henry Smith.
Thank you, Mr. Speaker. The UK is the World Health Organization's second largest funder, yet that agency has been found wanting and subject to political interference by the Chinese Communist Party. After this pandemic, will the government look at a new World Health Order, as suggested by the recent Foreign Affairs Committee report?
Minister.
Thank you, Mr. Speaker. The honourable member is right to recognise that international cooperation is absolutely vital to tackle COVID-19, and that's why we are working with the WHO and other international organisations to develop and deliver a globally accessible vaccine alongside effective tests and treatments. And it's because of this that we want to ensure that they are safe, effective, affordable and accessible for all, including the world's poorest.
We now go across to Preet Kaur Gill. Preet Kaur Gill.
Mr. Speaker, this week is World Immunisation Week, and every year millions of lives are saved thanks to immunisations, and it is recognised widely as one of the most successful and cost-effective health interventions. And with DFID funding going into the global effort to tackle this health crisis, can the Secretary of State explain what safeguards she has implemented to ensure UK public contributions to the research, development of COVID-19 diagnostics, treatment and vaccines will be guaranteed to every person, and assure the British public that public money isn't just going into lining the pockets of big pharmaceutical companies?
Minister.
Thank you, Mr. Speaker. Of course, whilst we are focusing on COVID-19, there is the broader issue of vaccines. And the UK is already one of the biggest global donors. And to date, we have pledged £744 million to support the international response in terms of COVID-19. We have also funded £40 million into the Wellcome Mastercard Therapeutics Accelerator Initiative, up to £23 million to the funding for foundation for innovative new diagnostics, and up to £5 million through the Joint Initiative on Research for Epidemic Preparedness. Because where we're faced with a global pandemic, we absolutely need an international response, and it is about making sure that vaccines reach all those who need them.
We have a substantive question. Robert Coach, Minister.
Sorry, Mr. Speaker. We will always stand by the overseas territories, Mr. Speaker. A range of government departments led by DFID and the FCO are supporting the overseas territories to mitigate the impacts of the pandemic. Support includes essential medical supply, public health advice, security and access support, and financial aid to mitigate the economic impacts in the most vulnerable territories.
We go across to Robert Coates. Robert Coates.
Thank you, Mr. Speaker. The Royal Navy is providing a pivotal role in providing medical assistance to the British Overseas Territories. Would the Minister join with me in recognising the dedication and skill of the servicemen and women of RFA Argus, which is providing that medical assistance to the Caribbean?
Minister.
Mr. Speaker, I know the Honourable Member for Witney takes a keen interest in defence matters, and I absolutely do agree with him that the Royal Navy continues to provide great service to the territories, particularly in the Caribbean. I also commend the servicemen and women of RFA Argus who are providing vital support to the overseas territories. RFA Argus is boosting the resilience of the territories as they prepare for hurricane season. The FCO and DFID are providing further support to the territories to help deal with the impacts of COVID-19. And in addition, MOD security assistance teams will also be supporting local authorities in some of the territories as they respond to the coronavirus.
Substantive question, John McNally, Minister.
Thank you, Mr. Speaker. Hand washing with soap and water, as we are all recognising, is the first line of defence against coronavirus transmission. The UK has world-leading commercial and scientific expertise on water, sanitation and hygiene, and DFID has launched a £100 million scheme with British soap company Unilever to promote hygiene in developing countries, and has given a further £20 million to UNICEF to strengthen its coronavirus response in these areas. We're helping people around the world to defeat this virus.
John McNally. Over to John McNally.
Thank you, Mr. Speaker. The International Rescue Committee has highlighted that hand-washing facilities are absolutely crucial in preventing the spread of diseases in the developing world, with our experience of Ebola showing that NGOs currently working on the ground are best placed to scale up an emergency response. So I welcome the funding given to the Red Cross and others, but what plans does the Secretary of State have to increase funding to other local NGOs working within communities?
Minister.
Mr. Speaker, food hygiene is the single most effective action an individual can take to prevent COVID-19 transmission. This is an absolutely important point that has been raised. And water sanitation and hygiene is a key part of DFID's work and vital in humanitarian crises. DFID funds the provision of safe water and sanitation in disaster areas across the globe, and since 2015, DFID has helped over 51 million poor people in Africa and Asia get access to a drinking water supply or toilet for the first time, but we recognise there is still more to do.
Jessica Morden, substantive question, Minister.
Thank you, Mr. Speaker. The UK has long been a world leader when it comes to nutrition, which is why I'm looking forward to supporting the Nutrition for Growth Summit later this year. We're working hard to stop poor diets making people in developing countries more vulnerable to coronavirus, and we will not allow malnutrition to exacerbate the crisis. For example, we're working through UNICEF to get life-saving supplies to treat acute malnutrition in children across the Sahel, Somalia, Nigeria and Yemen.
We go across to Jessica Morden. Jessica Morden.
Thank you, Mr. Speaker. As the Minister said, malnourished people are clearly at a greater risk of serious health problems due to coronavirus than healthy people. How is DFID specifically supporting its partners to adapt their nutritional programmes in light of COVID-19 and working to minimise disruption to supply chains so we don't see a surge in malnutrition cases?
Minister.
Thank you. This is an important point, Mr. Speaker, and we know that for every percentage point contraction in global GDP from COVID-19, we would expect to see, sadly, a result in up to an additional 4 million stunted children, and acute malnutrition is likely to increase. Between 2015 and March 2019, DFID reached 50.6 million women, adolescent girls and young children with nutrition services in 25 countries, and this includes life-saving treatment for acute malnutrition.
I will now call Minister Dudridge to answer the substantive question tabled by Ben Spencer. Minister Dudridge.
With permission, Mr. Speaker, I'll group this question with question 12. Keeping supply chains open is essential for British consumers to access what they need. It will also help British business to bounce back quickly. We must protect the lives and livelihoods of people in developing countries that work in those supply chains. So we're working across government within the G20, the World Trade Organization and the World Bank on development-focused trade support, including flows of medical supplies. We're also working with British business to support vulnerable communities overseas that provide goods to the UK.
Spencer.
Thank you, Mr. Speaker. Domestic and international supply lines will clearly be crucial to both ours and the world's economic recovery as we bounce back from coronavirus. Is the Minister working with colleagues from the Department of Transport and BEIS to also support logistics firms such as those in my constituency and the vital role they perform in keeping our country running and open for international business?
Minister Dudridge.
Mr. Speaker, I thank the logistics firms across the country, but also particularly in Runnymede and Weybridge, for the work they do. This ministerial team will continue to work with the Department of Trade to keep supply chains open so that firms can restart exporting as soon as the operating context allows. We will also work with the Department of Transport and the Department for Business, Innovation and Skills to understand the impacts on UK logistics firms and the critical role they play in facilitating trade.
Across to Siobhan Bailey. Siobhan Bailey.
Thank you, Mr. Speaker. The pandemic is affecting supply chains across the world at the moment, including those who provide vital goods to the UK and businesses in Gloucestershire. What is my right honourable friend doing to make sure that the work in the affected industries in developing countries are supported during the crisis?
Minister Dudridge.
Thank my honourable friend for that question. We are engaging with businesses in the UK and developing countries to understand the challenges they face to protect incomes and livelihoods. For example, in Bangladesh, through the Better Jobs in Bangladesh programme, DFID will be supporting 1,000 factories and their workers to safely return to work when they're able to do so. We're also urgently examining what funding is needed and how we can have the biggest impact working in partnership with businesses and addressing these issues in the most vulnerable countries.
We now go over to questions to the Prime Minister, but on behalf of everyone in the House of Commons, may I say congratulations to the Prime Minister and Carrie Symonds on the birth of their son. Such happy news amid such uncertainty. 2020 is certainly a year they will never forget. I will call the First Secretary of State to answer the engagement question. I call James Cartledge virtually.
Thank you, Mr. Speaker. And can I join you in sending heartiest congratulations to the Prime Minister and to Carrie on the birth of their son. It's wonderful news, and I'm sure he'll bring them great joy in these difficult times. On coronavirus, surely we should not underestimate the significance of getting to what we hope is the peak of the outbreak without the NHS being overwhelmed. To do that, we've had to take the difficult but unavoidable decision of putting elective surgery on hold for many people. So can I ask, what more can we do to free up the NHS so that our constituents with cancer and other serious non-COVID conditions can start being treated again as soon as possible and in significant numbers?
Both things is engagement. First Minister.
Thank you, Mr. Speaker. I've been asked to reply on behalf of my right honourable friend, the Prime Minister. As members will have seen, as Mr. Speaker has explained, the PM and his fiancée, Carrie Symonds, have announced the birth of a healthy baby boy this morning. Both mother and baby are doing well, and I'm sure the whole House will want to join with me in sending congratulations and our very best wishes to them. Mr. Speaker, the whole House will also want to join me in paying tribute to the 85 NHS workers and the 23 social care workers who have very sadly died from coronavirus. My deepest sympathies are with their family and their friends at what is an incredibly difficult time, and we will continue to do whatever it takes to support them. Mr. Speaker, I'm sure the whole House will also want to join me in wishing Captain Tom Moore, who has done so much, raising £29 million for NHS charities together, a very happy 100th birthday tomorrow. His life of service for his country and his dedication to helping others is an inspiration to us all. Can I thank my honourable friend for his question? And of course, as he notes, it's because we've taken the right measures at the right time that we have flattened the peak of this virus. We have prevented the NHS from becoming overwhelmed. The two single most important elements of this strategy that we've delivered, that has meant the NHS has had capacity to deal not just with COVID-19 patients, but other urgent treatments. And he's also right to say that as we move forwards towards a second phase, we must plan to ensure the NHS is able to deliver elective surgery and treat patients with other conditions, which is exactly what we're planning to do.
I now go over to the Leader of the Opposition, Keir Starmer.
Thank you, Mr. Speaker. Can I add my congratulations and the congratulations of the Labour Party, and I'm sure everybody in this House, to the Prime Minister and Carrie Symonds on the birth of their baby boy. Whatever differences we have in this House, Mr. Speaker, as human beings, I think we all recognise the anxiety that the Prime Minister and Carrie must have gone through in these past few weeks, unimaginable anxiety. And so I really hope that this brings them incredible relief and joy. Can I join with the words of the First Secretary on those that have died on the front line and what he said about Captain Tom Moore, an inspiration to all of us. Mr. Speaker, yesterday, an important set of figures was published about the deaths from coronavirus. First, the deaths in hospital, currently at 21,678. That's the number that's published every day. On top of that, yesterday, we saw the CQC figures for deaths in care homes for the 2 weeks ending last Friday. That was a figure of 4,343. And at the same time, the ONS figures came out for deaths outside of hospitals, outside of care homes, and that was a figure up to the 17th of April of 1,220. There's a bit of a complication because of the different dates, but that makes a total to date, Mr. Speaker, of 27,241 recorded deaths from coronavirus. And that's probably an underestimate because of the time lag. Behind each number, of course, is a family shaken to its foundations. Now, 6 weeks ago, on the 17th of March, the government's chief scientific advisor indicated that government hoped to keep the overall number of deaths from coronavirus to below 20,000. He said that would be good, by which, in fairness to him, he meant successful in the circumstances. And we're clearly already way above that number. And we're only part-way through this crisis. And we're possibly on track to have one of the worst death rates in Europe. On Monday, the Prime Minister said in his short speech that many were looking at our apparent success in the United Kingdom. But does the First Secretary agree with me that far from success, these latest figures are truly dreadful?
First Secretary of State.
Thank you, Mr. Speaker. Well, first of all, can I welcome the various points of solidarity between our front benches in relation to, of course, the new baby boy for the Prime Minister and Carrie Symonds, but also in relation to care workers and NHS workers who have lost their lives. He's right that there is a challenge in deciphering the difference between the different figures because of the time lags in relation to the care home deaths. Equally, I know it's something that on all sides we have wanted to deliver, which was clearer breakdown and distinction between care home deaths and deaths in the NHS, and I think that is progress. He mentioned the target of 20,000. Of course, this is an unprecedented a pandemic, a global pandemic. And I think in fairness, we shouldn't criticise either the CMO or the Deputy CMO for trying to give some forecast in response to the questions that many in this chamber and indeed in the media are calling for. But the reality is we know a lot more about the virus, both domestically and internationally, than we did before. I absolutely share his, I guess, our joint horror at the number of deaths. Tragedies, each and every one. Equally, I'm going to disagree with him that it is far too early to make international comparisons on a per capita basis. I think we're already seeing that there are different ways that deaths are measured, not just in the UK in the different settings, but across Europe and across the world. And of course, this is a very, as I've said, delicate and dangerous moment in this pandemic, which is why, with the greatest respect, I think we do need to wait until we've got further evidence from SAGE before moving towards a transitional phase or a second phase. And it would be irresponsible right now and to start setting out in detail what proposals we might come up with in advance of having that advice from SAGE.
Keir Starmer.
Thank you, Mr. Speaker. Can I make clear I wasn't criticising the experts. I was pointing out the difference between what had been hoped for and where we'd got to. I do welcome the clearer breakdown of figures, which I think we're going to get from this afternoon onwards. I also welcome the fact that it appears, and I hope this is right, that the number of hospital admissions are going down and the number of deaths from coronavirus in hospitals are going down. We've all been looking at those graphs, and I hope that is continuing in the right direction. But from yesterday's data, it appears that that just isn't the case in care homes. They show that deaths in care homes appear to have been rising even while hospital deaths have been falling. And that's on the back, as the First Secretary knows, of concern for some weeks from the front line about testing in care homes and the speed of testing, about concerns about protective equipment and arguments that it's been too slow. We've all heard from the front line in the care sector expressions of real anxiety about the situation that they find themselves in. So can the First Secretary explain why he thinks that coronavirus continues to spread so fast in the care sector? And returning briefly to something from last week, but I think the First Secretary has already touched on it, could he give us the up-to-date figures for the number of those that have died on the front line in the healthcare staff and the number of social care workers? I raised it last week. I think he's given a figure, but just to confirm that.
First Secretary.
Well, can I thank the right honourable gentleman? I have already given those figures, and they are, of course, produced in the normal way, and he will be appraised of them just as he is in relation to the other figures. It's absolutely right to say that there is a challenge in care homes. In fact, when SAGE produced their advice and when the Chief Scientific Advisor and the Chief Medical Officer gave their 3-weekly review several weeks ago now, it was made clear that we had made good progress overall in reducing the level of community transmission, but there were still challenges both in hospital settings but also specifically in care homes. There are real challenges in care homes. The principal challenge in care homes, unlike in the NHS setting where we've made such good progress, is the greater challenge from a decentralised basis in terms of exercising control over the ebb and flow of people into those care homes. That includes residents, it includes care home workers, which sometimes work in different care homes. It also includes NHS workers and, of course, friends and family. That is the single biggest challenge in terms of reducing transmission. But I hope I can reassure him that we have a comprehensive plan to ramp up the testing in care homes. The eligibility was changed yesterday by the Health Secretary, to overhaul the way PPE is delivered to those in the front line, and we're also expanding the workforce by 20,000 through a new recruitment campaign. But there is no doubting, Mr. Speaker, and I will not shy away from saying in front of the right honourable gentleman that this is a challenge, but it is a challenge that we must grip and that we can grip to make sure that those in care, we can get the numbers down in care homes, as we've seen in hospitals and as we've seen in the country at large.
Keir Starmer.
Thank you, Mr. Speaker. Just on the back of that answer, I think on the MAR programme on Sunday, the First Secretary said that deaths in care homes were falling in line with those in hospitals. That doesn't appear to be borne out by the figures, unless there are some figures we haven't seen. I just wonder if the First Secretary could take a moment to clarify that when he next gets up. Yesterday was Memorial Day for all those who lost their lives at work. And it's really important that we honour and remember all those who died, whether from coronavirus or from anything else. But it's also important we redouble our commitment to protect all those at work. And that's why protective equipment for the front line is so crucial. Now, I recognise the challenge the government faces on this. I recognise that getting the right piece of equipment to the right place every time is very difficult. But lives do depend on it. And it is 10 weeks since the Health Secretary declared that there was a serious and imminent threat to life. And you'd hope that by now things will be getting better, not worse. Yet a survey of the Royal College of Physicians, published on Monday, reported that 1 in 4 doctors are still not getting the protective equipment that they need. And the RCP president was quoted in these terms, his words on Monday: "It's truly terrible that PPE supply has worsened over the last 3 weeks rather than improved." Now, I know that's not where the First Secretary or the government want to be, with indications from the front line that things are worse, not better. But he must recognise this is a plea from the front line. So can I ask the First Secretary, what's going on and how soon can it be fixed?
First Secretary.
Can I thank the right honourable gentleman? First of all, in relation to the care home data, obviously we've seen the latest data come out. There are some positive signs, but I think they're frankly within the margin of error, and we need to be very focused that there is a challenge in care homes and we've got a plan in place to grip it. So there's no sugarcoating that issue. I take exception with him suggesting that things are getting worse, not better. That is not true overall. We have shown through the social distancing measures the overwhelming commitment to them by the public and our efforts to ramp up capacity, particularly ventilator beds, critical care capacity in the NHS, that the two central limbs of our strategy, which is to flatten the peak that we're going through, which if we hadn't done, the death toll would have been even worse, and also to make sure that the NHS ability to cope, those two critical elements of the strategy have worked to date, and it's absolutely important that we keep up the effort on all of that. In relation to PPE, again, he must, when he addresses this, recognise that we face an international, a global supply shortage. Every country, when I pick up the phone as Foreign Secretary and I speak to leaders, foreign ministers, counterparts around the world, are facing this. And we are now the international buyer of choice. We have had 22 flights of PPE and ventilators from China just this month, in the last week, over 1.5 million masks from China, 3 flights from Turkey with gowns and face protection, 140,000 gowns from Myanmar, and we brought in Lord Dayton, the Noble Lord from the other place, Lord Dayton, to ramp up our domestic production, supply and distribution. So he's right, there is challenges on the front line. There's no minimising or sugarcoating any of those cris de coeur that he mentioned. I feel animated, inspired to do even better, but he needs to recognise on PPE that there is a global supply shortage, and we're doing absolutely everything we can to make sure that those on the front line get the equipment that they need.
Keir Starmer.
Thank you. I do recognise the efforts that are going on. The First Secretary says he takes exception to what I said about things worsening. I've tried not in this to base anything on my own personal opinion, because I don't think that's helpful. What I was quoting was the Royal College of Physicians, those on the front line. So it's not my view, it's their view. And I've tried to be careful to stick to the data and the evidence rather than just coming up with an opinion. Can I ask the First Secretary about testing? Now, it's clear there's been an increase in testing in the last week and since we were last at the dispatch boxes, and I welcome that. And yesterday, the government announced further extension and expansion of testing, and I welcome that as well. But there are obviously still significant problems. The government reported figures for Monday show a capacity to test of 73,000, which has gone up, it's the highest it's ever been, but only 43,000 actual tests were carried out. And when you drill down into the figures, only 29,000 people were actually tested. So the number of people tested was 29,000. Now, last week, the First Secretary said the problem was not capacity, but there was a lack of demand. I wasn't convinced, to be honest. But now we know demand's gone through the roof. We know sites were unable to cope with the numbers of people trying to book tests. So obviously demand isn't the problem. Yet on Monday, 30,000 tests that were available weren't used. Now, I'll have to recognise that the 100,000 a day by Thursday was only ever a staging post, and perhaps the exact date doesn't matter as much as some would think. On the March the 12th, 7 weeks ago, the Prime Minister made clear his plan, and his plan was to ramp up daily testing to 250,000 tests a day. I agree with him on that. I think that's the scale we should be at. So can the First Secretary clarify that the 250,000 tests a day is still a government target? And if so, roughly when he thinks the government will hit that target?
First Secretary.
Can I, Mr. Speaker, and I thank the right honourable gentleman, just on this issue of things getting worse. I understand the point he wants to make about PPE. It's an absolutely valid point, but I don't think it should be elided into the broader critique that overall things are getting worse. As we come through the peak of this virus, we start to get deaths down. We've got to focus on driving them down even further, and in particular making sure that we don't risk a second spike by increasing the transmission rate. And I think the right honourable gentleman could take time just to recognise our success on social distancing and critical care capacity, which has allowed that to happen. On testing, we now have 73,400 tests capacity every day. That is almost double from the point at which we were at the dispatch box last week. On daily tests carried out, the figure is now 43,563, which is up from well over double the 18,000 from the point at which we were at last week. In relation to capacity and demand, when we talk about demand, when the NHS talks about demand, they're talking about the numbers of tests actually carried out, people not just being willing to come forward, but actually being able to come forward. And what we've done to make sure that we ramp up the testing as swiftly as possible is not just the extension and the widening of eligibility last week, but we've gone further, and we've now said anyone who needs to go to work and says that they can't just work remotely and they have symptoms, we will widen the eligibility to them. Anyone over 65 with symptoms will also be able to action those tests, and of course it will be, and it comes back to his earlier point, available to all care homes, all care home residents as well as staff, whether they're symptomatic or not. This is incredibly important. We are on track to make huge progress, and of course he's right to say that the 250,000 target is still an aspiration. I'm not going to put a date on it, but the key point is the 100,000 milestone. Very important to me, we're making good progress, is only the first stepping stone towards testing, which is essential to the wider testing, tracking and tracing regime we'll need as we transition to the second phase.
Can I just gently say to both front benches, we're really going to have to put some speed up, so we'll not get anybody else in today. Keir Starmer.
Thank you, Mr. Speaker. The First Secretary invites me to recognise the good work on social distancing and on critical care capacity. Can I do that unreservedly? It's been an amazing piece of work, particularly the ramping up of capacity, and I send my thanks to all of those that have been involved in it. I'd absolutely recognise it. Mr. Speaker, the reason I've raised these issues is because they're vital to controlling the virus, protecting lives, and so that we can get to an effective exit strategy. The public need to know what's going to happen in the next phase. And on exit strategy, I want to be absolutely clear with the First Minister. I am not asking for lockdown to be lifted. We support the government on lockdown and will continue to do so. So I'm not asking for that. I'm not asking for a time frame. The government says it can't give a time frame. I accept that and we support the government on that. I said I wouldn't ask the impossible and I won't. What I'm asking for is the government to be open with the British people about what comes next. That's crucial for three reasons. We need their trust. Secondly, the government itself, the public, schools, businesses, trade unions need to plan ahead, and they're saying that loudly and clearly. Third, and frankly, we'd like to try and support the government strategy when we know what it is. I think it's important for us to do so if we can. We can't do that if the government won't share its thinking. The Prime Minister said on Monday that he wanted maximum transparency. Will the First Secretary give us some now and tell us when the government will publish an exit strategy?
First Secretary.
Can I thank the right honourable gentleman? I'll just remind him that, as I set out on the 16th of April, SAGE advised against any changes to social distancing measures at that point. The reason is that they would risk a substantial increase in the infection rate. SAGE is reviewing the evidence again in early March. He's asked for a time frame and a date. We can't give it until we have the SAGE evidence. If he thinks there's things that we could be announcing, whether it's along workplace, which you referred to, schools or otherwise, feel free to propose those things. But I would just gently say that based on the advice and the evidence that we had from SAGE, which he said he wants to closely follow, it would be very difficult for us to responsibly set out those proposals before we've had that subsequent advice from SAGE, both on the rate of infection, the death rate, but also the measures it would be responsible to make. And that's why, with the greatest respect, and I understand he's trying to be constructive, we can't be pulled in to making proposals in advance without SAGE opining.
Keir Starmer.
Mr. Speaker, the problem with the First Secretary response is that it risks the UK falling behind. France, Germany, Spain, Belgium, New Zealand, Australia, Scotland and Wales have all published exit plans of one sort or another. The First Secretary said, well, what are the proposals? What should they cover? If you look at those plans, as he's done and I've done, it's clear that there are common issues such as schools reopening, business sectors reopening. These are the issues that, if he wants me to put them on the table, I absolutely will, because they're clearly the issues that need to be addressed. There will be other issues, of course, but delay risks not only falling behind other countries, but also the successful four-nation approach so far. We want to support the government on an exit strategy. We want to support the four-nation approach so that we can all exit across the UK at the same time and hopefully in the same way. So I asked the First Secretary if the government will work constructively and openly with the opposition on the question of what happens at the next stage.
First Secretary of State.
And I thank the Right Honourable Gentleman. We certainly will engage, and I've enjoyed the telephone calls with opposition leaders, including himself. But can I also just gently say that if he's suggesting that we can set out concrete proposals now, despite clear evidence and advice from SAGE, that we should wait for their review of evidence in the next week or so, I would gently say that is the wrong thing to do. And if he thinks he knows better than SAGE and the scientists that have suggested that, he needs to explain it. He talked about the Scottish Government. The Scottish Government have not set out an exit strategy. I read through very carefully their 25-page document. It was eminently sensible, and it was grounded in the 5 tests that I set out on the 16th of April. He talked about some of the other European countries, but he will know, because I know he's an assiduous follower of the international evidence, that Germany is now having to think twice about easing up on the measures because of the risk of a second spike. This is exactly the risk that the Governor of the Bank of England referred to last week, that I referred to on the 16th of April, and that SAGE and the scientists have been referring to. And I just, again, the Right Honourable Gentleman is trying to, and is succeeding in engaging in a very constructive way. He has a strong professional reputation when he was DPP for being guided by the evidence. That is much to his credit. Can I just gently say he shouldn't abandon that rigour now?
Sir Desmond Swade.
Will garden centres and nurseries be allowed to reopen in short order?
First Secretary.
I thank my Right Honourable friend for cutting straight to the chase. I totally appreciate the value of garden centres and nurseries. The current advice, as I've indicated from SAGE, was that relaxing any of those measures, including the ones that he refers to, would risk damage to the public health, our economy, and frankly the progress that we've made, the sacrifices so many have made, the lives that have been lost. But can I reassure him that they look specifically at garden centres, and we will continue, as I've indicated earlier, to keep the evidence on each individual measure under very close review.
We go across to the Leader of the SNP, Ian Blackford. Ian Blackford.
Thank you, Mr. Speaker, and can I send my congratulations to the Prime Minister and to Carrie Symonds on the birth of their son, and long life and happiness to the newborn. Mr. Speaker, we are 2 months away from the deadline on approving an extension to the Brexit negotiations. Michel Barnier has been clear. The UK is refusing to engage seriously on a number of fundamental issues. The government is shamefully gambling our economic future with a no-deal Brexit in the middle of a health emergency. Why is the government threatening to isolate our economy at the end of the year during the biggest economic crisis of our time?
First Secretary.
Can I thank the honourable gentleman and join with him in sending those messages of goodwill to Carrie Symonds and the Prime Minister and, of course, their new baby boy. I'm not sure I'd be quite taking the word of Michel Barnier for the state of progress in the negotiations quite as readily and as uncritically as the honourable gentleman has. But let's be very clear about it. Our position is unchanged. The transition period ends on the 31st of December. That is enshrined in law. There's no intention of changing that. And actually, what we should do now, given the uncertainty and the problems and the challenges coronavirus has highlighted for us, but also for our European friends, and I've worked extremely closely with our German, French and all of our other European partners, is focus on removing any additional uncertainty, doing a deal by the end of the year and allowing both the UK and the European Union and all of its member states to bounce back as we come through the coronavirus.
Ian Blackford.
Thank you, Mr. Speaker. What we should be doing is removing uncertainty, and we should be putting a stop to these talks. We should be making sure that we protect our businesses, and the failure by the First Secretary to rule out a no-deal Brexit should alarm us all. Mr. Speaker, the World Trade Organization predicts that world trade may fall by 32% this year. The IMF says the global economy will suffer its worst financial crisis since the 1930s, and the OBR warns that the UK economy could shrink by 35%. That means 2 million people are at risk of losing their jobs. Refusing to admit the inevitability of an extension isn't a tough or a clever negotiating tactic. It's a reckless and a foolish gamble. Will the Secretary of State embrace common sense and recognise the need for a Brexit extension, show some leadership, face down the hardliners in the Tory party, extend the Brexit transition and let us all get on with the job of tackling this health crisis together?
First Secretary.
Can I thank the honourable gentleman? So first of all, if his desire is to avoid more uncertainty, then the right thing for us to do is double down, get a deal by the end of this year. If his desire is to dig ourselves out of the economic challenges that we, the European Union, the world face, then the answer isn't to engage in protectionism, but to do this deal, give a shot in the arm to businesses on both sides of the channel, and that is what we're absolutely wholeheartedly focused on doing, and we're doing it as one United Kingdom.
Rob Roberts.
Thank you, Mr. Speaker. The company programme run by the charity Young Enterprise provides the opportunity for young people to apply their skills in real-world situations, working in teams to set up and run their own young enterprise company. My right honourable friend agree with me that providing financial education in our schools is a vital way of empowering young people and ensuring that we're able to further our Levelling Up programme across the whole country when we come out of this crisis.
Mr. Secretary.
Can I thank my honourable friend for raising this excellent programme. He's absolutely right. A strong understanding of numeracy underpins a young child's ability to manage money, for example, by calculating percentages or doing divisions. And this government's reforms have made a step change in progress for numeracy and literacy for those young children. But that needs to be backed up by the practical applications, and many organisations that support schools with financial education are adapting their programmes, and I think Young Monies is an excellent example of that.
We go over to Alan Dorans. Alan Dorans.
Thank you, Mr. Speaker. Will the First Secretary of State make a commitment today that when a vaccine for COVID-19 becomes available, the United Kingdom will take a leading role together with other nations to ensure it is distributed according to the needs of people across the world rather than on the basis of wealth?
First Secretary.
Well, can I thank the honourable gentleman? He's absolutely right. And we, as the Health Secretary announced, we've had trials announced very recently. We are taking a lead in the research and development, but he's also right to say, as my right honourable friend, the Development Secretary announced, I think, earlier in questions, we're also contributing to Gavi and CP, which is the international effort to make sure we can ramp up not just the international effort to find a vaccine, but to make sure that not only can we vaccinate all of the people here in the UK, but also in the most vulnerable and poorest countries around the world. And so I entirely agree with what he said.
Robert Coates. We go over to Robert Coates.
Thank you, Mr. Speaker. The government has pulled out all the stops in providing a range of timely financial support for businesses. But both as the chair of the Small Business APPG and in West Oxfordshire, I hear reports of businesses that are being denied help by banks that are falling behind regulatory systems rather than concentrating on the urgent need to get cash out of the door to the businesses that need it. Would my right honourable friend agree with me that as the nation makes sacrifices unheard of in peacetime, it's also time for the banks to do their bit?
First Secretary.
I thank my honourable friend, pay tribute to all he's doing to champion small businesses. We want to help all businesses, small, medium and of course the large ones in Witney and across the country, get through this incredibly difficult period and bounce back with confidence as we defeat the coronavirus. Through the coronavirus business interruption loan scheme, through the large business interruption loan scheme and the bounce back loan scheme, we're lending to businesses of all shapes and size. And the government has stepped up to the plate, and he's absolutely right that we expect the banks to do the same too.
We go across to Zara Sultana. Zara Sultana.
Thank you, Mr. Speaker. While working people are having to make huge sacrifices through this crisis, state support is available to big businesses that dodge taxes and pay millions to super rich executives and shareholders. Mr. Speaker, we should be bailing out the 99%, not the 1%. So will the government follow the likes of Denmark and stand up to big businesses by saying, if you want state support, you have to prohibit dividend payments and share buybacks, and you can't be based in a tax haven?
First Secretary.
Look, I thank the Honourable Lady. I have to say, I think if she looks at the package of measures that my right honourable friend, the Chancellor, has put in place in the round, she will see that not only are we dealing with small businesses, we're also helping those larger businesses, and they're important too. They're large employers, and we're doing everything we can to support innovative firms, which will now benefit from the offer of £1.25 billion, which is for high growth firms. So I think we should take, frankly, some of the partisan baggage out of this, focus on targeting the businesses that will create the growth, which will drive us through this crisis, and support the workers up and down this country who rely on those crucial businesses.
We go across to Robert Largan. Robert Largan.
Thank you, Mr. Speaker. The current crisis has shown just how important it is to have sufficient urgent care capacity in the NHS. I've been campaigning for new urgent care centres at both Stepping Hill Hospital and Tameside Hospital to help NHS staff provide world-class care to people in High Peak and across the region. Can the First Minister assure me that the government remains committed to building these badly needed new urgent care centres?
First Secretary.
Well, can I thank my honourable friend for the way he is championing the NHS in the tenacious and doughty way. I'm delighted that Stockport NHS Foundation Trust have been allocated close to £31 million for the provision of a new emergency care campus at Stepping Hill, one of our 20 hospital upgrades. And Tameside and Glossop Integrated Care NHS Foundation Trust have also been allocated over £16 million to provide emergency and urgent care facilities at Tameside General Hospital. Conservatives are the party of the NHS, with more money, more hospitals, more doctors and nurses, and that's one of the reasons we've managed, through our critical care capacity, to help protect the NHS from becoming overwhelmed by coronavirus.
Wes Streeting.
Thank you, Mr. Speaker. Can I, first of all, offer my deepest thanks to first responders from the Metropolitan Police and the London Ambulance Service who were greeted with the horrifying scene on Sunday night of an 18-month-old baby girl and 3-year-old boy brutally murdered in their own homes. There are no words of comfort that we can offer their grieving mother, but what the government can do is to do more to support people who are not safe in their own homes. I recognise the £3 million that's gone in to support children who witness domestic abuse and the £2 million that's gone in to support the domestic abuse hotline, but it's not enough and it's not quick enough. So in that spirit, can I ask the First Secretary of State to commit to providing the £75 million ring-fence fund that the Shadow Home Secretary has called for, so that in these darkest of times for people who are trapped unsafe in their own homes, they know that support is available?
First Secretary.
Can I thank the honourable gentleman and first of all say how appalled I am at the tragic case in his constituency. I pay tribute to the frontline emergency responders, but I absolutely, in total solidarity with the honourable gentleman, want to pass my condolences to the family around that terrible case. It sounds absolutely appalling. The police have been very clear that they will pursue perpetrators and anyone in immediate danger, and they should call 999. We're going through the coronavirus challenge. It's put pressure on the police, but they are there to do that incredible job that they do day in, day out. We do have the National Domestic Abuse Helpline staffed 24 hours a day. We're supporting charities and others supporting victims of domestic abuse with £750 million. He makes some interesting points about what more we could do. We're constantly looking to reinforce and strengthen the challenge of the response to domestic abuse, and he's right that there is a specific issue around it in relation to this crisis. The domestic abuse bill had its second reading yesterday, and that will help take our response to the next level, and also is an opportunity for him to make further proposals in due course.
Shirley Schwab.
Thank you, Mr. Speaker, and may I join in the congratulations to the Prime Minister and Carrie Symonds on the birth of their son. Mr. Speaker, I was recently speaking with a lady who, very sadly, lost her husband in hospital to COVID-19. She spoke of the fantastic care given to her husband by the NHS staff, but she also spoke of the incredible support that she and her family received from those same NHS workers. Would my right honourable friend join me in congratulating the NHS staff, not only for caring for those who are ill, but also for the wonderful support they give to their loved ones?
Mr. Secretary.
Can I thank my honourable friend? Can I first of all pass on my very deepest condolences to the widow in his constituency. I, along with other ministers, have the grim task of reading out the total death toll at these press conferences, and I always walk away ashen-faced at what this must mean for individual families up and down the country. He's right to pay tribute to the NHS, who are doing an amazing job, and all of us, I think, across the House, pay tribute to them and the care workers with our minute's silence in particular yesterday. But I think he's absolutely right also to say that they're not just there to treat the physical condition, whether it's of coronavirus or otherwise. They do an amazing job as providers of emotional support for patients and their families, and I think that's something which is too easily overlooked as we come through this crisis.
Going over to Geraint Davis. Geraint Davis.
Mr. Speaker, the UK opted out of the EU joint procurement of PPE, ventilators and medical equipment. Can the First Secretary confirm that whether this was a political or commercial decision, and take this opportunity to say that we will take any future opportunity to join any EU scheme that helps to safeguard supplies to our NHS in order to avoid any preventable deaths in our communities or in the NHS or care services?
First Secretary.
Thank the honourable gentleman. I mean, as you'll know, because it's been made clear by the government and clarified when it wasn't clear, the original issue was a failure of communication. We didn't get the original invitation to tender, if you like. It's very clear to us that the schemes in relation to the first batch of EU-wide procurement would not have made any significant extra difference or added any value to what we're doing here. I can tell him that we will look at any future procurement-wide initiatives, for example, on therapeutics. I can also just reassure him, one of the things that we're doing is working very closely with our European partners on returns and repatriations, and that's something where we have taken advantage of EU-wide schemes if it can help us share costs, and that's the collaborative internationalist approach that the UK government takes.
Mark Pritchard.
The sector is vital to Shropshire's economy, employing thousands of people, and notwithstanding his earlier response to my right honourable friend, can I ask that in any economic unlock, that in phase 1, that garden centres and nurseries, seasonal nurseries, will be allowed to open, albeit with careful and considered strict guidelines?
First Secretary.
I thank my honourable friend. Second plea for garden centres and nurseries is absolutely right, and I understand entirely why it's so important, both economically but also socially, particularly for certain members of our community for whom it will be an important means of getting outdoors and getting out of the lockdown. Sage has already considered it once. I know it will consider garden centres and nurseries again, and I know he will expect us to continue to be guided by the evidence, but he has made his point in a powerful way, and it's certainly very firmly registered that this is an important area for us to look at for the future.
Alex Cunningham. Go over to Alex Cunningham.
Thank you, Mr. Speaker. There's never been sufficient nursery places to meet the extra demand created by the Child Care Act 4 years ago, and now things are set to get worse. I've received a huge number of emails from local nursery managers and workers angry at the government for failing to take action to protect early years workers during the coronavirus crisis because they're not entitled to access the furlough scheme. What will he do to sort this out and ensure that these nurseries still exist once the crisis is over?
First Secretary.
Well, this is a hugely challenging time for nurseries as it is for schools and other small businesses. The Chancellor has set out the range of support that's available. It's widespread. It covers all sorts of different areas. But of course, in relation to nurseries or any other sector that is finding the challenges too much to bear as we go through this crisis, we will of course make sure we look at them afresh and see what further can be done.
Saqib Bhatti. Over to Saqib Bhatti.
Thank you, Mr. Speaker. I'd like to begin by echoing the congratulations that have already been given to the Prime Minister and his fiancée on the birth of the baby boy. I hope they're all in good health. Mr. Speaker, over the weekend, there was a double stabbing in my constituency. In light of this, will my right honourable friend join me in calling on the Police and Crime Commissioner to reverse his decision to close the local police station? And what reassurances can he give the House that as we emerge from this lockdown, we are protecting our communities from the scourge of knife crime?
First Secretary.
I thank my honourable friend, and it's a tragic but timely warning that some of the persistent social challenges that we face around knife crime or any other kind of crime will persist and not just stay at home because of coronavirus, although overall the level of crime has come down. Can I pay my very deepest sympathies with the families of the victim in his constituency, and can I reassure him we've committed to recruiting 20,000 more police officers over the next 3 years. We're making it easier for the police to exercise stop and search powers. We're ensuring that more perpetrators go to prison and for longer. He will know that it's for PCCs to decide on how and where to spend their resources, but I pay tribute to him for being a tenacious and doughty champion for the the crime issues and the policing that needs to take place in his constituency.
We go over to Alison Thewlis. Alison Thewlis.
Thank you, Mr. Speaker. Many businesses in my constituency and around the UK shut their doors on public health advice, and they're now finding that insurers are refusing to pay out on business interruption policies. So I ask again, will the UK government intervene and stand behind these claims so that no business loses out for doing the right thing?
First Secretary.
And I thank the Honourable Lady. I don't think it's the right thing to do to stand behind all of the claims, but we certainly do and continue to liaise with the insurance industry to make sure, as far as is legally and practically possible, they're showing the flexibility as people and particularly the consumers of those insurance policies come through this very difficult time.
We go over to David Mundell. David Mundell.
Mr. Speaker, I'm absolutely delighted to be able to connect with you this week. I've finally escaped from the Zoom waiting room, and in so doing, I can pass my congratulations to Carrie Symonds and the Prime Minister on the birth of their son. Mr. Speaker, I have a large number of haulage companies in my constituency, and I'm sure the First Secretary will recognise that lorry drivers are key workers during this crisis, transporting goods across our United Kingdom. However, many have struggled to access hot food out with their cabs, even to access toilet and shower facilities. So can the First Secretary ensure that we're doing all that we can to support lorry drivers as they carry out their important duties during this crisis?
First Secretary.
I thank my right honourable friend and say it's always good to see him, even via Zoom, or especially via Zoom. Can I thank all of the HGV and delivery drivers for all that they're doing in the country to keep us going. And I think across the House we'd probably agree that our view and our definition of key workers has changed as we come through this crisis, and there is an appreciation of people doing those gritty jobs day in, day out, and quite the extent to which we rely on them. All motorway service stations in England currently remain open to road users. That is why the Transport Secretary is continuing, based on the concerns he's rightly raised, to work with motorway service operators to ensure as many facilities within those individual service stations remain open as possible to make sure HGV drivers can take a break and use whatever facilities they need before they go back to work. And he raises an excellent point.
Dave Dugan, go across to David Dugan.
Thank you, Mr. Speaker. The Chancellor said of his COVID-19 response that we will not leave you behind, we all stand together. He then delivered a financial package that did leave behind hundreds of my constituents in Angus and thousands more across these islands by a government who will refuse to introduce a universal basic income, just like my constituent in Arbroath, who could not be furloughed by his former employer, and because of Treasury rules, neither can he be furloughed by his new employer. So now, after 44 years of working, he's been cut adrift as collateral by this government. What is the First Secretary's advice to my constituent?
Well, can I thank the honourable gentleman and just say to him, we don't support universal basic income, mainly because given our precious resources at such a challenging time, it wouldn't target it at those who need it the most. In total, Scotland will receive a cash boost over £3 billion to tackle the coronavirus. So the financial support from the UK government is going there. That's on top of the UK military support with things like mobile testing and the airlifting of patients from some of the island communities in Scotland. And we're also expanding testing capacity right across the UK with centres recently opened in Glasgow, Aberdeen and Edinburgh. We'll get through this crisis and we'll do so as one united kingdom.
Dame Cheryl Gillam. Dame Cheryl.
Thank you very much, Mr. Speaker. Can I associate myself with the remarks of the First Secretary and send congratulations to the Prime Minister and Carrie? Research from the All-Party Parliamentary Group on Autism found that before the coronavirus crisis, more than 2 in 3 autistic adults were not getting the support they needed. Sadly, in some areas, emergency powers to ease duties under the Care Act have had to be triggered. Can my right honourable friend guarantee that autistic people will not be disproportionately affected by these changes? And will he publish which councils have to resort to emergency powers?
First Secretary.
And I thank my right honourable friend. She raised a really important point. And of course, we want to make sure all autistic children or any other children with special needs going through this terrible crisis are as protected as we possibly can. I think when it comes to looking at the future arrangements for schools, on top of the key workers, we've got to make sure that we do as much as we can to protect vulnerable children and particularly those with particular needs. She talked about the funding going through to local authorities. Allow me to take that back, speak to both the Education Secretary but also the Community Secretary and make sure that we can come back with a specific answer on the particular points she raised.
Last and final question. We now go over to Sir Geoffrey Donaldson. Sir Geoffrey.
Thank you, Mr. Speaker. Could I, on behalf of the Democratic Unionist Party, echo and pass on our congratulations to the Prime Minister and Carrie Symonds on the birth of their son. The headline in this morning's Belfast Telegraph speaks about deaths for people who are not infected by the virus, people who have not been attending hospital and who desperately needed treatment. Will the First Secretary advise us of the measures the government intends to take to address this issue and to ensure that more people are able to attend for treatment, including cancer patients?
Secretary.
Can I thank the honourable gentleman and pay tribute to all the work he is doing and indeed the Northern Ireland Executive at this difficult time. He's absolutely right to raise the challenge within the NHS more generally of dealing not just with COVID-19 but the wider conditions that people have. The Chief Medical Officer has made it very clear we have the capacity, the plans that we put in place and that we delivered through the Nightingale hospitals, the ventilators, the critical care capacity is in place not just to deal with coronavirus but also to deal with other non-COVID priorities, whether they're urgent or whether they're other forms of treatment in relation to cancer or otherwise. And I'm certainly very willing to work with the Health Secretary and the Northern Ireland Secretary to make sure in relation to any particular challenges faced in Northern Ireland that we can deal with them and address them. And it's absolutely crucial as we go through this crisis that that NHS capacity is protected. And that's one of the reasons we introduced the social distancing measures and why it's so important that they've been so effective.
That is the end of Prime Minister's questions. We're now going over to a statement on repatriation of UK nationals affected by COVID-19. I call Minister Nigel Adams to make the statement and he's got up to 10 minutes to do so. Minister Nigel Adams.
Thank you very much, Mr. Speaker. With your permission, I would like to make a statement on the Foreign and Commonwealth Office's response to the COVID-19 pandemic. Our team of experienced diplomats here at home and in our embassies and consulates around the world continue to work around the clock using our unparalleled international connections to help overcome this unprecedented challenge. Now, since the outbreak in Wuhan, Mr. Speaker, our overriding priority has been to help British travellers get home safely to their loved ones. And we estimate that over 1.3 million people have returned to the UK since the outbreak via commercial routes. Now, this has been from countries across the globe. We've seen 200,000 British nationals return from Spain, and 50,000 have returned from Australia in the past month alone. Keeping commercial options running has required an enormous international effort. We've worked alongside airlines and foreign governments to keep vital routes open and ensure that domestic restrictions don't create a barrier to getting people home. But as you will appreciate, Mr. Speaker, as countries have increased travel restrictions, often without notice, commercial routes have ceased to be an option for some travellers. So thanks to a £75 million partnership between this government and airlines, we have now brought back more than 19,000 people on 93 charter flights organised by the Foreign Office from 20 different countries and territories. And in some instances, this will mean bringing home a few hundred passengers from small countries like the Gambia or remote locations like the outer islands of the Philippines. In other cases, this has meant returning thousands of British travellers, such as the 10,000 people returned home from India and 2,000 thus far from Pakistan. In the next week alone, we will bring back thousands more travellers on further charter flights, including from Bangladesh, Nigeria and New Zealand. Mr. Speaker, I'd also like to touch on cruise ship travel. More than 19,000 British passengers were aboard 60 cruise ships when the FCO changed their travel advice on the 17th of March. And working with those local authorities and governments and the cruise operators, the FCO has helped ensure these passengers were able to return home. We've provided consular assistance to many of them, and in some cases we've organised direct or supported charter flights for over 1,500 people. But for those people who have chosen to remain in place or are still trying to get home, our consular teams are providing support 24 hours a day. To ensure timely responses, we've tripled the capacity in our consular contact centres. Our broader consular effort has been centred around supporting British travellers right across the piece. We've worked with foreign governments to ensure that British travellers can continue to meet visa, immigration or documentation requirements while they're abroad, and we're offering financial protection as well, including through the same measures available to British workers and residents here at home, such as the Coronavirus Job Retention Scheme and access to mortgage holidays. We're making sure that British travellers have access to essential care, including food and accommodation, as well as medical care. This also includes psychosocial support, and we've been working with third sector and external partners to deliver this. And now, most UK insurers will extend their travel insurance cover, so British travellers actively trying to get home will be covered for emergency medical treatment if they're still stuck abroad for at least 60 days. Our efforts and our aims show that we're committed to helping every British traveller, no matter where they are in the world. And Mr. Speaker, I'd now like to turn to the FCO's role in procurement, particularly and specifically on PPE equipment. With so many other countries in similar circumstances, we are grappling with a global shortage in personal protective equipment. Yet thanks to the efforts of our domestic manufacturers and our work with international partners around the world, we've procured and distributed over 1 billion items to those on the front line. Lord Dayton, who helped organise the London Olympics, has been brought in to oversee efforts to boost our domestic supply even further. And in the Foreign Office, we're working tirelessly through our overseas posts to get medical supplies into the UK. Mr. Speaker, over 350 million items of PPE equipment have been procured through our China network alone, and we're working flat out to get orders delivered from, for example, Turkey and Egypt. We've also distributed over 1,500 ventilators, with thousands more ordered and on the way. And in the last week, we've received shipments of more than 4 million IIR masks and 1 million other masks. And by the end of today, flights will have touched down with more than 500,000 masks, more than 350,000 gowns, and more than 750,000 face shields. Meanwhile, the Foreign Secretary and my fellow ministers at the FCO are on calls with counterparts around the world every day, working to secure new deliveries from abroad with the support of our excellent and tireless diplomatic service. Now, from the start of this crisis, the UK has played a leading role in tackling the spread of the disease and the world's response to it. We are uniquely placed to do so as a member of the G7, the G20, NATO, the Commonwealth, United Nations, and as a major donor to the global health system. And as the Foreign Secretary laid out in his previous statement, our international strategy is focused in 4 key areas: securing a strong and coordinated global health response, particularly for the most vulnerable countries; accelerating the search for a vaccine, more effective treatments and testing; supporting the global economy, keeping trade open and securing critical supply chains; keeping transit routes, hubs and transport routes open to support the flow of freight and medical supplies; and, crucially, to bring our people home. I've outlined our support for bringing British nationals home, Mr. Speaker, but would like to touch on our good progress in other areas. We are helping vulnerable countries with their response to coronavirus by announcing up to £744 million in aid, including for R&D and support to the World Health Organization, UN agencies, NGOs, and the Red Cross. And today, my right honourable friend, the International Development Secretary, also announced a funding pledge equivalent to £330 million a year over the next 5 years to Gavi, the Vaccine Alliance. This will fund the immunisation of 75 million children against other deadly diseases, supporting the world's poorest countries so they can cope with rising coronavirus cases. On the COVID-19 vaccine, this government has already committed £360 million as part of our domestic and international effort. This investment includes £250 million to the Coalition for Epidemic Preparedness to support coordinated global research. This is the single largest contribution by any country. And we are helping to keep vital trade routes and supply chains open by coordinating closely with allies and partners in the commercial sector. And finally, Mr. Speaker, the UK has a responsibility to protect the safety and the security of the people of overseas territories, most of whom are British nationals. So we've been providing tailored support to our overseas territories, ensuring that the appropriate resources are provided to them during the coronavirus response. Mr. Speaker, the scale and impact of this pandemic has been unimaginable, but working alongside our international partners, the UK has been able to demonstrate the kind of leadership, cooperation and collaboration that will get us through this crisis. And I commend this statement to the House.
We now go over to virtually Lisa Nandy over in Wigan and welcome her to a new position as Shadow Foreign Secretary. Lisa Nandy.
Thanks very much, Mr. Speaker. I can confirm that it is as sunny as always in our neck of the woods. Can I start by thanking the Minister for advance sight of his statement and for the weekly briefings that have allowed us to work together over recent weeks to bring some very vulnerable people home. And in that spirit, can I turn to a number of issues that his statement did not address so that we can begin to resolve those too? I am deeply concerned that weeks after Britons were advised to return home by the government, there's still no accurate assessment of who is stranded and where. On Monday, the Foreign Office came up with a figure of 57,500, and yet I've been told repeatedly that there can be no accurate assessment because while some embassies record those who approach them for help, others do not. We do need to know who who is stranded and where? So will he now ensure that his department counts and publishes those statistics so we can rapidly bring those numbers down? I was very glad to hear that the numbers returned on charter flights are up to 19,000 on 93 flights. And I again place on record my thanks to our diplomats, embassies and consular staff. But this is still frustratingly slow by comparison with other countries like Germany, who by early April had repatriated 60,000 citizens on 240 charter flights. By chartering 20 times the number of flights, they were able to bring their citizens home weeks ago. And I would like to place on record my thanks to Germany and to other countries who've offered spare places to stranded Britons on these flights. But I'm sure he understands why people are upset and frustrated that their government hasn't done the same. Now, I know that the government was keen to reduce costs, but this reliance on commercial flights has left far too many British people at the mercy of cancelled flights, airline strikes, extortionate prices, domestic lockdowns and chaotic booking systems. So can he today commit to rapidly scaling up the number of charter flights? It's not clear to me what the barrier still is. 90% of the country's commercial fleet is currently grounded. The RAF stands ready to help. Other countries have the same problems that we do. And in recent weeks, I've spoken to many global leaders who say that there is a willingness to work together internationally to open airspace and keep those transit hubs operating. Now, I know that he is doing his best, but this is quite unlike the problems the government has had with testing or PPE. We have the capacity to do more and we must. There are many people on those charter flights who've told me that they're being charged up to £1,000 a ticket. So it'd be helpful to understand where that £75 million the Foreign Secretary announced has gone. Has it been spent? And if so, what on? And after the Foreign Office website this week suggested that Britons in New Zealand might be better off staying put until the crisis is over, can he commit that all British people who need it will be not just helped, as he suggested, but repatriated, and the cost will be no barrier to bringing our citizens home? I also suggested to him last week that it be made easier to apply for emergency loans and that people be allowed to claim universal credit from overseas. He gave me a very enthusiastic response. Can he update the House on progress with this? Can he also tell us what support is being provided to non-UK nationals, many of whom have lived and worked in Britain for decades? Many that I'm in touch with are extremely vulnerable. Others are NHS workers who are desperate to get back to the front line, but some of them have been told that they are at the back of the queue, while others have been told to contact other countries' embassies for help. Now, we were recently shamed by the treatment of those who made Britain their home and have lived and worked here for decades, and we mustn't allow this to happen again. So I hope he'll take this opportunity to reaffirm our commitment to those non-UK nationals and guarantee them the same rights to return home. Finally, I'd like to ask him about the mixed messages that those returning home are getting. At the weekend, a government source told The Telegraph that a 14-week quarantine period would be introduced. When the Foreign Secretary was asked, he simply said, "I don't know." Yesterday, the Transport Secretary wrote to MPs to tell us that targeted screening measures had been carried out at UK airports, but that these have now been stopped. This is really worrying. There are people entering the UK from countries where infection rates are rising, access to healthcare is limited, and preventative measures are non-existent. They are travelling back to their families on public transport. This is surely not sensible. We've discussed this several times. It is frustratingly one of the areas where we've been unable to make progress. And the UK is now a major outlier on this. South Korea, the Netherlands, Greece, Lithuania, Singapore all have self-isolation requirements in place. We must have clear advice for those returning to the UK, a quarantine period and testing on return to limit the spread of the virus. Can he commit to this today? And if he can't, will he take this away and ensure it's acted upon? As always, I am ready and happy and willing to offer assistance and support where I can.
Minister.
Thank you very much, Mr. Speaker. And through you, can I congratulate the Honourable Lady on her appointment and also for the spirit in which she has cooperated. We do speak regularly with our weekly phone calls. I think we're due to have one tomorrow where we're able, myself and officials are able to update her. And I've been nothing but impressed with the Honourable Lady's constructive approach to this very difficult matter. But could I just try and answer some of the points that she's raised. I'm sure she'll remind me tomorrow when we have our phone call if I didn't get around to answering all of them. She talked about the data and posts having that information on the number of people who want to return home. Our best estimate at the moment is around 50,000 people, and hopefully by the end of today we will have passed the return of 20,000 British nationals on the charter flights. We will obviously update the Honourable Lady with the numbers tomorrow. It is tricky collecting all the data. I won't pretend that it's not, but I can assure her when we do have that information, we will keep the Honourable Lady updated. I just would like to politely, in the kind of best spirit possible, politely remind the Honourable Lady when she was referring to the number of people that have been repatriated by other countries. Of course, other people have taken slightly different route on getting people home, but can I just remind the Honourable Lady and the House that over 1.3 million people have come back to the UK since the start of the outbreak. That's a phenomenal number of people. We have worked with the commercial sector to ensure that routes are open, ensure that flights are available. And clearly now we are focusing on those countries where there are large numbers of British nationals and where there aren't commercial flight options. So I would hope that she would recognise that our strategy of working with the commercial sector initially has paid dividends. We're now focusing on our charter efforts. We are indeed prioritising British nationals on these repatriation flights. That's our first priority, those that are vulnerable and those that faced the greatest risk. This might be because a country doesn't have a health service that's comparable to the NHS, but we always do our best to consider making space available for others where there are, not least those who are, as the Honourable Lady mentions, key workers, in particular NHS, where we can, where possible. She also mentioned about the advice that those returning to the country have been getting. It's absolutely the case that people booking onto these flights, anybody who is symptomatic cannot take a charter repatriation flight organised by the UK government back to the UK. That's absolutely clear. They won't be allowed on the plane. They're given advice on the plane in terms of what they should do. Anybody arriving in the UK on a flight or from another country should follow the current Public Health England advice, specifically regarding social distancing and self-isolation. We've continually tested strategies with scientists, such as quarantining those coming from abroad, to make sure we're able to take any measures which are necessary. And I would point out to the Honourable Lady that as we consider transition to the next phase, the second phase, we will be looking at these issues. We've already had discussions with other departments across government to make sure we're taking all necessary measures to preserve our way of life and to protect people.
We now go over to the Chair of the Select Committee, Tom Tugendhat. Tom Tugendhat.
Thank you, Mr. Speaker, and thank you very much for calling me to speak today. Can I just say congratulations, of course, to the Prime Minister and Ramadan Kareem to so many in our community who are celebrating the holy month at the moment. May I ask the Minister what improvements he's going to make to the communication system that he's been using to communicate with British people around the world? In the Foreign Affairs Committee, we've been holding a survey which is online on the Parliament website at the moment to ask people what their experience is, both good and bad, of being repatriated to the UK. And the main issue that we found is the inability or the difficulty with which some people have been communicated with when they're abroad. There are good examples, like the High Commission in Kenya, and there are difficult examples, like the High Commission in India. And seeing how we improve that would be important for the whole community.
Thank you, Mr. Speaker. The Chair of the Select Committee raises an incredibly important point, because the most important thing, if you're a UK national, you're stuck abroad, you're concerned, your flight's been cancelled by your operator, you want to have some assurance that the government is on your side and is going to assist you, and communication is absolutely crucial. I totally accept at the start of this crisis that our comms in some parts of the network wasn't as good as it should be. There are some brilliant examples which the honourable gentleman refers to. I'd also point out to our post and the great work that our High Commission in New Zealand has been doing in terms of communicating. We have put an awful lot more effort into ensuring that our embassies and our consulates up their communication game. It's so important because if you're, as I say, if you're stuck, you want to make sure that at least you are being, even if there's no news, you are getting some information. So I totally accept the honourable gentleman's point.
We now go across to the SNP spokesperson. We now go across to Alan Smith, who has 2 minutes. Alan Smith.
Thank you, Mr. Speaker. It's good to see you virtually. I thank the Minister for sight of his statement in advance, and on a consensual point, I'd very warmly welcome the announcement of funding for the vaccines network, the Gavi programme, which the SNP called for some time back, and glad to see we're in agreement. That's really going to do a lot of good in the world. On repatriation, without getting into the specifics of it, I have to echo a number of the concerns raised already in this discussion. I myself have praised the work of FCO officials who are working really hard under tough circumstances. But I have to say this statement seems rather more Panglossian than the experience of a number of my constituents, and I'm quite sure of constituents across the House. Can the Minister commit to an inquiry into the FCO handling of this issue in due course so that we can learn lessons for the future, not least focusing on the issue of the defunding of the FCO network, which has left it really at a loss that it didn't have the capacity to cope with this. But can also touch on the procurement aspects of this statement, and I'm struck that it didn't make a single mention of the EU procurement issue. There was a quite remarkable session of the Foreign Affairs Select Committee recently where Sir Simon MacDonald had to clarify his clarification, and reading from the letter, he said quite explicitly, ministers were not briefed by UK mission on the EU's joint procurement agreement. He then goes on to say, owing to an initial communication problem, the UK did not receive an invitation in time to join the COVID EU procurement response. Now, forgive me, it seems quite inconceivable to me that UK mission did not make London, call it that, aware of the existence of these schemes. So can the Minister perhaps clarify, were officials in London briefed by UK mission on the existence of these schemes? And can he assure us that where there was an initial communication problem, I quote, was it between UK mission and London, or was it within London? In that we missed out on these procurement schemes, they could have been of value to our constituents. And can he assure us that these problems have been dealt with and we will contribute to and participate in future EU procurement schemes?
Thank you, Mr. Speaker. Can I thank the honourable gentleman again for the way in which he has been very constructive in his dialogue with government, and also his SNP colleagues in Scottish Government. I have weekly update conversations with all the devolved administrations, and indeed they are just as constructive. And also, I would just reiterate the point from one of his early points, that the combination of working with the scheduled flights and the commercial sector has enabled over 1.3 million people to get home. So I think there is something to champion. Of course, the network has been put under extreme pressure. We've never faced anything like that. We've never had to repatriate effectively people from all over the globe before. But I think that we've done a pretty good job in our repatriation so far, especially as we will pass the 20,000 charter flight mark today. With regard to his latter point, the Permanent Secretary of the FCO has issued a correction to the FAC. He's setting out that position, make clear that a political decision was not taken on whether or not to participate. And as the Health Secretary has said, we will participate in the joint EU procurement scheme on therapeutics that is soon to launch. And we've been clear that we will consider participating in other future schemes on the basis of public health requirements, including on any PPE. And finally, I just remind the honourable gentleman, there are currently around 10,700 mechanical ventilators available to the NHS across the UK, with thousands more in the pipeline.
We now go across to Richard Drax. Richard Drax. In which case, I will go across to Alistair Carmichael. Alistair Carmichael.
Thank you, Mr. Speaker. Can I take the Minister back to the two positions taken last week by Sir Simon MacDonald? These are not differences of nuance here. They are two fundamentally different positions. Can the Minister maybe share with the House the explanation that Sir Simon gave him for two such different positions being put out in the course of one day? And more importantly, even than that, though, can he give us some assurance that if EU procurement processes are to offer a route to our much-needed PPE being available in care homes and hospitals across the country, that we will not lose out on that opportunity?
Thank you, Mr. Speaker. Well, at risk of repeating myself on this point, Mr. Speaker, it's actually the case, the Permanent Sec, he issued his correction to the Foreign Affairs Committee. He made it very clear that a political decision wasn't taken on whether we should participate in this scheme or not. And again, I'll just reiterate the answer I gave to the SNP. The Health Secretary has confirmed we will participate in the joint procurement scheme on therapeutics. That is soon to launch, and we've made it very clear that we will consider our participation in other future schemes on the basis of public health requirements, and this includes PPE.
William Bragg. Thank you very much, Mr. Speaker. And following on from my right honourable friend, could he further elaborate the work that the Foreign and Commonwealth Office has done to source PPE supplies for our frontline health and social care workers? Are pre-existing supply lines working? Because this will be crucial in the government assessing its key pillar to have adequate supply of PPE for any decisions on loosening the lockdown.
Minister. The honourable gentleman makes a very good point. As I said in the statement, the Foreign Office is in addition to the domestic work that we are doing on PPE. We have helped secure, I've had conversations with our posts in China, and from China alone we've had we've had over 1/3 of 1 billion pieces of equipment. That work is continuous. All our posts are on the hunt for equipment. That is one of their tasks, and they're doing a pretty fine job.
We now go over to Clive Lewis in Norwich. Clive Lewis.
Thank you, Mr. Speaker. Like a number of members, I still have a number of constituents trapped in different parts of the world. One couple from Norwich have been trapped in New Zealand for well over a month now. They're running out of money. They've been refused a refund from their travel company, face exorbitant flight prices that they can't afford, and are becoming increasingly desperate. So can I ask the Minister what pressure the Foreign Office is putting on travel companies to refund British nationals trapped abroad, and to reiterate the point made by my colleague, the Honourable Member for Wigan, why it's taken so long for sufficient charter flights to be put on compared to countries like Germany, who've managed to already get most of their trapped nationals home?
Minister.
Well, I thank the honourable gentleman for his point. On New Zealand, I'm pleased to say that over 600 UK nationals have returned. Most of the commercial flights, and one of the problems is most of the commercial flights back to the UK have been suspended, so flight availability is extremely difficult. We are now chartering flights to help bring back the most vulnerable British nationals stranded in New Zealand. There's 5 initial government charter flights started on the 24th of April. They'll bring home over 1,500 people. And just on costs, I do accept his point, the way some airlines have dealt with their customers and not giving cash refunds. I don't agree with that. I think it's incredibly bad form of the airlines not to provide timely refunds to their customers. The cost of the repatriation flights are at a reasonable level, maximum of £800 if a flight's over 10 hours.
We go over to Ray Manchester. Ray Manchester.
Thank you, Mr. Speaker. Through the Minister, can I thank all the fantastic work done by the FCO team in bringing back my constituents from Fiji, from New Zealand, from India, from Pakistan. And I know there's 10 chartered flights that have taken place from South Africa. However, I have a 80-year-old constituent just outside Johannesburg who's supposed to be coming back to Rainham on the 4th of April. She's been told by her tour operator she's unlikely to come back before July. Can I ask the Minister to urgently look at this case? I have already raised it with the Minister for Africa, who's been exceptionally helpful, but can I please urge him to do everything that can be done to help this 80-year-old constituent of mine?
Minister.
Of course, the FCO will look into the case the honourable gentleman raises. I would like to thank him for the praise for the work that's been done returning his constituents from around the globe. As you will know, we've got over 2,000 British travellers back from South Africa on our special charter flights, but we will certainly look into that individual and see what support we can give through our network.
Dr. Rupa Huck.
Mr. Speaker, the Minister talks a good talk, and it was good news for my constituent when he was able to get over to see his ailing elderly dad for probably the last time, for the first time in 8 weeks. But the bad news is it was in blockaded Gaza, where there's no flights in or out of what David Cameron called an open-air prison. So look, will the Minister, who I have raised this with on a conference call on the 15th of April, please have a word with his officials, who up to date have told my constituent that it's his own fault, and get a family of 4 British citizens in Acton, their dad, back for Ramadan?
Minister.
Thank you, Mr. Speaker. I will say, of course, we will take up that case if it's not already been taken up. I doubt very much whether a member of the FCO staff would use language like "it's your own fault," frankly. But we'll certainly follow this up. We are due another conference call later on this week on Friday, which I'm holding for honourable and right honourable members. But we will certainly follow that case through for it.
Gavin Mahindra.
Thank you, Mr. Speaker. Can I firstly pass on my thanks for the work his department has done during this unprecedented pandemic? Would my honourable friend update the House on progress made by his department in offering consular support to British nationals, especially in Peru?
Minister.
Of course, the honourable gentleman raises a very important area, Peru. It's been a very difficult country to deal with, given the amount of backpackers and travellers that are dispersed over a very large area. We've got 1,100 people returned on 5 flights. People that are back. There are no commercial flights running. We still do have our consular staff available, and other staff in the embassy continue to provide assistance in that region to British nationals.
We go over to Lucy Powell in Manchester. Lucy Powell.
It's very sunny here as well, Deputy Speaker. The travel industry is facing an unprecedented crisis, and whilst completely understandable given the current circumstances, the Foreign Office's indefinite travel ban means it's very hard for companies to plan for the future. What thought is the Minister giving to how that advice might be eased when it's safe to do so? And has he been involved in the discussions taking place today with EU partners about the forthcoming summer holidays and how they might be made to work?
Minister.
Well, I can tell her on a final point, the Honourable Lady, I haven't as yet. I've been at the Foreign Office and here at the Commons. We are constantly talking as the FCO to the travel sector. Of course, many elements of the travel industry have been decimated by this unprecedented event. It's absolutely crucial, though, that we focus on the job in hand, and the FCO's main focus at the moment is to get British nationals home. But she makes a very fair point. There will have been discussions with the travel sector as we approach the summer holidays, and I'll be delighted to update the Honourable Lady in a further call.
We go over to Dr. Andrew Morrison. Dr. Andrew Morrison.
Thank you, Mr. Speaker. Can I very much welcome the Minister's comments about Gavi, the Vaccines Alliance. The government's leadership in this matter is extremely timely. Will the Minister say what part the FCO played in Exercise Cygnus in 2016 and what exercises the Foreign Office has subsequently run to test the UK's ability to repatriate British nationals in the event of a crisis of the sort we're living through now?
Minister.
I thank the right honourable gentleman for his question. Now, clearly, with reference to the Cygnus exercise, I'm not aware of how involved the FCO was back in 2016, but the government regularly, as his constituents and the country would expect, regularly tests pandemic plans. Cygnus was, I understand, a test of domestic preparedness for a future flu pandemic. And of course, the lessons learnt from Cygnus continue to be considered by government when we are reviewing our responses.
We go over to Pat McFadden. Pat McFadden.
Thank you, Mr. Speaker. I have a number of constituents who are still stranded in Punjab in India, some of them in real distress. Now, I recognise the effort from the Foreign Office in chartering flights from Amritsar, but after several weeks of this effort, my office is still receiving large numbers of calls from people with serious medical needs who've so far not been allocated a place on any of the charter flights and, importantly, don't know when they will be. So can I ask the Minister, when does he think this repatriation effort will be completed?
Minister.
The honourable gentleman raises a very good point. India, as you can imagine, there were tens of thousands of British nationals in India. We've got back over 10,000 on 38 flights so far, and we've got another 14 planned. Of course, with India, we are prioritising, doing our best to prioritise the most vulnerable who have registered that they want to come home. We expect that we're able to get the number to 13,000 coming back from India. We are repatriating people from multiple cities across India, and we will consider the option of additional flights after these particular flights based on need and circumstance. But the honourable gentleman flags a very important area for us.
We go over to Teresa Villiers. Teresa Villiers.
Thank you, Mr. Speaker. Can I ask for the government's help getting people back from Pakistan, because I have constituents there? And can I also ask him to provide more reassurance to constituents here who are worried about the continuation of flights from COVID hotspots like Iran without sufficient work going into checks to making sure that incoming flights from different parts of the world aren't potentially making our virus situation worse?
Thank you, Mr. Speaker. The Right Honourable Lady raises Pakistan, another area where there are thousands of Brits wanting to return home. We've got over 2,000 people back already. We've got another 9 flights planned. So I can assure the Right Honourable Lady that through our mission in Pakistan, we are doing our utmost to get people back. We're also putting on flights from Karachi as well, because obviously the size of that particular country. With regard to the health point that she raises, I mentioned it earlier, the Public Health England is the current advice we are giving people as we enter phase 2 of these repatriation flights and phase 2 of the pandemic here. We are going to be looking very closely at the advice that we're going to be giving. But no one who has got symptoms of this virus can get on one of these flights.
Chris Elmore.
Thank you, Mr. Speaker. Can I take the Minister back to the whole issue of EU procurement schemes? It seems at the moment that at the very best the situation is confused and at very worst rather fishy, and the Minister's answers aren't giving any more reassurance or clarity. So can I ask him, was any Minister briefed about any of the schemes? And if not, why not?
Minister.
Well, again, Mr. Speaker, at the high risk of repeating myself on this point, and I particularly understand why the opposition might want to probe this politically, but the Permanent Secretary issued his correction to the committee. He set out his position very clearly, and that was that a political decision was not taken, and repeat, not taken whether or not to participate. We will be joining the scheme on the EU procurement scheme on therapeutics, and any other scheme will be considered by the government according to the public health requirements of the UK.
Anthony Magnan.
Thank you, Mr. Speaker. Can I thank the Minister and his Foreign Office team for all the help that they have given me and my team in returning constituents of mine from across Totnes and South Devon to their rightful place at home. But there are some lessons to be learned from this situation, and I ask that the Minister might consider that the Foreign Office performs a retrospective analysis of how we have repatriated British citizens and presents that report to this House so that we may be able to scrutinise it in future. Because I think those shortcomings will need to be addressed. Added to which, should we not also be looking at the cooperation that could be had between public and private sector when it comes to commercial flights?
Well, the honourable gentleman makes a very sensible point. Of course, we learn from every day. We learn from the lessons of such a huge operation. This is something we've never faced before. The nearest we've come to it is the Thomas Cook repatriation not too long ago. This is a point that a previous questioner asked that I didn't get around to answering. So we learned lessons from that, but this is on a scale that's unimaginable. You know, never before have we had to repatriate this many people. Over 1.3 million people have got home via commercial routes. We have been working very closely with the commercial sector. The airline industry, a number of airlines have signed up an MOU with government so we can ask them to bid for charter flights. But he raises a very good point, and no doubt this will be something that we do look at in the cold light of day.
Matt Weston. Thank you, Mr. Speaker. And can I add my comments of congratulations to the Prime Minister and Carrie Symonds on the birth of the child. On the 24th of March here in the Chamber, I asked the Foreign Secretary about the situation of my constituents stuck in India and elsewhere around the world. 40 are still stuck in India, including Lashkar Singh Jyoti and Surinder Jyoti, who've been resident in the UK for almost 50 years. She is a specialist neuro care worker who needs to get back to work. There seem to be echoes here of the Windrush scandal, in that they've been told they are not eligible for consular support. She's needed back at work, as I say. Can I ask the Minister to intervene and help them and all other UK residents be returned and repatriated to the UK?
Minister. Can I just answer the honourable gentleman by referring to a previous answer? We are prioritising British nationals. These flights are paid for by the British taxpayer, so our initial priority is with British nationals. Of course, those that have indefinite leave to remain, they should not be discriminated against in any way. The priority initially was British nationals. We're certainly not in the business of breaking up family groups. We want to ensure that families are kept together. I would very much appreciate if he could flag with my office that particular case, and we see if we can drill down and get those people home.
We go across to Surrey, Lancashire. Anthony Higginbotham.
Thank you very much, Mr. Speaker. And can I first thank the Minister and the entire FCO team for everything they are doing. I know they're working around the clock, not just to return my constituents to their home, but all of our constituents. If I might come back to the topic of Pakistan, I'm very fortunate that many of my constituents are now home from Pakistan, but there are still some left there. Could the Minister give some reassurance that the repatriation flights being run by the government will continue until such a time that commercial flights resume? I know that was the situation before, that PIA were running commercial flights, but until they do actually commence, and we're not talking a promise to commence them, will our repatriation flights still go?
Minister. Thank you, Mr. Speaker. And the honourable gentleman, I know, has been incredibly resilient and has pursued FCO ministers on the individual cases of his constituents, and he's absolutely right to do that. We are launching a new phase of flights back from Pakistan. We've had 2,000 back on our special charters. It's worth pointing out the point about Pakistan International Airlines. We are working very closely with the government of Pakistan and PIA to ensure the continuation alongside these charter flights. And it's worth also mentioning, Mr. Speaker, that since the 4th of April, over 13,500 people have returned to the UK on 40 commercial PIA flights through that negotiation alongside our charter flights, which is
Hi, it's Charles. Can you see me now?
Yeah, let me. How's that? Is that better? Yeah, a big black cloud came over. Okay, cheers. Bye.
Sorry?
was told twice. I was told to remember 3, so yeah, I'm feeling so good. 3. Well, it'll be 8 hours by now, which is, I think, long enough in Downing Street. So it'll be interesting to see what happens with that, because they still haven't really released a lot of detail on it. You want to know what it works like in silent as well. Okay, 20 factors. No, but as in, when you get the shutter there and stuff going on, the rolling shutter, because the last stuff that you used was all about 8K video. Yeah, it was. Because the rolling shutters, that's the first time you get sensors. Interesting to see what they've done with that. It's also, you know, what it's like sending live action pictures. It's going to have. Well, hopefully, you know, I don't know about you, but I do my captioning on the computer. You know, if I've got to do a rotor, I'll put the caption on the camera, shoot it straight to the audience. So I don't have to run the X with the camera, what it is to do. What shutter speed. That's the other options now. £2 a month. Because I've got it, and it's the old one. Won't that work? No, well, I haven't used it for a bit. It works really well, because what I do, the only great thing you can do is an arm level. On my one, it does. You put the caption in the phone. Yeah, it talks to it, sends it. But I always just find it difficult to work out which one's the send which end. It tells you what it is. So maybe it's a lot better. Maybe there's maybe the new version is a lot better. Oh, God. Yeah, they went on a subscription. As you said, it's 82. just do a lot of galleries on Photoshop. The last one I did just before the outbreak was like that, where they wanted everything set immediately, and now it's in like to go and do an extra idea. When you're moving ahead of it, you much know what lens you're going to be using. So I just follow that. Just use the one camera. Oh, I don't. Well, jobs like that. It's always the worst. You've got really high hopes. side dock, on a 300, no sense that he's actually in there. Yeah, I mean, I better go and send this fucking picture. Right, off. And have to perch in there for a moment. Have I very not? Yeah. I'm going to fuck her off soon. I've got a replacement. Who's that?
That I don't know. I've not done
I think they say it's not going to be someone like John Craig.
Yeah, I mean, maybe over interviews you get 2 and 3 as the outgoing line.
Yeah, it'll be one of those two. I remember last time.
Yeah.
Last time I saw John, because he turned up and down and
yeah, I mean, of course, and what I mean, just book everything.
And the sun hadn't taken its spot.
Yeah, well, I'd say, yeah, sure, yeah. Is there something?
He was just doing it for himself. Put it into the telegram. I was so embarrassed. I think he shot it tall, so he had loads of space and money. And they wanted to make the whole price. And then
yeah, I'm not. Yeah. Yeah. I see that. Yeah. So no, I thought there'd be a few flowers going up or something. Oh, well, I did. Yeah. I thought. Actually, have you got those shots? If you didn't think I was looking down the right line, how did they see those? Oh, I see, Jack's. Well, yeah, I've got it on my camera. Yeah, so I've got it on my camera card. Yeah. So that. But yeah, Jack.
Spitfire pilot.
Yeah. Okay. Right. Okay. Cheers. Bye.
Is he alright now? He's no outside. The heart was all for himself. harassing, difficult. Especially now, so it's more current uptake afterwards. He's got arthritis. I think he's on the because I have got my even towards you. He almost took my son's eye out. Is that anyone?
Hello, son. I'm alright. I'm standing in Downing Street in the rain. Yeah. Yeah, no, all fine. Yeah, all good. Yeah. Oh, yeah, yeah. Okay. Yeah. Yeah.
Yeah, the bottom's just soggy, doughish. Yeah, yeah. I did that one. I baked a really nice raspberry cake. Went all the effort against it.
Yeah.
Jane through. Well, it sounds a bit like a burn.
Right. Yeah, I mean, I don't know. I mean, it's a bit of a pain because it then means he's taking leave during term time. This is what. Yeah, full time. Yeah, that works better for me because otherwise I'm having to get cover during. Because otherwise I like to encourage people to take their leave during recess. Put it very bluntly. It was so top of my head. It's 8 weeks recess. So you got 8, 9, 10, 11 weeks recess. Must be with Christmas. Can't remember off the top of my head how many. Yeah, because it varies. I think it used to be 45 or 46 weeks, something like that. It seems to. It doesn't include conferences because that's no. So that's yeah. So well, it's 5 weeks in summer that you take off, 2 weeks in the Christmas period. That's 7 definitely. Then there's the Easter break, which might be another 2 weeks. And there's the half terms, Whitsun, and another one. But no, that's the thing. That's why it's not an exact science. But we definitely are 5 weeks in summer, 2 weeks in Christmas, 7. They're definite. Yeah, so it's somewhere around there, 44 weeks, 45 weeks would be about right. It's not exact science. Cheers, cheers, bye.
30 grand a year for that.
I give away all my money.
Well, apart from you.
Well, that's you.
See you later. See you later.
Sorry.
God, I missed the day that I could get up at my knees. Really annoying. A friend of mine is a Oscar-winning sound engineer, and he's been obviously not working because there's no movies being shot. And
what films has he done?
well, he's done a lot of that twat. He does proper stop to sweat down.
Guy Ritchie?
Yeah, he's old mates. He's mates with Guy Ritchie. They grew up together. Larry. Let's under the spot. Larry. So here's the very jealous man who's not going to appreciate John Hawkins. Well done. Now we need that point. This is our role. It's what to report on. I expect more of you, Tom.
I know.
You're an award-winning news hound. Not a capital, not a propagandist.
I was just looking at well, you guys did it, and I was singing.
He'll be Erdogan's official photographer.
Oh, again. Lunchtime.
Here's the delivery from Buckingham. If any of those are sharp off the amount of rocking around you we do, just then I'll Is that yours?
Yeah.
Really? So it's a bit like a 24/7 on an A9, isn't it? And they are nice lenses. Does that built-in one? Does that make it what, 600 5.6 or something?
Yeah, you can also put on it. I mean, you can also use this so you get about.
Is it 600 5.6 like that?
With this, 540 mil or 5.6.
Yeah.
You put enough chaser
In mount.
784 mil.
Yeah, I'm sure I've seen a picture of him with either a mouse or a bird.
If you really
But with the 5D,
is this for your
it's so much harder.
Yeah.
It's quite, I mean, it's normal.
I mean, sometimes I think to myself, maybe I should have I'm just.
teachers, one was the other was 6 yards and the bird, the bird on the the other one until he got old. I found that. The worst was when he was half dead bird, and then he would have to fly around and remember to put it in with it, and it was like half covered with blood.
But the mere fact of stockpiling equipment and PPE says to me, we decided the battleground, if I can use that language, was going to be in the ICUs, was going to be in the care homes, rather than taking it to it and fighting at the airports, fighting at the seaports. Why do we not do that? On the 3rd of March, I asked the CMO and again Matt Hancock, what are you doing about ports, seaports and airports? And on the 3rd of March, they did not have an answer. And today, I still don't see that answer.
Again, it's a fair challenge. Different countries which have had restrictions, for example, on flights, have had a similar or even greater incidence to countries that have had fewer restrictions on flights. So it is the case that the science and the evidence is accumulating at the moment, and all of us are learning as we go. Now, the work that was done in Exercise Cygnus and in other exercises undertaken by the UK government was designed to anticipate what might happen in a flu pandemic. As we discussed earlier, the precise nature of this virus meant that that response had to be recalibrated, but that work was clearly helpful in preparation for this. But if we look across the globe, and in particular, if we look at other European countries, we can see that they have faced similar challenges. They faced particular pressures on their health service and on ICU capacity. And whether it's been France, Germany, Italy, or Spain, all of those countries, as I say, have faced a similar scale of threat. And we are learning from those countries, as they are learning from our own experience, what have been the most effective and best targeted responses.
And yet a small island nation of a population of 5 million people like New Zealand seems to have done it a whole lot better.
Well, again, New Zealand has a specific geography which has provided it with a different set of challenges. But if we look at the United Kingdom, there are factors, and here these are factors to be borne in mind. They're not definitive, which is important to bear in mind when we think about the spread of the disease. One of the things we know about the disease is that it spreads, as we have become aware, through social mixing, and it spreads faster, or appears to have spread faster, in cities. If you have an open, dynamic, multicultural, multinational, free trading nation like the United Kingdom, and you also have significant cities of the size of London, Birmingham, Manchester, and Glasgow, then it is the case that you are likely, on the basis of what we know so far, to have a faster rate of reinfection than in other countries. Now, again, it is perfectly legitimate and indeed necessary for people to ask questions and to challenge, but this is a developing picture, and I think it's important that all of us have a degree of what a philosopher might call epistemic modesty in making sure that we don't overclaim for our ability to determine exactly how the virus is going to respond to interventions in the future.
As well as epistemic modesty, could we have perhaps briefer answers as well? If I could cut across to David Mundell, followed by David Jones, please.
Thank you, Chairman, and thank you, Michael. I mean, devolution is obviously one of your other responsibilities to which the committee will be returning to discuss in due course once we're through this crisis. But can I ask you, in relation to the three devolved governments, UK government, how those governments have been working together during this crisis? The outcome of the 2009 swine flu epidemic was that the governments had worked well together. What's your assessment of how the governments have worked this time, and how actually does that manifest itself on a day-to-day basis, the working together?
Well, thank you, David. It is the case that all the devolved administrations are represented on the committees that are dealing with this challenge. So if I take my own committee as an example, it had its 31st meeting, I think, today. We had representatives from the Scottish Government, Ivan McKee, from the Welsh Government, Leslie Griffiths and Lee Waters, and they take part in those conversations as equals. Everyone who participates is participating as a responsible minister seeking to do their very best in order to fight this pandemic. And I have to say that whether it's been with respect to the Scottish Government, Humza Yousaf when it's come to justice matters, or John Swinney on education matters, their approach has been collaborative and constructive, and it's shown the devolution settlement working well.
But obviously there are, within the devolution settlement, scope for divergence. So where do you think the balance lies between the divergence and the need for a uniform message? Because, I mean, I'm slightly confused at the moment, because here in Scotland, I'm being recommended to cover my face if I'm in certain shops and on public transport. Yet if I travel to London, where I might deem that more necessary because of the points you just made in your previous answer, I don't have to do that. So, you know, where does the balance lie between having one message and the ability to devolve? And specifically on the face covering issue, do you think that that's something that is likely to be recommended by the UK government in due course?
On the point about divergence, obviously it's the case, because we respect the devolution settlement, that different policy approaches can be floated or proposed by the devolved administrations. But I think it is better if we work as one. I think and the point that you just made about masks is one example overall, where if there is a consistent message across all parts of the United Kingdom, it makes it easier for people to understand, appreciate, and comply with. Clarity and consistency help. One of the challenges, for example, that the Federal Republic of Germany has had is that some of the Länder there have been more determined to press ahead with, in this case, actually easing lockdown measures, and that's made the challenge for the Federal Chancellor more difficult. On the specific issue of face coverings, the scientific evidence so far is that face coverings can have an effect in preventing an individual from spreading the disease to others if they have it and they're asymptomatic. But there is also a worry that some people may think that wearing a mask protects themselves as distinct from protecting others, and therefore they may behave in a manner that is slightly more cavalier. So it's a finely balanced judgment.
And is the UK government going to make that judgment in due course?
Well, that judgment is made collectively with respect to an analysis of the science by the Cabinet, and I know that it's a situation which is under review.
Okay. Thank you. David Jones, followed by Jackie Doyle-Price.
Yes, continuing the same points, Michael, you'll probably be aware that people in Wales, for example, take most of their news from the main BBC evening news. They're probably all watching the 5 o'clock Downing Street press conferences, where messages are being relayed that they assume is policy which is going to be implemented in Wales. And yet we see divergences, we see delays in adoption of policy. For example, take the policy of NHS responder volunteers. That was tremendously successful, attracted, I think, 750,000 volunteers. Everybody in Wales assumed that it was going to apply in Wales, and yet we heard subsequently that the Welsh government were not going to do that. And in fact, there is no such scheme in Wales. Isn't this adding to confusion, and could not the position have been agreed before the announcement was made?
Well, it's a very fair challenge, David. We have to respect, as I mentioned earlier, the devolved nature of the settlement, and Wales has its own health minister, Von Gethin, and when it comes to the delivery of certain aspects of policy, Matt Hancock can share information, share ideas, but not direct. However, all 4 health ministers talk at least weekly in order to coordinate their response. Like you, I think that wherever possible, we should be entirely, in dealing with this pandemic, entirely as one. So that is my personal preference, but I also regard it as my responsibility to make sure that we can work with those devolved administrations, even if they do take a slightly different approach, respect that, even if it might not have been the decision that I would have taken, and then get on with working well together wherever possible.
But do you not observe some fissures starting to develop? For example, the Welsh First Minister announced the continuation of lockdown after the first 3 weeks before the United Kingdom government. He's also now published, as you're probably aware, proposals for relaxing the restrictions of lockdown. In fact, he's come up with a traffic light system that is again peculiar to Wales and is not prevailing in the rest of the country. Do you not think that that is causing some confusion?
Well, my own preference, a strong preference, is that there should be unified communication, but I respect the right of the First Minister of Wales to communicate the Welsh Government's approach in his own way. The thing about the document that the Welsh Government produced was that it wasn't that different in overall tone and detail from what the UK government had said, but people like yourself and so on will draw their own conclusions about the appropriateness of the way in which it was communicated.
And in terms of the army, whose role is becoming increasingly prominent in this crisis, if one of the devolved administrations seeks the assistance of the army, I think that there have been 6 requests from the Welsh Government for army assistance. How is that arranged and how is that authorised?
Well, it is the case that any request for military assistance to the civil administration has been expedited. It goes to the MOD. The MOD are only too happy to help, and it's been the MOD who've been, well, on one hand, it is the case that there are members of the military who are currently in the Department of Health helping to coordinate the delivery of testing. And it is also the case that it is members of the military who are responsible for ensuring that the various mobile testing centres that we have around the country can visit care homes and ensure that people are tested in numbers. That wouldn't have been possible without the British Army, the Royal Navy, the Royal Air Force and their personnel. And like you, my respect for the armed forces has only increased. Their capacity to manage logistics, to think around corners, to deliver is peerless, and we are very, very lucky to have them.
Thank you.
Thank you. Jackie Doyle-Price, followed by John Stevenson, please.
Thank you, Chairman. One of my bugbears is London-centric policy making. And as you mentioned earlier in your evidence, clearly the disease has spread far more quickly in densely occupied urban areas like London, Birmingham in particular. Can I ask to what extent it was considered in implementing the lockdown, whether it should be done on a more regional basis? Bearing in mind there'll be some communities where actually the incidence is very small, and we do have hospitals in the north of England which are now full of empty beds.
It was the case at the beginning of the discussion about the lockdown. It was the case that 1 or 2 people put forward the idea that it should be London specific for all the reasons that we know. But the point was made, well, it'll be difficult to police. If you say that someone has to observe social distancing rules and can't go to the pub in Kingston, what happens if they go over the River Thames and go to the pub in Surrey. It becomes difficult to manage. It was felt that it was appropriate to do it on a nationwide basis, and I think it has been effective because we have seen the virus spread, and there have been flashpoints and outbreaks across the United Kingdom that have been worrying and concerning. But I do agree with you. It is often the case that because of where our politics takes place and because of where our media are, that we sometimes have London-centric policy thinking. One area where we may be able to explore having the lockdown eased more would be in island communities. And Bob Seeley, the MP for the Isle of Wight, has suggested that we may trial contact tracing on the Isle of Wight before it's rolled out nationwide. And if we do that, we might be able to use the Isle of Wight as an opportunity to see how we can relax those measures. And I think similar suggestions have been made by some of the island communities in Scotland, but obviously that's a matter for the Scottish Government.
But I think there's an issue here as well with regard to messaging, and it's similar to the ones that my colleagues representing Scotland and Wales have raised, because clearly the lockdown applied to if you can work from home, please do, but you can still go out to work. Whilst at the same time, the Mayor of London was becoming very agitated about construction workers still travelling to work and using the public transport system. But clearly, from an economic perspective, we still needed that activity to go on. So do you see a tension also with the leaders of devolved local government in terms of ensuring consistency of messaging?
I don't see that tension yet, but I think you make a fair point. And again, one of the things is that outside London, and certainly outside major metropolitan areas, the overwhelming number of journeys to work are done by car and van, not by public transport. And I think that that sometimes that is forgotten in some of the discussions, just because it may be the case that that MPs or national media journalists are using public transport in London. They assume that that is the normal for everyone, and it's not. And when we've been looking at ways in which we might potentially ease the lockdown, the point has been very forcibly made. Yes, it is important to think hard about public transport in London and in the West Midlands and elsewhere, but it's also important to recognise that most people in the rest of the country don't use public transport to get to work, and that we should think about policy in that way as well.
Well, I'm glad to hear that, actually, because it's abundantly clear that probably the worst place to enforce social distancing is public transport system. And the dependence in London is quite unique. But obviously, the most important thing we've got looking ahead is to make sure that we do get the economy back on track as soon as possible. So I guess my plea to you is that when we come to look at easing the lockdown, can we have a real attention paid to public transport and a real attention paid to making sure that those people who can work are getting that message loud and clear, and that it's tolerated by everyone else. Because I don't know about you, but I'm getting rather frustrated by my neighbours who tut about people getting in their white van to go to work every morning, but quite happily take the delivery from Amazon for their latest delivery. And I think there needs to be a bit more understanding on the point of view of the pointy elbow middle classes of what the workers have to do to earn a living.
I agree 100%.
Marvellous.
Thank you. Briefly before John Stevenson, sorry, a supplementary from David Mundell.
I'd like to return to the issue of potential regional or indeed national variations in the lockdown. I know that you're a keen follower of the Scottish social media scene, and there's been quite a lot of excitement in that environment about the potential for regional or national variations in lifting the lockdown. Now, I mean, obviously, if the scientific evidence promoted such a view as to be a basis for easing out of the lockdown, it's obvious to me that that's something that could be contemplated. And I just wanted to be clear where the UK government stands on that issue, that it would contemplate such a regional variation. I was pleased to hear the First Secretary describe the Scottish Government's paper, which they had produced last week, as sensible, because indeed that's what it was, because like the Welsh comparison you made, actually it was almost entirely predicated on the UK government's 5 tests. But could you just confirm that you could contemplate that there could be some form of regional or national lifting of the lockdown?
Thanks, David. I agree with you and the First Secretary that the Scottish Government's document was sensible, and I read it with interest, and you're absolutely right. It broadly reflected the policy the UK government has been following. On the area, on the question of regional variation, this is something that they're talking about in France at the moment as well. My own personal view is that it's preferable if we do it as one United Kingdom, but there is a specific scientific justification for saying that island communities can be areas where you could pilot some measures, contact tracing in particular, in order to combine that with relaxing measures at a progressively greater rate, and that can help you judge what is right for the country overall. So, you know, as I say, different European countries are adopting regional variation. My belief is that overall it's better if we do it as one United Kingdom, but there are specific opportunities in island communities to conduct trials.
I mean, it certainly would be better, as you would appreciate, to have a one United Kingdom approach for my constituency, which is on the border, and people still are travelling to Carlisle, for example, to work in the NHS. It would seem to be ludicrous that there would be different rules applying to them at home as to in their place of work.
Yes, I mean, it would be odd if the political editor for Border TV had to observe different rules depending on whether or not he was reporting from Langham or from Carlisle. Exactly.
Thank you. John Stevenson, followed by Lloyd Russell-Moyle.
Thank you, Chair. Michael, at the beginning you said all aspects of the Constitution are working well together. One part of our constitutional system is local government. How have local government leaders been involved in decisions about the UK response to COVID-19?
Thank you, John. The Secretary of State at MHCLG, Robert Jenrick, and his junior ministers, Chris Pincher and Simon Clarke, are regularly in touch with local government leaders in order to make sure that they understand the strains and pressures that they have. And it is the case that the role of local resilience forums has become even more important, obviously, in dealing with this crisis. And they are in regular touch, as is the Cabinet Office, with the people involved in manning and operating local resilience forums. One of the things that Simon Clarke has done is that he's asked all government departments for recommendations for areas where there are burdens currently on local authorities that we can lift in order to allow them to concentrate on the particular challenges of the emergency.
Interestingly enough, the devolved administrations have been involved with the national government quite regularly, as has the Mayor of London. Do you think other metro mayors and possibly some sort of representation from the rural parts of England should have also had greater representation?
It's a fair point. I think you're right that metro mayors, Andy Street, Andy Burnham, Ben Houchin, have a very important role to play. And I know that the MHCLG team have been in touch with them. And I was able to talk to Andy Street a couple of weeks ago about a specific issue where I hope that we would be able to help. But you're also right to raise some of the particular questions that face rural communities. And those concerns are reflected by different ministers. But one of the things I will talk to both George Eustace and Robert Jenrick about is how we can make sure that when we're thinking things through, that we're properly rural-proofing our response.
Thank you. In addition, what mechanisms are in place to ensure that the various local authorities have access to, say, scientific advice, which they need to use to fulfill their role in emergency planning, dealing with the pandemic, and obviously social services? So what advice are they getting, and how easy is it?
Well, the Civil Contingencies Secretariat has a good relationship with local resilience forums and shares material with them. And that should ensure that whoever the goal commander is for any local resilience forum and whoever his or her partners are, have access to the best contemporary evidence. And obviously, when it comes to some of the services that local government are providing at the moment, we're discussing with them everything from what might be a safe way for schools to return, and what might be some of the additional PPE requirements that people delivering public services might have.
Do you think that's a two-way process, in that quite clearly local government will have their own experiences, there are clear regional variations, and they will be feeding back into central government? Is that a response from central government in response to the feedback of information?
I think it is, and let me take one very challenging area. One of the concerns that people have had throughout the pandemic is that the increased number of deaths would place particular strain on funeral management and everything associated with that. And we've been talking to local authorities about that issue, and their response has informed everything that we're doing. There's a dashboard of the local capacity that local authorities and local resilience fora have, and that helps us because local authorities feed back information about particular areas where central government can help them to discharge their responsibilities.
During this pandemic, there's quite clearly a number of organisations who are involved and have responsibilities. Do you think it is clear who has responsibility for what between central government, devolved administrations, Public Health England, NHS England, local authorities? Is that clear and transparent and obvious?
I think it is, but obviously, if it's the case that your constituents or others feel that there is any uncertainty, then obviously we'd want to respond to that. I mean, the one thing I would say is that all of us as MPs know that sometimes there can be, in the minds of some of our residents, uncertainty about whether or not something is the responsibility of the borough council or the county council. So it may well be the case that for people leading busy lives, the distinction between Public Health England and the NHS may be one that they wouldn't ordinarily want to scrutinise closely, but in a pandemic situation, of course, it becomes critical that we know who is delivering what. And I think that is clear, but if for any reason there are any difficulties that people are encountering, then the more we know, the clearer we can be in reinforcing those lines of accountability.
On that point, where do you think issues have arisen?
In terms of potential confusion?
Yes, and lines of responsibility. Where have issues arisen?
I think that trying to think where that might have been. I think the quite a lot of planning went in originally, as I mentioned earlier, in the context of the flu pandemic, to areas like the management of more deaths than might have been anticipated. So the role of the local authority, the local resilience forum, central government, funeral directors and others, that was worked out beforehand. I'm not sure where I think that there's been the, and I don't want to appear complacent at all, but I'm not sure where any uncertainty may have arisen. I think the uncertainties that may have been generated go back, I think, to some of the earlier questions, with people asking, well, if the Mayor of London says this, but central government says that, which is right? So I think it's been more a fact of different views from different people in different parts of the United Kingdom, rather than a lack of clarity about who's delivering what. But as I say, we're not complacent, and if there are examples that people want to bring to me, then we will respond.
Mr. Gove, just intervening on that point, you mentioned in answer to Mr. Stevenson that the Civil Contingencies Secretariat has good relationships. Good relationships are all very well, but at a time of national emergency, what teeth does that Secretariat have?
Well, the Coronavirus Act, of course, gives central government powers, but the Civil Contingency Secretariat is, as much as anything, about collating and sharing information and then drawing up plans so that central government and others can be in a strong position. It's also the case as well that, as well as the Civil Contingency Secretariat being part of the sort of broader resilience community that includes local resilience forums, that military planners have been dispatched to every local resilience forum to help them with their delivery of particular services.
Thank you. And are those military planners able to cut through the bureaucracy? Is that why they've been sent there?
Yes.
Thank you. Lloyd Russell-Moyle.
Thank you very much. The local resilience forums have been used, which are actually outlined in the Civil Contingencies Act. But of course, we have not followed the Civil Contingencies Act in some of the other areas, and followed a new act, which is understandable. The local resilience forums are mapped on policing areas rather than, say, local health strategic partnership areas or wider partnerships of CCGs. Now, luckily in Sussex, that is coterminous for us. But I wonder, is there any thinking about whether, particularly in the future, but considering what we now know, whether those areas were the right coterminous areas to use? And secondly, in terms of the makeup of the local resilience forums, it is of civil service leaders rather than elected politicians, which makes perfect sense when you've got a short-term crisis. Aeroplane crash, for example, when we last used the Sussex Resilience Forum. But actually, does there need to be some thinking, particularly when these crises go on for longer, about including local politicians? And I don't just mean directly elected mayors, but I mean leaders of councils in some of those deliberations.
Well, I think those are very good points. I think the first point about the geography and the fact that they're coterminous with policing areas flows from the fact that local resilience fora will often rely on the blue light services, police, fire and rescue, and of course ambulance as well when dealing with particular issues. But of course, when, as we all hope, the effect of the pandemic has subsided, I'm sure one of the things that we'll all want to do is to look at the architecture of local resilience forums to make sure that we've got things right. And I think you're also right as well, that we do need to continually think hard about making sure that we involve local politicians and not just metro mayors. And that's managed through MHCLG, and MHCLG ministers are always very sensitive to the needs of people in local government. But I think those are two very good areas for reflection for the future. Because as is so often the case when you're dealing with a crisis, you just need to crack on with dealing with the immediate, as you point out, but then you can learn certain things from it about how better to prepare for the future.
Did local resilience forums have enough autonomy to hit the ground running, particularly in things like buying PPE? I know my one said at the beginning they weren't sure whether they had the mandate to go out and just get the stuff that was needed, or whether their mandate was to coordinate. Is there a role in giving them a more a clearer, more robust mandate to actually do things rather than just to coordinate things?
Yes, I think that's, again, a very fair point. And some local resilience fora, and indeed some other arms of government, like the prison service, went out there early in order to secure their own supplies of PPE. There's been a broader problem, as we all know, with PPE globally, and we can discuss some of the challenges there.
Come back to that in a bit, yes. Yeah.
But I think you are right that encouraging people who are professionals to exercise their own initiative, I think, is a good thing. Absolutely.
Thank you.
Thank you, Karen Smith, followed by David Jones, please.
Thank you. And following on those points, and I declare my bias, I was an emergency planner at the NHS in 2014, and I think I'm a bit surprised to hear you say, Mr. Gove, that you're not really aware of some of those local versus national issues. We picked this up last week, the difference between strategic planning and operational planning locally, because the different ways in which the different bodies have had to access, for example, PPE, surely does stem from disclarity locally within local resilience forums and what exists on the ground.
Well, again, I would hope that we weren't complacent in government, and we're always determined to learn from any examples of areas where people on the front line feel that they haven't been getting the support that they need. Just to take one step back on the PPE question, we had a big national stockpile of PPE to deal with the flu pandemic. As I mentioned very briefly earlier, we had to revise our approach because of the emerging nature and the new science that gave us a better understanding of how coronavirus itself affected people. And we're also considering at this moment what the best scientific advice is for the sorts of PPE that might be required for people who are not in health or social care settings. And we touched on that obviously when David Mundell and I were discussing face coverings.
My point really isn't on this that the government's been complacent. My point really is the disconnect between the operational planning in a local area, be that what was a strategic health authority before the Health and Social Care Act, or the local resilience forums, and the responsibility of Public Health England, particularly within that, and local government. And the learning from that has been known over the last few years. And you say you're learning as government, but how have you learned from the way that local resilience forums have been operating in the last 2 or 3 years to inform this pandemic?
Well, as you will know, local resilience fora have had to deal with some real challenges, particularly but not exclusively flooding events. It's also the case that local resilience fora were very deeply involved in the preparation for what might have occurred if we'd left the European Union without a deal, and some of the challenges that that might have thrown up. And the conversation that local resilience fora and their leaders have with the Civil Contingency Secretariat has informed our approach to the Civil Contingency Secretariat, has often updated me on areas where they think, on the basis of their conversations with people at the front line locally, that central government's expectations need to be recalibrated.
Thank you.
Thank you. David Jones, and then followed for a new topic by Ronnie Cowan. David, please.
Yes, briefly, what is the line of reporting for local resilience fora in Wales, given that they comprise both devolved and non-devolved entities? Do they report by the Welsh Government, or do they report directly to Whitehall?
Principally to the Welsh Government, but it is the case, and it's the same with the different resilience model in Scotland. But it is the case, of course, that the Civil Contingency Secretariat and the Cabinet Office has relationships with people involved in the work of resilience across the whole United Kingdom.
So there's a direct relationship there?
Yes.
Thank you.
Thank you. Ronnie Cowan, and then it'll be Rachel Hopkins. Ronnie.
Yeah, thanks very much, Chair. Short questions here, because we're already up against the clock here. But I'm really curious, what was the need for the Coronavirus Act when we already had the Civil Contingencies Act in place?
Two things. The Civil Contingencies Act is designed to be used for something that is unforeseen. It's designed to be used in a range of situations where there is no time for preparation and forethought. The Coronavirus Act grew out of some of the, I hate the word learnings, but you know what I mean, some of the learnings from the exercise Cygnus operation. The fact that we were able to introduce the legislation so quickly was as a result of having thought through what might be required in a pandemic.
But there's a problem with scrutiny, is there not?
I don't
the Civil Contingencies Act would be there for scrutiny. The Coronavirus Act isn't.
Well, it's up to Parliament to have any debates that it likes on the Coronavirus Act, and it's also therefore, it's there are appropriate staging posts which are in the legislation for review.
But using primary legislation meant powers come into force sometime after they could have under the CCA. Did the government consider introducing short-term regulations under the CCA and then allowing Parliament more time to consider the primary legislation?
We did consider whether or not the CCA was appropriate. There is a risk, rule of law applies throughout, that actually using the CCA would have been and could have been challenged on the basis that its use was inappropriate in circumstances where some of the requirements for dealing with the coronavirus were foreseen in advance.
Let's intervene on that, Ronnie, forgive me.
Sure.
The Civil Contingencies Act exists for contingencies. If this isn't an occasion at which that would be necessary, when would be?
Well, the sorts of things that would be totally unexpected. For example, if the country were to face, and one wouldn't want to get into lurid speculation, a military attack, for example.
But the Civil Contingencies Act doesn't just exist for a preemptive nuclear strike on this country, does it?
No, but its powers, or the powers upon which it confers upon government, are sweeping, and it is specifically, and this was the clear advice specifically designed to be used when you have an unexpected bolt from the blue, rather than when you have something which is, as we saw, a developing threat. And the legislation was in place in order to ensure that the government was able to respond appropriately. We could have a discussion about whether or not the government has done everything right, but in terms of the legislative easements required, no one, to my knowledge, has said that there is anything that we should be doing which we don't have the legal power to do. So the Coronavirus Act was, I think, the legally appropriate thing to do. And the use of the Civil Contingencies Act, as I say, would have been open to challenge because it's not a bolt from the blue.
But it does cover epidemics, does it not?
It can be used in a variety of different areas, but it is the case that the specific requirements of the Civil Contingencies Act would have meant that if we'd used that, we would have been open to challenge.
So this epidemic wasn't quick enough. Is that basically what we're saying for why we didn't use that act?
No, I think it's the case that actually the Coronavirus Act has the legislative easements that you need to deal with the pandemic. The fact that we were able to bring it onto the statute book so quickly is because the Department of Health had used the evidence and the wisdom and the experience gleaned from thinking about pandemic threats in the past to have legislation which was prepared and which could be tweaked.
Would you be willing to share that legal advice, Mr. Gove, that determined the Coronavirus Act was necessary?
We never share legal advice.
Thank you. Mr. Cowan, sorry to interrupt you.
No, that's absolutely fine. I'm staggered to hear, actually, that this was not a bolt out of the blue. You know, given the speed which this virus has ripped through the United Kingdom, has killed over 20,000 people, we're saying we weren't surprised by this. If we weren't surprised by it, why were we not better prepared? My real concern here is that the scrutiny which the government does or does not allow itself to be put under in these times. The Civil Contingencies Act regulations have to be renewed every 30 days and can be annulled or amended through a resolution of the Commons and the Lords. The lockdown regulations were made under the Public Health Control of Disease Act 1984, which contains far less stringent scrutiny. And sure, you can understand why, at a time like this, people want to hold the government up to scrutiny.
I do, but I'm sorry that you were at variance with your colleagues in the Scottish Government, because the Coronavirus Act was agreed across all 4 nations, and the Scottish Government ministers, like Welsh Government ministers, thought it was the right thing to do. But of course, we're open to scrutiny at every point. If there's any example of either the UK government or any other government abusing its powers under this act, please do bring them to my attention. Otherwise, some people might think that this was a synthetic display of anger from someone who was at variance with politicians from their own party who actually exercised executive power.
Sorry, are you accusing me of a synthetic display of anger?
Some people.
Gentlemen, as chair, if I could intervene and insist that we'll have no synthetic displays of anger whatsoever, and only genuine ones, please. And on that note, perhaps, if Mr. Cowan, you finish, if I could ask Rachel Hopkins to join us.
Thank you, Chair. Mr. Gove, the National Risk Register should be produced by the Cabinet Office every 2 years. Where is the 2019 version, and how much variation was there from the 2017 version?
Well, the National Risk Register, you're right, is published as a result of the work that's undertaken by the Civil Contingencies Secretariat. In terms of variation between 2017 and 2019, I can't give you chapter and verse on that, but the National Risk Register, as I say, is a publicly available document which reflects the broader work that is done, which the Cabinet Office necessarily keeps confidential.
So is the 2019
I do beg your pardon, Rachel. I saw a copy of it in the Observer, Mr. Gove. Is that the public domain where this document is?
It was the case. I can't remember completely whether it was the Guardian or the Observer, but at the weekend, either one of them had details from a leaked document. Again, governments don't tend to comment on leaked documents, but one of the points there is that the National Risk Register is the public version of the sort of edited version of a broader document. That broader document is the government's own manual for dealing with a range of risks. By definition, you would quite rightly want to share with the public what some of the risks are that we are seeking to mitigate, but you wouldn't want to publish every aspect of your attempt to deal with risks, because there are bad actors out there, whether state actors or non-state actors, who, if you laid bare the nature of your resilience planning, might be able to exploit it to their own advantage.
Quite, Rachel, do forgive me for interrupting at this juncture, but Mr. Gove, where therefore is that executive summary that you allude to? I can't find it in the public domain.
That is the National Risk Register, which is shared in the public domain, yes.
Rachel?
Great, so it can be shared with us then. So reflecting on the risk register, and it was assessed that the risk of a flu pandemic to be the most likely, a most disruptive crisis facing the UK, but deemed the threat of other pandemics less serious. So how different has the response to COVID-19 needed to be from the planned response for a flu pandemic?
It's a very important point. There are significant areas of overlap. As we mentioned earlier, many of the items that we stockpiled in order to deal with any potential flu pandemic have been of critical use in dealing with the coronavirus pandemic, but the nature of the coronavirus is different from seasonal flu, and as a result, it's required, in some cases, additional elements of PPE. I mentioned briefly earlier that the government scientific advisory group NERVTAG has specified what those additional requirements would be, but many of the things that one would prepare for in a flu pandemic, for example, the legislation that we've just been discussing, and the plan to move non-essential cases out of hospitals in order to free up capacity, those would be the same whether it were a flu pandemic or obviously in response to the coronavirus pandemic. But because it's a new virus, we're learning, all of us in real time, about the specific symptoms and the specific responses required. And we're also learning that there are some treatments which work or might work against flu, which won't work against corona.
So reflecting on what you've just said, at what point did the government deviate away from a flu pandemic response?
Well, we responded on the basis of the scientific advice as we discovered more about the nature of this virus. So to go back to the example of NERVTAG, their advice, as they knew more about this particular disease, allowed us to refine the approach that we were taking towards advice on PPE, for example.
And the risk register emphasised the availability of PPE for first responders. But how is it not foreseen that in a global pandemic, global supplies of PPE would be in short supply?
Well, I think we had stocks for dealing with a pandemic, a flu pandemic, but the nature of this particular virus has meant that there's been a need for additional PPE that wouldn't necessarily have been the case in a standard flu pandemic. And you are right, there's been a global demand for it. One of the things that many of us will reflect on is whether or not the sources of supply for PPE are too concentrated in a geographically limited number of countries. And that is definitely a lesson to be learned.
Can I just have one more question on the risk register and how any embedded assessment of equalities was considered in the risk register? And I reflect on this pandemic having particular issues for older people, and as we're beginning to see people from BAME backgrounds?
Well, it is the case that all of the work of the government is done through the prism of equalities, and the Equalities Act places responsibilities on all ministers to think about those things. And you are right that there is emerging evidence that the virus has a particular impact on people from Black and minority ethnic backgrounds. We don't know what the full epidemiological lessons are to be learned, but the leading indicators are worrying in that area, and that's why the government has commissioned extra scientific work into this, and also asked Trevor Phillips to look at some of the questions that the emerging evidence raises.
So on the risk register that you say is published that we will be able to see, we will see explicit equalities impact assessment of some of those risks as well?
I think there's a difference between equalities impact assessments that are carried out before certain policies are instituted or before certain bills are introduced, and looking at things through an equality lens overall. But one of the things that we didn't know about the coronavirus and has only become apparent is, as I say, the evidence which you quite rightly alluded to about what appears to be its disproportionate impact on minority communities. But I just want to stress that while it is a worry and we are responding to it, it's difficult to make hard and fast conclusions about the nature of the variable impact of the virus, because we are still learning about it. We know that, for example, it tends to be more lethal amongst people who have certain comorbidities, and that tends to be, as you know, diabetes, heart disease, and so on. So it's looking at all of this evidence and seeing what the real risk factors are and which vulnerable communities are particularly in need of support.
Okay.
Thank you. Karen Smith, please.
Thank you. Did the Cabinet Office monitor whether various departments and agencies actually completed the mitigations in that risk register?
Well, it is the case that we do, depending on what the government department responsible, seek to ensure that government departments do have plans which are ready to deal with the threats that have been identified. So, for example, it is the case that BEIS develops plans if there is any interruption to the operation of the national grid, that DEFRA prepare plans in the event of either an animal disease outbreak that threatens the food supply, and so on. So it's the responsibility of government departments to do that. And one of the things that we seek to do is to make sure that those plans are as robust as possible and renewed or refreshed in the face of a different assessment of threats.
So you, as the Cabinet Office in your coordinating role, did assess if those departments had fulfilled those mitigations in their risk registers?
It is our responsibility to do that, yes.
Good. If I can just come back to the unexpected nature of this particular virus, I accept that we are learning all the time, but Public Health England, in its pandemic flu strategic framework in 2014, some 6 years ago now, had a key principle of firstly preparing for the worst. It also, in its planning assumptions, recognised that a novel virus would hit the UK very quickly and that a vaccine wouldn't be available for up to 6 months. So much of this has been known within the community for some time. This is not as unexpected, the way that this virus would react, as I think perhaps you are indicating. So what lessons have you been learning from those organisations, from the risk register over the last 5 years?
Well, I think I'd say two things. One of the things is that we identified learning, I hate that word, sorry, identified evidence from both how a SARS-style virus had operated, and also from what a global flu pandemic might do. And the evidence certainly from previous SARS outbreaks reflected the fact that the instance of them and the lethality of them in the UK and in Europe was less than a flu pandemic might be. That's on the basis of the evidence that we had. We're now revising that, of course, because of the nature of this outbreak. And as you quite rightly acknowledge, it's a novel virus that combines the lethality of, to a greater extent actually than before, of coronaviruses, and the ease of infection and spread of seasonal flu. So it poses a unique set of threats, and we are like everyone, seeking to find out which treatments might be appropriate in order to ensure that those who are infected don't develop the worst form of the disease. And also, as you say, seeking to develop a vaccine as well. And we're taking part in a global initiative.
But a novel virus has been long expected.
Well, one of the things that I would say is, if we look across the world, we find that every country has responded in different ways, but there's been an overlap, as I mentioned earlier, in their response. And every country, every scientist would say that it's vital to share that information and learning, but it wasn't the case that anyone anticipated precisely the type of virus that we face now.
No, but a novel virus was expected for some time.
It is the case that we have always been aware that there could be a particular threat of the kind that SARS posed, but on the evidence that we had at the time, we anticipated that it might operate in a different way.
Thank you.
Thank you. Mr. Gove, you're always very precise, and quite rightly so, in your use of language, in that you said that the Cabinet Office has the responsibility to check that different departments have robust plans for contingency. Did they do that?
I believe the Cabinet Office has. It may be that, for the sake of argument, that there is a particular threat in a particular government department where we have not been as assiduous as we might have been in assessing it. But with respect to flu, it was the case, following on from exercise Cygnus, that the National Security Council Subcommittee on Threats, Hazards and Resilience looked explicitly at the lessons to be learned and made recommendations to DHSC and other government departments about what was required. So, for the sake of argument, there might be an element of the risk register where the Cabinet Office will need to go back to the relevant department to make sure that its plans are absolutely as robust as they should be. But on all the evidence that I have of the work of the Civil Contingencies Secretariat, plans are robust and have been and are regularly reviewed.
Would you undertake to write to this committee to confirm or otherwise that in fact the Cabinet Office did undertake that responsibility properly?
Absolutely.
And you preempt me in my further question, which does regard exercise Cygnus, an exercise that is shrouded in mystery, it seems, only several references to it in local authority minutes and a board paper from NHS England. I presume that you have read the report issued following that exercise?
Yes.
So you can confirm it therefore exists?
Yes.
And would it be possible to put that in the public domain?
I don't think I can make that decision. I will talk to my colleagues. I think one of the things, again, that I would say is that the purpose of exercise Cygnus was to model a scenario for a flu pandemic. It was conducted in 2016 with a different Prime Minister. That Prime Minister then authorised, as I mentioned, the National Security Council to look at the work that was required. And it was because of that that we were able to introduce the coronavirus legislation, because of that we had a pandemic stockpile, because of that some other steps were taken by DHSC.
If not a full version, might you be able to provide a redacted version?
Let me consider that, yes. And I'd obviously want to share as much as possible with the committee. And it may well be the case that members of the committee could come into the Cabinet Office to read it, or that we could share a redacted version. I'll reflect with my colleagues on what is the right approach. One of the things, again, that you will know as a committee is that while ministers have wide discretion, I have to take account of precedent, and I'd have to ask the propriety and ethics team here in the Cabinet Office, because sometimes I'm anxious to share things, but the point is made to me that this is advice that has been offered in confidence by civil servants, and that we have to respect their duty of candour and the safe space in which advice is offered. So I'll talk to the propriety and ethics team, take their advice and write back with what I can and cannot share. But my general disposition is to share as much as possible.
When did you read it?
I read it last week.
Was it not given to you perhaps earlier on in your role? Might it not have been appropriate to receive it perhaps in January?
Some of the product that flowed from that report I had read beforehand, yes.
What aspects of the product, as you say?
The specific set of responses that had flowed from that, for example, the need for a particular set of specialist legislation, the approach that was taken by DHSC to deprioritising non-urgent operations in order to clear space, as it were. So it is the case that the Cabinet Office team run exercises all of the time, and those exercises then inform the threat assessment and the risk register that they draw up, and the work that is then done as a result. So the fact that that exercise had taken place helped us to shape and frame our response subsequently.
And in that helping to shape the response, what lessons did you and the Cabinet Office and other ministers learn from that exercise?
I think the first thing is that if it and this was a point that was made right at the very beginning, that unless you take rapid action at the right time, there is a risk of a virus, and in this case it was a flu virus, spreading at such a rate that the resources of the NHS can be overwhelmed. So the principal lessons were, A, make sure that you increase NHS capacity, particularly ICU capacity, by repurposing the way in which hospitals operate and by removing those patients who have non-urgent conditions, and also at the same time make sure that you have the legislative power or the appropriate support to bring in the social distancing and other lockdown measures required in order to stop the spread of infection. But one of the things I don't, sorry.
Thank you. What about the more practical aspects? Did the exercise reveal that there would be a lack of PPE across the health and care sector?
No, and this I think is an important point, that the exercise led to, inter alia, the development of a pandemic flu stockpile. What has caused a particular challenge is that the novel coronavirus, because it's novel, it's new, required a recalibration of our approach towards PPE, and that recalibration was recommended by NERVTAG, the scientific advisory body with particular expertise in respiratory diseases.
So in essence, you're saying that the planning for this eventuality was on the assumption that this novel coronavirus or any pandemic would be akin to an influenza pandemic, requiring a certain stock and quantity of PPE. Is that what you're saying?
Yes, because exercise Cygnus was specifically to model a response to influenza.
And was in the lessons learned, was it looking at a stockpile of actual gowns, gloves, whatever else in warehouses in this country, or was it over-reliant on securing quite complex supply chains?
It was based on making sure that we had a stockpile in this country. I should add that that stockpile was augmented as we were preparing for the potential of a no-deal Brexit outcome. But the broader point you make is one of the things that has been brought home to all of us, that when it comes to PPE, we have an over-reliance on a small group of nations to produce the bulk of the personal protective equipment required. And it's also the case that the material that is required for the best personal protective equipment, which is a byproduct of the petrochemical industry, again, the production of those raw materials tend to be concentrated in a relatively small number of countries as well.
So might not a lesson that could have been drawn from this exercise would be that those supply chains would have come under pressure and there would be an immediate need to ramp up domestic production to plug those gaps?
Well, it is the case, again, because it is a novel coronavirus, the change in the approach that we took to PPE was NERVTAG recommended, and the stockpile that we had was designed explicitly to deal with a flu pandemic. I think if you look across the globe, there is a recognition, not just with respect to PPE, but with respect to some other questions, that the future of domestic production may require greater resilience in national economies in a number of areas. There have been some people who've been warning that globalization has led to an over-concentration of production not just of PPE, but of other things in some countries. But the dominant economic discourse has tended to be, what's the word, skeptical about that. I think that that economic conversation, as you quite rightly point out, is changing.
Well, that's a rather long-term analysis. What about the here and now? What's being done in the here and now to ramp up domestic production?
Lord Dayton is leading a group within DHSC to increase domestic production of PPE. We've entered into contracts with a firm in Scotland that produces the material that is required. And what we're seeking to do is, first of all, to establish which particular sources of raw material we can access, and also, given that we have expertise in the petrochemical sector and indeed an oil and gas industry, how we can ensure that the appropriate fabric is comes on stream here. And we're also looking, as I say, Lord Dayton and Lord Agnew, at producing not just masks and gowns, but other material here in the UK. It is the case that there is some personal protection equipment whose production we've already ramped up. Not the most vital, but still vital. It is the case that distillers can produce hand sanitizer. And one of the strengths of the United Kingdom, of course, is that we've seen distilleries in Scotland change their production lines in order to produce some of the hand sanitizer that is so valuable.
Thank you, Lloyd Russell-Moyle.
Thank you very much, Mr. Gove. It's been reported that the government has received over 8,000 offers of supply for PPE. How many such offers did the government actually respond to positively in the end?
We've received 10,579 offers, and we're working through those now. Of those, there are, I think, 800 that are currently going through a process where we make sure that the offer is robust, because as you'll appreciate, as we just touched on, we want to make sure that the quality of the equipment is absolutely in line with the recommendations that Public Health England and others give in order to keep our frontline workers safe. One of the problems that we've had is that there are a number of people who've made offers, kind offers, well-intentioned offers of personal protective equipment, but they haven't been people who are capable of producing that equipment. So, for example, and I don't mean to be unfair to the people concerned, there was a company that was responsible for period costumes of the kind that dramas might require, that said, we'd love to help, and they got in touch. And again, we've had to say, well, very kind, thank you. We do appreciate that everyone wants to help our NHS at this time, but it's quite a specialised sector.
I mean, was there any attempt to triage some of those smaller offers, or offers that wouldn't maybe be at standard for the NHS, but they would be able to support some of the other caring sectors in different kinds of equipment, so to make sure that they weren't just rebuffed totally?
Yes, that's a very fair point. We have obviously prioritised those who've got the biggest sources of supply and who can help the NHS and social care first. But it is also the case that we're looking at other offers where we may be able to help other areas in the public sector, and indeed beyond that as well. So yes, a triage process precisely of the kind that you outline has been done.
There were reports in the press that a number of firms came to the government early on with offers to get supplies of European certificated PPE to the standard that we know, and the government didn't respond quickly enough, and those pieces of equipment have now been lost. Are you aware of instances where the government's, and I grant you that you're never going to pick up every single thing on time, but the government lost a number of big orders, or do you not recognise that those kinds of stories?
I don't think we have. I'm always looking at how our procurement operation works, and it may well be, as we comb through every example, that there will have been a significant and generous offer that we did not respond to sufficiently quickly. So I'm not denying that it's a possibility, but one of the challenges that we face is that This is a market where, as you'll appreciate, prices have gone up. Money can be made by middlemen. Often some of the people who've approached us saying, I can provide you with X or Y, are middlemen, and the ultimate source of supply is elsewhere or out of their hands. So sometimes we find that there are people who are attempting to play different markets off one against the other, and sometimes they just don't have access to it themselves. They're operating on the fly, as it were.
Yes. So, I mean, in yesterday's Daily Mail, not a newspaper that I would normally read because I find it rather revolting, but on this instance, doing something very positive, airlifting £1 million worth of PPE from China and other places to Britain. And they say they're going to do a number of those airlifts with their charity. Why is the Daily Mail able to secure £1 million worth of pieces of protective equipment? And we hear about other organisations, Liverpool, local authority, etc. But the government is saying that they are not able to secure that. And we saw over the weekend but gone, where we were waiting on this shipment from Turkey. How come private organisations are able to do it and we're not? Is there something that I'm missing here?
No, I think your question is a very fair one. The effort by the Daily Mail is wholly welcome, and I applaud it. They've done it in combination with business people, including the chief executive of Marshall Wace, Ian Wace, who is a distinguished philanthropist, and a colleague of a friend of mine, Sir Paul Marshall. It's really welcome that they've done that. However, it is the case that the amount of PPE that the UK has secured in China through the government dwarfs that of private philanthropists. And it is also the case that, without wanting to cast aspersions on anyone, that the market for PPE in China is not a completely transparent and free market as some others are. There is always, when you have transactions in China, the knowledge that the state there can intervene in particular ways.
I would be interested to know what the level of utilisation of the private sector and charitable sector has been in providing both ventilators and PPE, and what the Cabinet Office is doing to coordinate that. I mean, that's just one example, but what's the Cabinet Office doing to make sure that it is done in a holistic way, so we don't end up having the British government in a bidding war against the Daily Mail, in the bidding war against another charity, and we end up all losing out?
Well, it's a very good challenge. We have sent the Crown Commercial Service team to the Department of Health and Social Care, who are helping them to source the material required. It is the case that for a lot of PPE, China is the ultimate destination, and we have been working using our diplomatic posts and the ambassador in Beijing in order to make sure that we coordinate our sourcing effectively. But it is the case that there will be actors and players in China and in other countries who will, seek to pursue their own ends. But we do seek to coordinate that. With respect to ventilators, again, we've worked with the Department of Health and Social Care both to make sure that we are deconflicting any competing calls for ventilators, and also, of course, we've increased the capacity to produce ventilators at home. But it is a global race to secure this material. You will have seen, and no criticism of any other government, German doctors posing without clothing in order to draw attention to the lack of PPE there. It's been an issue in America and in France. I'm not trying to shuffle off responsibility by suggesting that we as a government shouldn't be doing everything we can to make the supply chain coherent and responsive. It's just to put into context the challenge that we face.
Do you think it helps to count individual gloves as separate items and individual masks even as all, to make the figures look like we are importing large numbers, which is what was reported in the Panorama and other stories? Or does that reduce public trust in thinking that our government is got a handle on this?
Again, I think that's a fair challenge. I wasn't aware beforehand, but it is the case, and I was told that in the NHS that you sometimes get gloves in different sizes and different consignments. Sometimes for certain procedures and processes, you don't just need a pair of gloves, you need 4 gloves. So therefore, the number has to be precise. And I know that at first blush, you'd think, well, you know, gloves should be counted in pairs, but that is apparently the way in which it operates. The truth is that whatever method of accounting for the delivery of products we use is perfectly open to people to criticize that and to say you shouldn't be lumping these things together.
Would it be a fairer way to accord this in terms of how many days supply we have managed to acquire? So, you know, you're quite right that sometimes it requires 4 gloves, sometimes you change the apron every person, sometimes, but we know roughly what an amount of supply will last now. Would it be now better going forward to say we have secured in this shipment X numbers of days supplies for the system, rather than talking about the number of items, which, unless you are an expert in this, is probably pretty meaningless?
I do take your point. I think it is certainly worth reflecting on. One of the things that I would say is that, and I think I mentioned this briefly earlier, and I think you acknowledged it as well, that the burn rate, to use the technical term, of PPE has been greater than we'd originally anticipated. So it might be the case that we would say, on the basis of what we might have thought at the beginning or what we know now, that we have 4 days, 5 days, or 3 weeks supply of a particular item, and then we find that the as I say, the burn rate is greater, and people say, well, you told us you had 5 weeks supply, and in fact it's been up in 4 weeks. You were misleading us. And what we would not have been trying to do was to mislead, but simply adjusting to changing criteria. But I do think that your broad point, if I may, which is a greater degree of transparency on PPE sourcing and supply overall helps build confidence, is fair.
The Clipper service is meant to be rolled out. It has been delayed 3 times now, which is the service to augment some of the centralised NHS purchasing. It's of course run by Clipper Logistics. Most local authorities have now been told it will be another 2 to 4 weeks before that service is up and running. My local authority now tell me that they've given up on it ever being able to deliver. Has this been a failure in government to make sure a private service provider is actually meeting the local need?
It is something that I've been asking about during the course of today, and I want to be able to give an entirely accurate picture to this committee and to others. So what I will do is report back on, because I know that anxieties have been expressed, what the precise state of the Clipper service is.
Yeah, because if people are just working around it, we get to a stage where it might be easier to scrap the logistic part of the Clipper service and just incorporate those supply lines into the supply lines now that have been established. You know, a change in 4 weeks' time might now be more disruptive. I wanted to move on to the strategy from the outset, because did the government, do you think, have a clear strategy from the outset with dealing with coronavirus?
Yes.
So the government strategy moved from mitigating the virus to very much strongly suppressing the virus. When and why was this decision taken?
It was taken on the basis of the scientific advice from the Scientific Advisory Group on Emergencies. Again, one of the points that scientific advisors have made is that if you want lockdown measures to succeed, you need to introduce them at the right point. Again, I think it's perfectly legitimate for people to say perhaps they should have been introduced earlier or not. There are some, looking at Sweden, who say, actually, we've introduced measures that are too restrictive. I personally think it's too soon in our response to come to a definitive view, but I'm sure that in the future, people will be able to look back and make a judgment about what we or other countries did or did not get right at the right time. But the overall advice was from SAGE's experts.
And the makeup of that committee is publicly known?
Well, there are some people who have identified themselves as members of the committee. Obviously, the chief scientific advisor is, There are other people who are on the committee who have the right to anonymity. One of the reasons for that is that there have been, unfortunately, one or two threats issued to members of the committee. So again, that's one of the reasons why their identity has been protected. But I know that one of the discussions that's ongoing is the extent to which people who are on the committee can identify themselves. In the past as well, there's also been an issue with potentially some people being placed under pressure by lobbyists from sectional interests who are seeking to persuade scientific advisors to take a particular view. We wanted to make sure that they had a totally safe space in which they could have very robust discussion. And it was felt that that was best served by protecting the identities of the majority of members. But it is something that's kept under review.
This isn't one of those committees where political advisors maybe go and give their view as well. They're all, I mean, can you give assurances that they're all qualified scientists, medical scientists and statisticians?
Yep. There was reporting earlier this week that two people from Number 10, one of whom, of course, is the Prime Minister's advisor, Dominic Cummings, attended meetings. But that is something that I would expect in the same way as when I was as Secretary of State at the Department for the Environment, I might ask the chief vet or the chief scientist in that department for their assessment of, say, the science behind the badger cull. And it was always the case that I would try to ask what I thought were appropriate questions, but I would never try to second guess the scientific expertise of the chief vet or our chief scientist. And in the same way,
is there not a problem in terms of public trust? If we don't know who's on this committee, but we do know that political advisors are going along, and of course, political advisors also helping frame the discussion. I grant you that they're saying these are the political realities. What's your advice on this? But then, very often in answers that you've given today, that the government gives generally, they say, "Well, we've just followed the scientific advice," whereas in those discussions, of course, there has been a large sprinkling of political directions.
I think if it had been the case that there had been any improper attempt to influence, then it would have been the case, certainly, that someone of the integrity of the government's chief scientific advisor would have said, "Hold your horses there, mate. That is just not appropriate." There hasn't been any evidence of that. Indeed, I think one member of SAGE, who's publicly identified, Professor Neil Ferguson from Imperial, made the point that there was nothing improper in the questions that were being asked. I think it would be the case, for the sake of argument, again, to go back, if I had said to the chief vet or to the DEFRA chief scientific advisor, "Oh, go on, relax the rules on this, can't we fudge the figures and so on," they would have blown the whistle. And I think the same thing would have applied with SAGE as well.
Sorry, gentlemen, I must move on.
Can I just ask the last herd immunity question on a brief, Mr. Ragg?
Yes, you can.
Perfect. Look, herd immunity was discussed at one point, and then it seemed to be off the table at another point. Was herd immunity ever discussed with government in response to part of the strategy or not?
It was never government policy. It is a term that epidemiologists and others use to describe a particular stage in the development of a disease if a particular set of principles are followed, but it's not government policy.
The British Society of Immunology says that there is no evidence that this disease might have long-term immunity. So why were we even talking about it in a scientific way? Does that not provide confusion for the public?
No, I don't think so, because the principle, I mean, we're all, or many of us are coming to terms with scientific debates and arguments which we weren't closely involved in before. And sometimes some of those terms can seem taken out of context, slightly worrying. And I can completely understand the public feeling on this. But it is a well understood term that epidemiologists use. Whether or not you can develop the type of collective immunity to this disease that you can to others, that is a scientific question that I'm not competent to answer.
Thank you. Thank you, Mr. Over to Mr. Ragg.
Thank you. David Mundell, please.
Thank you, Chairman. Can I ask about issues to do with data and international comparators, Michael? Earlier this month, the BBC quoted charities suggesting that elderly people were being airbrushed out of coronavirus death figures. What's your response to that assertion?
No, I wouldn't say that. I think one of the many tragic aspects of this virus is that all the evidence shows so far that it has a disproportionate impact on our older friends and neighbours, and there are a number of comorbidities, but certainly age is a clear factor, and that is particularly distressing. We have an approach which involves us collecting data from hospitals and then from care homes and other settings. There are slightly different collection mechanisms. That's because of the way in which NHS trusts can report death figures on a daily basis, even if the death might have occurred a day or two beforehand, whereas the approach that's taken to reporting deaths more widely relies on people registering the death, a process that people have up to 5 days to do, and then making sure that those figures are statistically accurate. And I think Sir Ian Diamond, the national statistician, has written to the committee explaining the approach that's taken. There's always a balance between having data that is timely and data that is accurate. The more that you have a chance to kick the tires, the more you can be certain that it is robust. And data serves two purposes. If you look at, for example, the rate of infection, you can begin to form a judgment about how effective your measures have been in mitigating that process. But it's also the case that people want to know, for entirely understandable reasons, what is going on in this country. And because the data in NHS settings comes quicker, some people have said that's because the government is prioritising that information over others and treating individuals in care homes with less sensitivity and acuity. I understand that debate, but one of the things that we all appreciate with data and information is that there has to be proper oversight in order to ensure that it's robust, and that's what the Office of National Statistics provides.
And how does that work with the devolved administrations and the figures that they're reporting, so that you can give a UK-wide figure? Because there are variations, are there not, in how these registrations are carried out in Scotland, Wales, and Northern Ireland. And it's these figures are very important. You may not be aware. I mean, in Scotland, it was announced today that in the period 20th to 26th of April, half of all deaths related to coronavirus occurred in care homes. I mean, that's a very, to me, that's a very significant statistic, which doesn't necessarily come out in the 5 o'clock briefing. It does in the Scottish one, but it doesn't in the 5 o'clock briefing. And that's a very relevant issue in a UK context as well.
Yes, I think you're right. I think that we have to respect the different ways in which the devolved NHS in Scotland and Wales and Northern Ireland operate. But one of the most important things from data is to make sure that you are within a particular country, within a particular sector, comparing like with like on a day-by-day or a week-by-week basis. Because in one of the most important, but there are many, many uses to which data can be put, one of the most important uses is seeing what the trend over time might be, so that we can have confidence that the steps that we're taking are having the desired effect. But you make a very, very fair point about some of the challenges of accepting the nature of the devolved settlement.
But it's also the challenge of being able to understand the balance of the issues between care in the community, care homes, and hospitalisation, because I don't think it has been clear at some points in dealing with the coronavirus that hospitals were only part of the picture.
I do take your point, again, decisions about who should or should not be hospitalised are based, of course, on the clinical advice, the aim is always to ensure that those with serious conditions and who face a threat to their life are in hospital. But you are right that as we look at the figures overall, we also have brought home to us the particularly lethal and vicious nature of this virus, and it reminds us of the vital importance of making sure that we support those who work in care settings.
And what responsibility do you see that the government has to ensure that ONS statistics are reported as widely as those that are used in the daily press conference, which I think you said earlier are just a selection of the statistics that you have available to you?
Well, again, my own view is that there is, as you quite rightly point out, a sensitivity towards the use of statistics, that there can be, or there might be, criticism of any government that chose to change its methodology midstream. Is it the case that we're attempting to change a methodology in order to achieve a particular outcome? So my starting point would be, this is the method that the Office of National Statistics is confident in. Let's keep that. We might want to review it later. But it is also the case, I know, that there's been a widespread feeling actually to change the nature of the statistics, how they're reported and so on. We are absolutely open-minded about that. But as I say, one of the reasons why they have been recorded in this way is I'm very sensitive to the fact that we would not want to be seen to be moving from apples to pears without people understanding, agreeing and requiring that that be necessary.
Yes, but I mean, obviously, as you accept the fact that, for example, here in Scotland, and which may be reflected in other parts of the UK, if half the people who are dying in care homes, then that does impact on the approach, surely, to the management of the disease, and is something that needs to be both in the government and public mind.
I agree.
Can I just ask you finally in this section about international comparators and how they are firstly presented, because again, following the graphs on the 5 o'clock briefing, you see a very low number of deaths, for example, in Germany, to which usually the standard answer is, well, they measure these things differently. And what is the context in the way in which these international comparisons are presented?
Well, I think it's a very fair point. I think the best way of doing so is to do it as a per capita figure, so that we, obviously the nation with the largest number of cases, the United States, is also one of the most populous nations in the world. So the overall figure doesn't tell you as much about the spread of the disease as a per capita figure might. I think that's the first thing to say. And then the second thing to say is that different countries do use different methodologies. And there are some countries where I'm sure, I won't name them, but there are, I'm sure, 1 or 2 countries where I'm sure there is some misreporting going on. But the really, I think, powerful evidence is of trend lines, and whether or not, as we've often discussed, curves are being flattened overall. That I think is the single most important takeaway. But I'm not an expert statistician, but people like Sir Ian Diamond and David Spiegelhalter, I'm sure, would be able to provide an additional explanation of the divergence in the way in which these things are recorded. And of course, they can offer the government advice on how we can do even better.
Thank you. Briefly, Karen Smith, to be followed by Tom Randall.
Thank you, Chair. Mr. Gove, you talked earlier about one United Kingdom response, but possibly small island, separate responses. Northern Ireland, of course, is part of the island of Ireland. Will you be discussing with the Irish government coming out of lockdown and how they're going to approach it? Whether there'll be a consistent approach across the island of Ireland?
I already have. I had a conversation last week with Simon Coveney, and Simon is also regularly in touch with Brandon Lewis, and of course with parties on the ground in Northern Ireland. Again, the substance of the conversation, as you'd expect, was about the interconnection of our economies and our peoples, and making sure that we kept each other as informed and involved as possible.
Thank you.
Thank you. Tom Randall.
Thank you, Chair. Mr. Gove, I was wondering if I could ask you some questions about the reviews that have to happen under the coronavirus legislation. And the first one, in Section 97 of the Coronavirus Act, requires a 2-monthly report on the provisions in Part 1 of that Act. And that report is, the first one is due in a few weeks' time. Could you tell us who will lay that report and what Parliament should expect from it?
It will be laid, I believe, by the Department of Health and Social Care. And I will check in with Matt and the ministerial team there to give this committee an understanding of what that would involve.
Do you know what criteria the government will use to assess the appropriateness of the status of provisions as the Act requires?
I think one of the things that we will be looking at in particular, as the First Secretary of State laid out in his 5 tests, is the extent to which we've been able to reduce the reinfection rate for the virus, the so-called R number. That will be a critical determinant. And related to that is the extent to which the scientific community and others believe that the social distancing measures that we put in place have succeeded in achieving that goal.
And looking at the Health Protection Coronavirus Restrictions Regulations 2020, these are the so-called lockdown restrictions. They require review every 21 days. What role do you and the Cabinet Office play in that review?
The Cabinet Office, on the one hand, will convene and prepare the documents for the Cabinet meeting that will sign it off, and also for the COBRA meeting that will involve the devolved administrations in doing so. But the principal judgment on this will be the scientific judgment of SAGE. Obviously, it's ministers who will decide, but one of the things that we do is we make sure that SAGE are commissioned in order to make recommendations about whether or not restrictions should be eased or lifted.
And will that review involve the 5 tests that have been set out by the government?
Yes, exactly so.
Thank you. And under the Coronavirus Act, there's due to be a debate in the House of Commons every 6 months on whether relevant temporary provisions in the Act should expire. Will you commit to publishing an analysis of those temporary provisions and whether they remain necessary in good time to help inform the debate in the House?
Yes, that's a good practice, and anything else I think would be disrespectful to members.
Thank you very much.
Thank you, Tom. Jackie Doyle-Price, please.
Thank you, Chair. Could I ask about moving out of lockdown, which is obviously what we're all anxious to do as soon as possible? When will the government be able to give more clarity about how and when that will come to pass?
I think in the run-up to the review date that we've just been discussing, in the run-up to May the 11th, we will be saying more about our thinking on it. One of the things, again, I don't want to criticise other governments, but one of the things that has been a challenge for France is that the president laid out a date, as it were, May the 11th as well, and then since then, the French government have come under attack for some of the things that they've said, because it's been felt that they have, by political opponents, that they haven't been thought through. The other thing in Germany is that Chancellor Merkel was on the verge of easing some restrictions, but then the way in which different regional governments responded meant that she felt, she pressed the pause button, as it were. So there's a balance to be struck between reassuring people lots of work is going on and not sending the wrong sorts of signals. But I think that most people understand that the sorts of things that any government would be thinking about would be how you can get more people back to work by having the right sorts of social distancing measures in the workplace. That people would be thinking about when and how it might be appropriate for people to return to work in schools and in childcare settings, and that it would also be the case that people would be thinking about what additional PPE might be required by people in the workplace, particularly in the public sector.
Okay, so and we discussed earlier about whether there ought to be a regional phased approach, and you make very clear that obviously people don't necessarily recognise borders in the way that perhaps we do as government. But in terms of a phased approach, can you see perhaps a more sector-based one? I mean, obviously we've got different sectors of the economy that are impacted more differently, and also where it becomes easier to implement social distancing.
Yes, I think you're absolutely right. One thing we know is that the disease spreads more easily indoors. So work out of doors. I mean, we're already obviously encouraging people to support the agriculture sector, but whether that's construction or indeed, as a number of people have outlined, sales from garden centres, it might be possible to take a differentiated approach in that way. Again, I don't want to preempt the judgment that has to be made across government. You know, the Prime Minister's got to sign off on this, Cabinet's got to agree, but these are the sorts of common sense conversations that people are having in public. So I hope I'm not jumping the gun.
Yeah, I mean, I guess it's the importance of rolling the pitch whilst managing people's expectations and taking them with you is quite a difficult act to manage when it comes to messaging to the public. But I guess one of the things about public confidence is the whole issue of PPE, because, you know, there's a good chunk of the population that want to get out of this quickly and think, actually, you know, this is all being a bit too you know, difficult. There's also a big chunk of people who are frightened to death of coming out of lockdown too quickly. And I guess one of the things that will assure that group of people is access to PPE. Now, to what extent is that going to be a challenge in terms of moving out of lockdown?
It is something that we're giving a lot of thought to, and PPE will be necessary in some settings, not in others. And we touched on the whole face mask, face covering issue earlier. I think, again, you know, government sometimes criticised for saying we're being guided by the science, and ultimately the buck stops with ministers. But I think people are more reassured if they see scientists and medics saying, you do need this in this setting, you don't in this setting. And that's why SAGE has been so rigorous in looking at the whole question of masks and face coverings, because it doesn't want to give people either false comfort or require equipment that isn't necessary. But you are right. I think, you know, the British public have responded very well because the guidance has been pretty clear, and there's a responsibility on government to try to keep it clear.
And what about the supply of tests, and to what extent the availability of tests is going to inform coming out of lockdown?
Well, testing is particularly important when it comes to coming out of lockdown, because we want to have contact tracing once we've reduced the reinfection rate to the lowest possible level, and we need to have sufficient testing capacity to do that. One thing I think, it's personal view, is that Matt Hancock has done an amazing job in dramatically increasing, exponentially increasing the amount of tests and testing capacity just over the last week. But of course, it is the case that into next month, we'll be thinking about how we can increase testing even further and build up the capacity that we've already secured.
So testing, the availability of tests is going to have a big impact on when we can come out of that lockdown.
It is a factor, yes, yeah.
Yeah. Two very quick questions before other people can wind up at the end. Could you write to this committee before the end of the current 21-day lockdown period with more information about how the 5 tests will be measured and the progress to them?
I'll do my very best.
Very good. And finally, obviously we do need to sort of make a balanced judgment about public health, but also to what extent we protect the economy. And notwithstanding the very decisive measures made by the Chancellor, the longer the lockdown progresses, the more difficult it is for some businesses to come out of this. So how is the balance being managed within government in terms of how we're making those judgments?
Well, you're absolutely right. It is very finely balanced. We're putting the health of the country first, but it is, of course, the case that if the economy suffers scarring, then our capacity to fund the NHS and also if the lockdown unmitigated goes on for some time, the impact on other conditions, people's mental health and so on, does have a bearing on the health of the nation overall. So the prism through which we're looking at things is health overall, but of course the economy isn't, as you quite rightly point out, something abstract. The economy, prosperity, affects well-being and healthiness overall. So we're balancing those factors, but health comes first.
Okay, thank you, Chairman.
Thank you, Jackie. David Jones.
Just on that last point, Michael, it's been reported this morning that the 5th of the 5 tests has been diluted. The wording of the test was confidence that any adjustments to the current measures would not risk a second peak of infections. That's now been changed to confidence that any adjustments to the current measures would not risk a second peak of infections that overwhelms the NHS. Of course, a second peak of infections inevitably means a second peak of deaths. Is it the case that the government is now moving towards giving more weight to the economy than to issues such as the increase of infections?
No, I can understand the people questioning, but I think it's more by way of elucidation and clarification than anything else. The point always, right from the beginning, was to ensure that we could, as the Prime Minister said, squash the sombrero, flatten the curve, in order to prevent the NHS being overwhelmed. And so what we want to do is to make sure that there is no sombrero peak again, because we want to ensure that the NHS is not overwhelmed. It is there for everyone who needs it.
But the wording previously did tend to indicate that a second peak of infections was to be avoided at all costs. The implication is now that a second peak of infections will be tolerated, provided the NHS is not overwhelmed.
Well, again, it's a very fair challenge. I wouldn't want people to overinterpret that change. I think it's an elucidation or a clarification rather than an alteration.
So your position is completely unchanged from the original wording in essence?
In essence, yes.
Thank you. John Stevenson.
Thank you, Michael. Businesses also need to plan ahead. If they're going to get their products in the right place, involve the supply chain, contact their staff, bring them all back. So they need to plan. So they need some advance warning from the government as to when the lockdown is going to change and whether they can get back into business. They clearly also want a degree of certainty that it's not going to be a stop-start scenario. So they do have an ability to plan accordingly. Would you accept that? Would you also make sure that that is part of the government's planning? And is that something the government will do?
I completely agree. I think that's spot on. The business department are talking to employers and trade unions with precisely those concerns in mind. And again, the point about stop-start is something that the First Secretary of State and the Prime Minister have made clear, and it follows on from David's question as well, that we don't want to have a situation where the rate of reinfection reaches such a point that you have to slam on the brakes again.
Thank you.
Thank you. David Mundell.
Following up from my previous questions about the engagement with the devolved administrations, is your anticipation that there'll be a four-nation announcement in relation to the lockdown and next stage, and that everyone will have come together with an agreed announcement rather than having separate announcements on different timescales? How do you envisage the managing of this piece of the intergovernmental working?
That's what I'd like to see. And before the last renewal of these measures, I talked to the First Ministers of all of the devolved administrations and the Deputy First Minister of the Northern Ireland Executive, as well as it happens with the Mayor of London, in order to make sure that we all had a shared understanding and a shared approach. And whether or not it's me or another minister who does that, we will want to do exactly the same. We'll want to be as coordinated and uniform as possible.
Thank you, David. Karen Smith.
My question is about nerve tag, but on that issue, again, the going into lockdown was really problematic for people in Northern Ireland and obviously caused some controversy. So I think it is important the government recognises coming out or moving through and announcing about what happens in Britain, also looks at what happens on the island of Ireland in both the United Kingdom and the Republic. My question is about nerve tag. In June last year, the minutes of nerve tag recommended that the gowns that needed to be purchased would fully meet infection control guidance and be body fluid repellent as a minimum standard. Can you confirm that those recommendations were achieved and implemented?
I'll have to go back and look at both the nerve tag minutes and also the DHSC procurement thereafter.
Be grateful, so you could come back to us on that.
Of course.
Thank you very much.
Thank you, Karen. And on that, Mr. Gove, there are a number of things that you've undertaken to write to the committee about, and I think if you can bear in mind that important point from Karen Smith, we'd be very grateful. Can I thank you for your time this afternoon in attending the committee in a virtual capacity? Can I also thank all members, and particularly the staff who have facilitated this meeting? It is much appreciated. Order, order.
Public administration and